Mic test. Mic test. Okay.
May we request the DOH officials to please take your seats? Thank you.
All right. This budget hearing is hereby resumed. Committee Secretary, please acknowledge the resource persons and guests present from the Department of Health, including its attached agencies and corporations.
Thank you, Madam Chair. May we request the DOH family to please acknowledge when your name is mentioned. Thank you.
For today's budget hearing, the House Committee on Appropriations would like to acknowledge the presence of our guests and resource persons from the Department of Health. Secretary Dr. Teodora Herbosa, OIC Undersecretary Dr. Gloria Balboa,
Here.
Undersecretary Dr. Maria Rosario Singh Vergere, Undersecretary Dr. Lilibet David, Undersecretary Ms. Maria Carolina Vidal Taño, Undersecretary Dr. Abdullah Dumama Jr., Undersecretary Dr. Kenneth Ronquillo, Undersecretary Dr. Nestor Santiago, Undersecretary Dr. Maria Francia Michano Laksamana, Undersecretary Dr. Enrique Tayag, Assistant Secretary Attorney Charade Mercado Grande, Assistant Secretary Ms. Maylene Beltran, Assistant Secretary Dr. Beverly Lorraine Ho, Assistant Secretary Dr. Leonita Gorgolon, Director General of Food and Drug Administration Dr. Samuel Zacate, President and Chief Executive Officer of PhilHealth Mr. Emmanuel Ledesma Jr., Executive Vice President and Chief Operating Officer from PhilHealth Mr. Eli Dino Santos, Director General of Philippine Institute of Traditional and Alternative Healthcare, Dr. Annabel de Guzman. Executive Director from Lung Center of the Philippines, Dr. Vincent Balanag. Executive Director of National Kidney and Transplant Institute, Dr. Rosemary Rosetta Liquete. Executive Director from Philippine Heart Center, Dr. Joel Abanilla. Executive Director from the Philippine Children Medical Center, Dr. Sonia Gonzalez. Yes. At this juncture, we would like to acknowledge as well the presence of the House officials and members in this budget hearing today of the OH. Deputy Majority Leader Julian Jambaronda, Deputy Majority Leader Janet Garin, Deputy Majority Leader Wilter Palma, Deputy Majority Leader Jose Bong Teves Jr., Deputy Minority Leader Franz Castro, Senior Vice Chair Stella Luz Kimbo, Vice Chair Jose Alvarez, Vice Chair Maria Rachel Arenas, Vice Chair Ching Bernos, Vice Chair Angelica Natasha Co, Vice Chair Ian Paul D, Vice Chair Teodorico Haresco Jr., Vice Chair Jocelyn Lim Kai Chong, Vice Chair Roy Loyola, Representative Yaser Alonto Balindong, Representative Arlene Brosas, Representative Edgar Chato, Representative Jaime R. Fresnedi, Representative Edwin Guardiola, Representative Mark Go, Representative Anthony Rolando Goles Jr., Representative Wilbert Lee, Representative Jervil Jinky Beatrix Luistro, Representative Allen Jesse Mangawag, Representative Salvador Plato, Representative Ray Reyes, Representative Siriaco Gato Jr., Representative Raul Daniel Manuel, Representative Rodante Marcoleta, Representative Ron Salo. Assistant Minority Leader Marisa Magsino, Representative Peter Miguel, and Representative Strelia. That's all.
Magandang umaga po sa lahat, and welcome to the House of Representatives. I believe that this is your first appearance as Secretary of Health, Dr. Herbosa. Tama po ba?
Yes, Madam Chair, Your Honor. First
Yes,
appearance.
and also the first time for President Mandy Ledesma.
Yes po. That's why I've been praying po since last night.
All right, so welcome po.
Good to see you po. Good morning po.
Okay, so on behalf of our Appropriations Chair, the Honorable Elizalde, I wish to give a short opening statement. Our healthcare system affects every individual, every family, and every community in this country. Because health is the most invaluable asset we possess, and it is our collective responsibility to ensure that everyone has access to high-quality healthcare services. While we have made significant strides in recent years, it is undeniable that our healthcare system faces numerous challenges. Limited access to healthcare facilities, an overwhelming burden on public hospitals, and disparities in healthcare delivery are just a few of the issues plaguing our system. The COVID-19 pandemic has further highlighted these weaknesses, underscoring the urgency for change and overhauling the healthcare system. In the Department of Health's proposed budget of 306.1 billion pesos for fiscal year 2024, the government will continue to prioritize improving our healthcare systems, promoting inclusive and affordable healthcare, and ensuring reliable health services. The budget includes funding for the Philippine Health Insurance Corporation, assuring our commitment to making health services available and affordable to the people, especially the marginalized. It might be good to note that very recent data from the National Demographic and Health Survey shows that in 2022, PhilHealth covered 37% or supported 37% of the average medical cost, which is down from 45% in 2017. This decline is even more pronounced in public hospitals, where the share paid by PhilHealth decreased from 71% in 2017 to 62% in 2022. So, improving PhilHealth's operations and ensuring its financial sustainability are imperative for the broader goal of universal health coverage. So meanwhile, the government will continue to provide funds for the Medical Assistance to Indigent Program, or the MAIP, for the hospitalization and assistance of indigent and financially incapacitated patients. The Health Facilities Enhancement Program, or HFAP, for the construction, rehabilitation, and upgrading of health facilities, Family Health Immunization, Nutrition, and Responsible Parenting Program, and payment for public health emergency benefits and allowances for healthcare and non-healthcare workers. We must also acknowledge the need for continued investment in our healthcare system. Our hospitals, clinics, and healthcare facilities require adequate resources, modern technology, and well-trained staff to function at their best. Let us ensure that everyone, regardless of their background or circumstances, can access the care they need through this budget. So to the DOH, we in Congress are one with you in building a government healthcare system that is a source of pride for our nation. A system that ensures every Filipino can access quality healthcare services when they need them the most. These are the imperatives, and the time for action is now. So the lead sponsor for your budget is yours truly, and the co-sponsors are the Honorable Vice Chair Lucille Nava, the Honorable Maria Rachel Aranas, Maria Angelica Natasha Co, the Honorable Janet Garin, the Honorable Roy Loyola, the Honorable Jose Alvarez, and the Honorable Teodorico Haresco Jr. So at this point, if any of the sponsors would like to give a sponsorship statement, please, you're welcome to do so. The Honorable Garin.
Thank you, Madam Chair. Today we gather here with unwavering solidarity, extending our support to the Department of Health's budget for the year 2024. I actually come before you with a deep sense of personal connection to this department, having been a dedicated member of the institution for a few years. Our presence here signifies our commitment to meticulously examine and evaluate the budget, not as mere critics, but as steadfast allies determined to assist the agency in accomplishing its fundamental mission and mandate. Medyo nakakaiba po, Madam Chairman, distinguished colleagues, kasi dati ako ay nasa other side of the fence. Now I'm at the other side of the fence, and what does that mean? It simply means that we are now tasked with making the mandate of DOH more effective, not to mention the fact that every peso and every centavo allocated from the taxpayers' money goes to actual services. Ang kagawaran ng kalusugan ay may pangunahing papel sa pagtitiyak na mayroong akses sa mataas na kalidad ng serbisyong pangkalusugan ang bawat Pilipino. Very important with this, Madam Chair, distinguished colleagues, is that hindi tumatagal ang paggastos ng pondo, because for every delay that the department incurs, it actually transcends to services also delayed. Andun po yung ating panawagan na huwag sayangin ang pera ng gobyerno. We have to limit unnecessary expenses, exorbitant consultants, and we have to spend on what is need rather than what we want. Una at pangunahin ang patuloy na hamon sa kalusugan kasama na ang COVID-19 at ilang pang infectious diseases dahil ito ay kaakibat ng climate change. May pangangailangan para sa isang malakas at mabilisang pagtuguan sa sistema ng kalusugan. Investing in DOH is actually investing in our people. It will enhance our preparedness for possible public health emergencies and ensure that our country have the resources needed. Ikalawa, kinakailangan nating isipin na ang kalusugan ay hindi lamang tungkol sa paggamot ng mga sakit. While PhilHealth is there to act on curative care, the DOH is actually tasked to really implement preventive and promotive health care. Kaya kailangan po talaga sa pamamagitan ng pagtitiyak na kinakailangan mga pondo para sa kagawaran ng kalusugan, maaari nating palawakin at mapabuti ang mga programang pangkalusugan ng publiko tulad ng pagbabakuna at iba pang mahalagang programa para makamit ang isang malusog at productive na mamamayan. I would also like to call on the department not to duplicate functions with its attached agencies. Mahaba pang araw, madami pang issues na tatalakayin, napakahaba po ng lista nung tayo dumating. We look forward to a productive discussion about the budget, aiming to ensure the successful implementation of your programs, making every cent count. To the DOH family, welcome to the House of the People.
Right, salamat, the Honorable Garin. Any other sponsor who wishes to give a statement? The Honorable Alvarez, you're recognized.
The province of Palawan fully supports the budget request of DOH. Thank you.
Ang lakas naman ng DOH kay Kong, hindi pa nag-represent, fully support na kaagad. Ayan. Okay, so... Okay, dahil napakahaba po ng listahan, at this point, Secretary Ted Herbosa, you may now proceed with your presentation. Try to keep it as short as possible, so 15 minutes, sir.
Thank you, Honorable. Good morning, Honorable Representative Stella Luz Kimbo, and to the honorable members of the Committee on Appropriations present in today's budget hearing, as well as to all the officials and staff of the Department of Health and its attached agency. I will be presenting the 2024 National Expenditure Program of the Department of Health. The outline of our presentation are as follows: the health sector strategy map for 2023 to 2028, the 2022 year-end accomplishments, the budget utilization trend, and the 2024 National Expenditure Program. Okay. To achieve our objectives and vision for the health sector, our strategy in this medium-term approach is the 8-point action agenda for universal health care, emphasizing the actions to fast-track the health sector improvements, focusing on tangible outcomes for every Filipino, every community, and every healthcare worker and health institution. We want to have better health outcomes with longer life expectancy, stronger health systems that are resilient against pandemics, and access of all Filipinos to all levels of healthcare through a humanistic leadership and good governance. Our 8-point action agenda involves bawat Pilipino ramdam ang kalusugan, ensuring that every Filipino experiences the benefits from comprehensive health services without financial hardship, ligtas de kalidad at mapagkalingang serbisyo, provision of high-quality, safe, and people-centered services through access to affordable medicines, teknolohiya para sa mabilis na serbisyo using digital health and technology for efficient and accessible health service delivery. Handa sa krisis, ensure a resilient health system to effectively prevent and respond to health crises and emergencies. Pag-iwas sa sakit, improve healthy behaviors through the promotion of health-enabling settings, implementation of healthy public policies, and enhancement of health literacy. Number 6, ginhawa ng isip at damdamin. Enhance Filipinos' well-being and ensure the quality of mental health services. Number 7, kapakanan at karapatan ng healthcare workers. Ensure an adequate, competent, and committed health workforce by providing fair compensation, decent work conditions, and opportunities for career development. And number 8, protection sa anumang pandemya. Strengthen our health systems and structures to prevent, manage, and recover from new disease outbreaks and potential pandemics. Before we proceed our budget or the NEP 2024, allow me to present what the department has done for the 2022 budgets. On ensuring that every Filipino achieves the highest level of health by providing safe, high-quality, patient-centered service, the department delivered the following from the 2022 budget: 2,372 health facilities enhancement projects or primary care facilities at the LGU and DOH hospitals and healthcare facilities such as temporary treatment and rehab centers and quarantine stations were completed. A total of 2.8 million indigent patients were served by the Medical Assistance to Indigent Patients Program. 66% of our people living with HIV are given their antiretroviral therapy. 1.3 million children aged 0 to 12 months are considered fully immunized for about 9 vaccine-preventable diseases. And additional 60 functional specialty centers across the regions were already serving for specialized care in different parts of the Philippines. On ensuring that each community thrives in the face of challenges, empowering through health promotion and fostering mental health and well-being, the department delivered 60% or 523 local government units supported as disaster-ready with institutionalized disaster risk reduction and management for the health system. We launched also the health promotional campaigns to increase health literacy of Filipinos through Health is Life, focusing on health promotion and 7 priority areas, Consultayo, focusing on primary care, and Pinas Lakas campaign on COVID-19 vaccination. 32 healthy communities, 9 healthy schools, 28 healthy hospitals working towards a healthy Pilipinas. A total of 362 DOH-accredited mental health access sites served essential medicines and mental health consultations to over 124,000 patients in 2022. On prioritizing healthcare workers' welfare and rights and strengthening health institutions, the Department of Health provided the following. As of December 2022, the Department of Health has deployed 25,955 human resources for health at all priority areas. HRH management will further be supported with the implementation of the National Human Resources for Health Master Plan, which is already approved at the NEDA SDC cabinet level. We were also able to release 1.67 million health worker claims for enhanced COVID-19 benefits and compensation as of December 28, 2022. And 100% of our healthcare workers, or A1 category, are fully vaccinated with the primary series of COVID-19, although only 32% have received their second booster. We also have the lifting of the public health emergency. We transitioned back to normal setup with the period of lockdowns, remote work, and online classes ended. In terms of financial performance, as shown in this trend, the average 5-year budget utilization by obligation is 91%, while the average utilization by disbursement is 76%. As of August 31, 2023, the obligation rate of the Department of Health is, for its current budget, 2023, is 61%, and disbursement is already 67%. To provide you a status update on our procurement as of August 2023, August 31, we already have 75% of the allocated budget already awarded, 25% ongoing procurement. Let me now present to you the highlights of our 2024 National Expenditure Program budget of the Department of Health. As shown in this trend, the Department of Health budget is increasing since 2019. The Department of Health-wide 2024 National Expenditure budget, however, is 3% lower than the 2023 General Appropriations Act level. For the Department of Health, the 2024 NEP is 5% lower than its previous level. The budget trend includes the allocation for the retirement of life insurance premiums and special accounts for the general fund. The majority, or 66%, of the Department of Health's NEP budget is allocated in the Department of Health Office of the Secretary, amounting to 204 billion pesos. The remaining 34% of the DOH-wide budget is allocated to the Department of Health attached agencies and corporations. Of this amount, 101.5 billion pesos, or 32%, is allocated for the PhilHealth premiums, subsidies for indirect contributions, and benefit package improvement. Overall, the budget level of most of our attached agencies and corporations have decreased in 2024 NEP, which is around their 2023 NEP levels. Let us now proceed with the details of the Department of Health's budget, amounting to 204 billion pesos in the 2024 NEP. Here are the top 10 major cost drivers of the DOH in 2024 NEP, which includes the corresponding NEP 2023 and GAA levels for reference. For operations, I think it's in more detail for the next slide. They constitute about 172 billion pesos, or 84% of the Department of Health's total budget amount of 204 billion. The 2024 NEP budget of the Department of Health will fund its 8-point action agenda. The succeeding slides provide the details of budgetary requirements per action agenda, and kindly note that only the major line items of the Department of Health identified to be directly contributing to a specific action agenda are shown. Other supporting line items of the DOH, including attached agencies and government-owned controlled corporation, will not be presented, but they are considered as contributory across all actions. To ensure that bawat Pilipino ramdam ang kalusugan, the following line items are funded in the NEP. Next slide, please. 23 billion pesos under HPEP, procurement of infrastructure and medical equipment of 1,444 health facilities. 67.3 billion pesos for the maintenance and other operating expenses of 14 Metro Manila DOH hospitals and 68 regional DOH hospitals, including newly established hospitals and other health facilities. 22 billion pesos is allocated for malasakit centers for medical and financial assistance for approximately 1.31 million patients, averaging at about 17,000 pesos per patient support. 1 billion pesos for Cancer Assistance Fund as financial support that will be accessed in 35 projected sites. For agenda item number 2, ligtas de kalidad at mapagkalingang serbisyo, 8.3 billion pesos is allocated for family health, immunization, nutrition, and responsible parenting for the routine vaccines for eligible populations and other provisions for nutrition, oral health, and family health commodities. 4.8 billion pesos for prevention and control of communicable diseases, for the commodities for tuberculosis, for HIV/AIDS, for dengue, and other infectious diseases. 1 billion pesos for cancer commodities under the prevention and control of non-communicable diseases. Remaining budget is for the mental health, which contributes to agenda item number 6. 1.4 billion pesos for strengthening regulatory functions of the Department of Health, which includes the budget of Health Facilities Service Regulatory Bureau and the regional licensing enforcement counterparts and the Food and Drug Administration, and the total of 918 million pesos under the Health Information Technology is allocated in teknolohiya para sa mabilis na serbisyong pangkalusugan. The fourth action agenda, Handa sa Krisis, is given a total of 690 million pesos, composed of the QRF or the Quick Release Fund and the Health Emergency Preparedness and Response Fund. For pag-iwas sa sakit, 2.1 billion pesos is allocated to health promotion, 120 million pesos for environmental and occupational health support, for zero open defecation and subnational water testing laboratories. The next action agenda, Ginhawa sa Isip at Damdamin, will allocate 683 million pesos for mental health commodities lodged under the Prevention and Control of Non-Communicable Disease, and further, a total of 1.6 billion pesos is allocated for the operation of dangerous drugs abuse treatment and rehabilitation centers. A total of 38 billion pesos is allocated for the kapakanan at karapatan ng health workers at institution. This involves the following items: 18 billion pesos for the National Health Workforce Support System or Augmentation Human Resources, 22,674 health human resources in priority areas, and provision of 1,667 scholarship grants. 20 billion pesos for the payment of the health emergency allowance and compensation for arrears, reckoning to about 3 million eligible healthcare workers and non-healthcare workers, and about 500 million pesos for the payment of sickness and death benefits to 32,000 eligible healthcare workers. Finally, proteksyon sa anumang pandemya with 1.7 billion allocation comprises 638 million pesos under epidemiology and surveillance to increase the capacity of the public health surveillance system, 325 million pesos from the World Bank PSERP and ADB HEAL for strengthening of primary care service delivery in underserved and unserved areas and support the establishment of specialty centers. 404 million pesos for the operations of the Bureau of Quarantine, and 732 million pesos in allocation for operations of national and subnational reference laboratory. Moving forward to PhilHealth, it has 6 priority items for the next 2 years. First, konsultasyong sulit at tama, or the PhilHealth Consulta Benefit Package, as we transition to a comprehensive outpatient benefit package in the next couple of years. The Consulta package aims to provide all Filipinos access to a primary care provider that shall deliver basic, essential services at every life stage to promote health, identify risks, and ensure early diagnosis, treatment, and care. It covers consultation, case management, assistance and referral in accessing services in partner facilities and/or specialty and higher levels of care. Next, we intend to release new and enhanced benefit packages under the benefit expansion. PhilHealth is currently updating the rates of top availed packages. The corporation is set to launch the first set of expansion with high-risk pneumonia and acute stroke. Further, other benefits will also be introduced, such as renal replacement therapy and acute malnutrition, among others. Third, also mandated by the Universal Healthcare Act, PhilHealth is transitioning its provider payment mechanism from all-case rates to disease-related groups and the global budget. The corporation is currently performing costing activities and is in close coordination with healthcare facilities in preparation for this shift. All these are intended to lower the out-of-pocket expenses of PhilHealth members. Fourth, to sustain the program, we are also guided by our fiduciary responsibility to ensure fund sustainability. While premium rates increases were deferred, the corporation sought other means to strengthen its accounts management, such as various collection programs at the end, improving collection efficiency. Fifth, to advance universal healthcare deliverables, PhilHealth is continuously adopting new and enhanced technologies to streamline and hasten major processes as claims payment, member registration, and collection. These include collaborative engagements with the Philippine Statistics Authority on the Philippine ID system and debt registry, and the DICT on eGov.ph super app, among others. Further, PhilHealth is also committed in fraud prevention and ensuring National Health Insurance Fund is intact. Lastly, sixth priority item is good governance. PhilHealth is currently in close coordination with the Governance Commission for GOCCs and its reorganization plan. Once the negotiations are complete, the corporation shall be adopting a more responsive and agile structure to address the needs of its members. We also would like to highlight a total of 101 billion pesos allocated to PhilHealth in the 2024 NEP for premium subsidy of indirect contributors amounting to 80 billion derived from tobacco and alcohol sin taxes, 61 million for pamana beneficiaries, and 21 billion for benefit packages improvement under the Universal Healthcare Act. That ends our presentation, and therefore I call on each one of us to join hands in achieving a healthy Pilipinas kung saan bawat buhay mahalaga sa bagong Pilipinas. Maraming salamat, Madam Chair.
Salamat, Sec. Herbosa. At this point, I'd like to acknowledge the presence of our esteemed APRO Chair, the Honorable Kong Zaldi. Good morning po. So, next, the Chair recognizes Press Mandy Ledesma. Would you like to give some opening remarks?
Thank you again po, Honorable Kong Stella. Good morning, Honorable Kong Saldi. Actually, I had a two-slide presentation, but which was already presented by the Honorable Secretary Ted Herbosa. No, I just want to take this opportunity to thank the Honorable Congressman and especially Honorable Alvarez for already for already approving. Thank you very much for that. And but seriously, Kong, we at PhilHealth are very grateful for this opportunity, and we can assure all of you, honorable congressmen, that we are here to serve the country, and we are here with our full support and here to work hard. Thank you very much, Kong Stella.
Okay, so at this point, we now proceed to our open forum. But Okay, since it's your first time here, let me just remind our resource persons as well as our colleagues that each member is given 5 minutes for questions or interpellation, excluding the response of the resource persons. And when you hear the bell sound, it means you only have 30 seconds to wind up with your questions. Our members can avail of an unlimited number of rounds, rounds 2 and 3 and so on. For each of those subsequent rounds, they have 3 minutes each. So nung isang araw, umabot po kami ng hating gabi. So it is to the best of everyone's interest to keep your answers concise. And to yung sa technical staff naman, sana maging listo kayo at ihanda nyo na kaagad yung data para makasagot ang ating secretary ng mabuti. Okay. And as part of a long-standing and respected tradition of the House of Representatives to accord preferential treatment to the minority members of the House and followed by the majority members in an alternating manner. So, the Chair now recognizes from the minority the Honorable Wilbert Lee.
Good morning, Madam Chair. Good morning, esteemed colleagues. Good morning, our DOH family. Magandang umaga po sa inyong lahat. My question is directed to PhilHealth actually. Madam Chair, is it correct that PhilHealth has around 466 billion investable fund? Can the PhilHealth validate this?
Yes po,
Mandy?
it's correct po.
Tama rin po ba na lumaki ang net income ng PhilHealth from 21 billion to around 68.4 billion as of July 31?
Yes po, that's correct po.
Therefore, it is clear na may pera ang PhilHealth.
Yes po, that's correct po.
Given that we have around 400 billion worth of investable fund in PhilHealth, and the agency has around 68 billion net income, bakit po maraming reports ang nagsasabing delayed ang bayad ng ahensya sa mga hospital? Madam Chair, ano ba ang mandato ng PhilHealth? Maging health insurance provider o maging isang state investment company?
Fresh Mandy?
Thank you very much for your question, sir. I'm very glad that you asked that question, so it gives us a chance to clarify everything, no? First of all, sir, yes, I personally, and I think PhilHealth agrees that our cash position is very high for a health insurance company. Same with our net income, no? Masyado pong mataas. In fact po, if you annualize that, that will be around 120 billion net income year-end po, no? Now, to answer your question po, tama ba yan? Does it look good? I'll be the first to say po na hindi po maganda tignan yan, no? Actually, we have to do a lot of rectifying and corrections on that, no? And our aim there to address this is in these ways po, no? First of all po, I'd like to mention on the benefit case packages of PhilHealth po, that hasn't been touched for the last 10 years po, no? And this year, and I've been highlighting this to Honorable His Excellency PBBM, no? This year we already adjusted our first 3 case packages po, no? And the increases have been very substantial, no? And we intend to continue with the remaining packages as we move forward po, no? So nagalaw na po, no? It's the first year. Secondly po, we are planning to move forward expeditely, no, on our digitalization and computerization /IT projects po, no? As you are very well aware po, we are actually behind, or we have shortcomings on all fronts with regards to IT, no? Both internal, external, no? With regards to data processing, fraudulent claims, payments, lahat po yan medyo backward ang PhilHealth, no? So we with the cooperation of DICT and with the trust and guidance of PBBM and Malacanang, we are moving very fast on that end po, no? So that's the second. Third po, we have a we have a pending review for a reorg, for a complete reorg with GCG, no? And once that's approved po, we will increase the number of employees of PhilHealth from the current roughly 7,000 employees. It will go above 10,000 employees po, no? So, we have a lot of plans for PhilHealth going forward. So, in the coming years, it is very clear po, you will not see numbers that are very close to this, no? With regards to cash position and with regards to net income, no? But again, I'm with you, sir. We are with you, sir. Masyado pong mataas. Both the cash position, which is north of 450 billion, liquid cash po yan, and the net income, no? Which is at 67 or 68 billion and which will be annualized to close to 115 to 120 billion po. Talagang napakalaki po, no? And I'm with you, the money should not be used. Hindi po naman kami bangko, hindi po naman kami corporation na naghahabol ng net income, no? We are here to as the Honorable Sec Ted Herbosa said, no, we are stewards of the people's money. We should use it wisely. And I'd like to think po, going forward, we shall be doing that po. The direction is very clear, and with the full support of Congress and Malacanang, I think we are definitely on our way po. Thank you po. I hope that answers your question po.
Thank you, Madam Chair. Actually, I will go to that expanded benefit packages later on. But yung isang question ko, magkano ba, no? Because yung tanong ko kanina is maraming utang sa mga hospitals, no? Magkano po ba ito? I mentioned this, Madam Chair, I want to put this on record. Hindi po ako may-ari ng hospital, wala po akong hospital, wala akong kaibigan o kamag-anak na may hospital. I mentioned this because sa akin pong pag-iikot, napakarami po ng mga hospital na hindi na tinatanggap yung mga indigent patients dahil daw po maraming utang ang PhilHealth sa kanila. And then, marami rin po na hindi na raw po mapasweldo yung mga kanilang pong mga staff, frontliners, dahil po malaki ang utang ng PhilHealth. So, ang gusto kong malaman, magkano ba ang utang ng PhilHealth dito sa mga hospitals na to? At ano po ang plano ng PhilHealth dito?
Okay. Po, Madam Chair, may I? Yes. Thank you again po for your question. In fact, I'm really grateful because that's the part I forgot that was supposed to complete my answer, no? Anyway, so we will come up with your question po on magkano po yung utang sa mga hospital. But what I want to highlight, and I wanted to mention this to Kong Stella before the hearing started because very important to, no? Yesterday po, despite our busy schedule, I called for a meeting with the Hospitals Association of the Philippines. Lahat po ng heads nila, lahat ng president, lahat ng senior officers, complete attendance po. In fact, 2 of them were attending an ExCom and they stepped out because sabi nila mukhang importante yung meeting. So I was grateful po to them. We had a very lengthy meeting. Yesterday lang po to. It was a virtual meeting, no? And the reason for the meeting, Honorable Congressman, is I said malamang bukas meron kaming hearing sa Congress with the honorables, and feeling ko ang itatanong nila is bakit hindi yung bayaran sa hospitals, bakit delayed, bakit hindi nagbabayad, no? True enough, it's probably the first question of the day, no? And just to give a brief background on the meeting, it went...
Press Mandy, can you just directly answer the question? Magkano po ang utang ng PhilHealth sa mga ospital?
Okay po. So in terms of, one last sentence lang po, the meeting kasi, it ended by, I asked all of the honorable heads of the Hospital Association of the Philippines, are you happy? And are you happy with the service? May mga complaints ba kayo sa mga utang ng PhilHealth? And lahat sila po, unanimously po, actually naka-record to po, so just in case kailangan po, no? Wala silang problema. Very, very happy sila sa service ng PhilHealth. In fact,
noted.
Okay
Please
po.
answer the question.
Thank you po. Sorry for that po. So anyway, so the question that was asked by Honorable Lee is how much is the payments to the total payments to the hospitals po, no?
Utang.
So ang payables po in process po now is roughly, yung more than 60 days po, is roughly 13 billion po. 13 billion po. Ma'am, does that answer?
Madam Chair, yan ba yung total payables na sa lahat ng hospitals? 13 billion lang lahat buong Pilipinas? Kasi kung 13 billion lang yan sa napakalaking pera ng PhilHealth, ano ba yung rason bakit hindi ito nababayaran, no?
Okay.
Hindi naman tayo pabagalan dito, no? Kasi serbisyo ito na binibigay sa atin mga mamamayan.
Oh, sige. Okay. So, ma'am, ma'am? Okay, sir, thank you again for your question. So, just to clarify, 13 billion yung more than 60 days po. Pero yung total of all, okay, of all, is roughly double that amount, 27 billion po. So, so to answer your question, I would think the number you were looking for was 27 billion po. Now, I just broke it down, yung more than 60 days to 13 billion po. So, yes po.
Madam Chair, okay, even at 27 billion, di ba napakaliit na amount nito? Ano ba nangyayari talaga? Bakit po umaabot ng napakatagal ng bayaran, no? Again, I'm mentioning this, Madam Chair, because apektado po yung serbisyo, no? Sa aking pag-iikot, and I personally experienced this, napakarami pong hospital ayaw nang tumanggap ng mga pasyente pag PhilHealth ang pinag-uusapan. And then marami rin mga doctors, marami rin mga nurses, marami mga empleyado, hindi na raw po nababayaran ng hospital dahil ang laki ng utang ng PhilHealth sa kanila. So, yun lang po ang gusto kong malaman. Ano po ang plano ng PhilHealth dito? Kailan ba ito mababayaran? Lahat ng ito, ano pa? And isasabay ko na, no, para isang tanungan in the interest of time. And I also learned that there are so many hospitals suspended ng PhilHealth just because meron daw pong mga, since 2013, mga double billing na nangyari in the amount of 2,000, 4,000 pesos na hindi naman po pagkakamali talaga, na hindi naman po daya yung iniisip ko, di talaga nagkamali lang dahil po manual pa nung mga panahon na yon. Ano ba ang status ng mga ito? Napakarami po ng mga hospital na suspendido dahil lang po sa mga ganitong kasong maliliit. Naapektado na naman po ang serbisyo na binibigay po natin sa ating mga indigent patient. Remember, PhilHealth, yan po ang primary agency ng ating pamahalaan na mag-provide po ng insurance para sa ating po mga mamamayang walang pera, mahihirap. Ano ba ang plano ng ating PhilHealth po sa mga ganito?
Press Mandy.
Maraming salamat po for your question again, Honorable Lee. No, I'm happy to state to Honorable Congressman that we will completely, hopefully, or very high percentage po within 90 days, no, yung 27 billion po. You can pwede yung naka-record naman to, diba? So within 90 days po, we will try to pay a very high percentage of the 27 billion. Now, the question the question is how are we going to do it? How do we intend to do it? We are already preparing. We had a meeting, our Execom had a meeting yesterday, no? We are preparing to use the DCPM formula, no? Yung debit credit payment mechanism formula, no? And we will use that to make sure that our reconciliation will be accelerated, no? So again, based on our discussion yesterday, I'm confident, Madam Chair, Honorable Lee, I'm confident that within 90 days from today, no, bulk or majority, if not all, of the 27 billion will be paid off, and hopefully that will make the hospitals and the doctors happy. Thank you very much po.
Madam Chair, no, I hope hindi mabawas sa oras ko to, no. Our colleague here from Zamboanga del Sur, actually, gusto niya namin itanong yung sinasabi ng ating pong presidente na 60 days, no, 27 billion ang kabuuan. Meron po dito since 2019, 2020, 2021, 2022 sa Zamboanga del Sur Provincial Hospital, mahigit 100 milyong piso ang utang. and then 1,000,000 lang ang nabayaran. Ano bang ibig sabihin ng 60 days na yan?
Okay po. Yung 60 days po, with all due respect to the Honorable Congressman, I will ask my CEO to explain that further, no? And I want to mention lang, Honorable Lee, as Kong Stella mentioned earlier, this is my first budget hearing, no? So, yung tunong 2021, 2020, 2022, wala pa ako sa PhilHealth, no? But I understand your concerns, and before I allow CEO to explain, I want to ask lang the permission of this Honorable Congressman, no? I think that's very fair, no? 90 days lang hiningi namin. In 90 days, you will see a huge difference. In fact, a complete turnaround. So, I think that's not too much to ask po, no? But anyway, Madam Chair, if I can pass on the mic to COO, can you explain on the 60 days COO policy?
Pag-ilinaw din po kung yung 13 billion na more than 60 days is only for 2023. Kasi ang tinatanong kasi ni Honorable Lee is yung lahat, kahit na yung nung 19 kopong-kopong pa, basta utang ni PhilHealth, isama po ninyo doon sa hinihingi po niya na total. Tama po ba, Honorable Lee?
Yes, Madam Chair.
Tama yan po, pero kasama na po, yun, total na po, yun. Yun na po, that's the whole thing na po. Complete, it's included already po. Anyway, thank you po.
Can we just, sorry,
Yes,
Madam Chair,
Honorable.
can I just ask the PhilHealth to submit kung ilan ba talaga lahat ito to the committee, no, para po for the interest of time, and also ask PhilHealth to submit before the plenary deliberations your proposal for new and expanded benefit packages para po magastos at magamit natin itong mga pera, gaya ng na-mention nyo kanina. No?
Okay po.
Yes.
I will go to my one last question.
That's your last question,
Yes,
and
last question,
PhilHealth
Madam
is so
Chair.
ordered to submit that report.
Yes, actually po, very quick comment po, if I may. Actually, I think po, we have it already prepared. Anyway, we'll definitely submit it. Not within the day, maybe within the hour po. No, we'll just put
Respond,
it.
if you have it there, hand it over to our page.
We shall po. We shall po.
Thank you.
you po.
Last question, Madam Chair. This is with regards to our cancer assistance funds from the DOH, no?
wala.
I believe that meron po tayong batas tungkol po dito and meron tayong pondong ina-allocate dito. Ako ay fully support na ito po ay dagdagan because ang cancer po ay pangatlo pong sanhi ng death dito sa ating bansa. Gayun pa man, ang aking concern po dito, meron pong pondo, tinaasan po ngayon, pero napakalaki po ng underspending po dito. No? So, ang gusto ko na lang po, Madam Chair, in the interest of time, can I ask the DOH to just submit kung ano ba yung plano nila for this, and bakit ba, kanina na-mention ni Secretary from 31, naging 35 na ngayon yung access site ng pondo na to. Ano ba ang basihan? Bakit 35 lang ang binibigyan ng pondong ganito? At pwede ba natin itong mas palawakin, no? So I would just ask the department to submit to the committee before the plenary debates kung ano ba yung plano natin dito. That's all for now, Madam Chair. Maraming salamat po.
Salamat. Secretary Barbosa.
Yes, Madam Chair, we will submit, we will comply.
Thank you. Next interpellate. Nandito pa since 6 a.m. para magpalista. Deputy Majority Leader Jan Baronda.
Thank you so much, Mr. Chair, Madam Stella. Hindi naman, alas 8 lang po, hindi 6 a.m. Good morning, everyone. I am pleased to welcome Secretary Ted Herbosa and DOH family. With your experience in the department as director, as USEC for how many years, I know that we are certainly glad to have an expert at the helm of the department. On behalf of the hundreds, if not thousands, of Ilonggos, I'd like to extend my appreciation to you, to your MAIP program, which is really felt by the Filipino people. And rest assured of my support on the approval of your budget. However, for fiscal year 2022, the DOH failed to use 29.40 billion, or around 13.2% of the total budget allocation of the department. This is an enormously unconscionable amount What is more shocking, Mr. Chair, DOH only disbursed 68.7% of the total 224.251 billion in 2022 appropriations. May we know why did the department fail to use this huge amount? Ano po ba ang nangyari sa mga pondo na ito, Mr. Chair?
Thank you, Madam Chair. Some of the money for 2022 were actually included in the continuing appropriations. So some of them by our continuing appropriations of 2022, and now we're already at 90+%, almost 100%. But we have several challenges encountered during the implementation. And some of them included, for example, delays in the approval of the Medical Assistance for Indigent Program, MOA, Memorandum of Agreement between the Centers for Health Development, the DOH Regional Office, and the local government. Another one is low fund utilization rate by the local government hospitals where we download some of the indigent funds. We also had needs for human resource complements at the regional level for program monitoring, and we also have lack of information dissemination of all this assistance, especially to GIDA, to the geographically isolated and disadvantaged areas to which most of these funds were allocated. We're also trying to improve inter-hospital and hospital facility coordination so that the funds can be used. So, as of now, we have requested some of these unutilized funds, ma'am, to the DBM for realignment, also to medical assistance for indigent program, because that actually tries to help a lot of our indigent patients, and also for health facilities enhancement, because there are many requests that were not funded. So we try to ask DBM to allocate those unused of 2022.
I think, Mr. Chair, totoo po yan. Because yung MOA, like ako, yung first term ko 2019, kailan lang po ba na-approve yung MOA na yan with some other private hospitals? It was only recently. Kahit na araw-araw, ilang buwan ako nagtatanong, pupunta ng opisina nyo. So, kailangan talaga ayusin natin yan kasi we are here, especially me, coming from a family of doctors. We save lives. Hindi po natin kayang sabihin, huwag ka magkakasakit ngayon. Kasi pwede ka nang mamatay ngayon pag hindi natin naagapan yan. So sayang yung 29.40 billion, 2023 na tayo ngayon, na may 10% pa rin ng kulang. Ang 10% po ng ilang billion na yon, that is more than 9 billion pa rin. So like for example, meron po ngayong hospital, Western Visayas Medical Center sa Iloilo. May 10 major operating rooms, may 2 cardiac operating rooms, 15 recovery beds, and 5 cardiovascular intensive care units. Nakita ko kasi, Mr. Chair, wala dun sa capital outlay ng hospital. I was with Senator JV last weekend because po, we prepared for this. During my first term, we passed Republic Act 11496, expansion of the hospital bed capacity from 420 to 700. Because dati pa lang, ito na po yung gusto natin mangyari sa Western Visayas Medical Center. And during the incumbency of Senator JV in 2015, he downloaded, parang tumulong po siya para mabigyan ng 440 million for that heart center in Iloilo. Sayang po dahil meron na tayong tao, human resource, meron ng building. Meron naman palang 29.9 billion na hindi nagamit. Sa tingin ko po, yung sulat po ng hospital director amounting to 300 million for the equipment, for equipping of that heart center, maibigay natin within this year. Kasi po, sayang ang pera na hindi nagagamit. Ang sinabi ng hospital director, pag meron na kaming worth 300 million na facilities na yan, magagamit na fully operational yung heart center sa Iloilo or Western Visayas Medical Center or the regional hospital. So sinasabi ko ito, Mr. Chair, para naman po at least hindi na po pupunta ang mga taga Western Visayas with million inhabitants kung magkakaproblema ang pamilya nila sa heart center, sa lung center, sa kidney center para gumasos ng todo kasi hindi naman lahat ng tao kayang gumasos ng ganyan para lang mabuhay. So, Mr. Chair, I would just like to ask the commitment of the good secretary if he can attend to the request of Hospital Director Dr. Nicolo to save lives and to make sure that health services unahin natin. Hindi lang sa buong Pilipinas, hindi lang sa heart center sa Manila, but of course sa Western Visayas with 8 million inhabitants.
Secretary?
Yes, Honorable Chair, we will look into the request of Iloilo for 300 million to finish this heart center.
Not to finish po, kasi tapos na yung heart center.
To equip,
Now,
to equip.
Because we are now working on the cancer center naman. So, ito pa, isa pa, Mr. Chair, yung isang nakikita kasi natin, minsan, pag ginawa natin yung program appropriation for a certain project, unahin natin yung building. Okay? After ng building, dun po tayo, a year after, mag-allocate ng pondo para sa equipping. Sayang, nakatenga na 1 taon ngayon ang building ng kung ano man yan na proyekto natin kasi it will take another 8 to 10 months for the procurement. So, hindi naman natin pwede madelay yan. Hindi ba pwede? It's about time to look into this, to call the attention of COA to support the Department of Health kasi pwede naman natin gawin na exemption when it comes to health programs, Mr. Chair. So again, Mr. Chair, my second question, as per the statement of appropriations,
Last
allotment,
question.
obligation, disbursement, and balances of DBM as of June 30, 2023. For this year, the DOH has an obligated allotment amounting to 135.548 billion, which amounts to only 43.8% obligation rate. As of today, may we know how much of your total allotments has been obligated? Magkano po ang kayang gastusin ng DOH bago matapos ang taon?
Secretary Herbosa?
Thank you, Madam Chair. As of now, as of yesterday, the report to me of our procurement service is 75% of the annual procurement plan has already been completed. So we have a remaining 25% that is ongoing procurement. So that 75% is already obligated. That means the awards, the contracts have been awarded. So nagamit naman po, ma'am, mababa nung nag-meet tayo previously. But I think many of the reconciled reports, hindi lang nagsasubmit yung mga regional na nag-bid. So mataas naman, ma'am, other than that initial report of 42.
Yes, I believe this year,
Can you
Madam
please
Chair,
wind up?
tumaas. Yes, I believe this year medyo tumaas compared sa 2022 with the 91% obligation rate, while the average utilization dispersed is 76%. Pero meron pa rin po, kung titingnan niyo po, i-convert mo yun into pera, money is 47 billion pa rin undisbursed sa 2022. Sana po hindi maulit yan kasi sayang yung pera ng gobyerno. Mr. Chair, magkano po ang nakikita natin na hindi na kayang
Last
gamitin ng
question,
pondo ng DOH at may balik sa ating National Treasury? Mauulit po ba ang mga nangyari noong 2022 na bilyon-bilyon muli ang hindi magagamit na pondo ng DOH?
Thank you, Secretary.
Thank you, Madam Chair. For the disbursement, we found that the slower disbursement rate was actually constructions that were delayed, especially in the HPEP projects. So what happens there is a progress billing type of payment. So they look at what is finished by the contractor, 30% payment, another 30%. So there is retention if there is delay. So sometimes it takes years after before they complete the project. But it's obligated. The money at least is already obligated. But the disbursement really gets lower at about 70. So we can have 90 plus obligation rate, but the disbursement is delayed because it's progress billing.
Thank you so much, Madam
Do
Chair.
you wish to be listed for round 2?
Yes, Madam Chair, thank you so much. Two things, Mr. Chair, Madam Chair. So una, dahil doon sa low disbursement rate, dahil may problema tayo sa mga contractors. Siguro it's about time din na titignan ni Mr. Chair, ni Sir Saldico, ni Chair, dahil magaling siya, he's into construction, na siguro pwede na lang i-MOA yan with DPWH kung hindi kaya ng mga regional hospitals natin. Kasi yun ang nakikita nating problema. Pangalawa, we have more than 300 representatives, the House of Representatives. Kung hindi ma-utilize yung pondo na yan, bigyan na lang natin lahat yung MAIP na to kasi araw-araw ilang libo pumupunta sa regional hospital, sa amin sa mga opisina para humingi ng MAIP para hindi masayang yung pera ng gobyerno. Maraming salamat, Madam Chair. Thank you so much, Mr. Secretary, and the DOH family.
Alright, salamat. Before we proceed, can we all please observe silence? Hindi na po tayo nagkakarinigan. Alright, so next to interpolate, from the independent minority, we have the Honorable Ed Salagman.
Thank you, Madam Chair, and good morning to Secretary Ted and the DOH officialdom. This year, Mr. Secretary, Madam Chair, there is a separate line item for family planning and reproductive health in the amount of 873 million 14,000. That is not maintained in the NEP for the proposed budget of the DOH for 2024 because it was reverted to the generic line item known as family health, immunization, nutrition, and responsible parenting. Is that correct?
Secretary?
That is correct, Madam Chair.
Would you not like to have this back to the current situation where there is a separate item for family planning and reproductive health, independent and separate from the generic item on family health?
Yes, Madam Chair, we will make a separate item for family planning and reproductive health.
Could you make the proper request to the committee on that request?
Yes, Your Honor.
Now, our present population is estimated to be 117,337,368. Is that correct?
Yeah, that's correct, Your Honor.
Okay. Now, our population growth rate is 1.54%. Is that also correct?
That's also correct.
Now, let me go to the data in 2023 compared to 10 years ago after the approval of the reproductive health law. 10 years ago, the population growth rate was about 1.76%. Is that correct?
I think so, Your Honor. That's correct.
And this is now an improvement, principally because, among others, we have enacted the reproductive health law. Now, the maternal mortality ratio in 2012 was 104 deaths to every 100,000 live births. Is that correct?
Yes, that's correct, Your Honor.
And the present maternal mortality ratio has been reduced to 84.86% deaths per 100 live births. Is that correct?
That is correct, Your Honor.
Again, that is an improvement.
Yes, Your Honor.
Okay. In 2012, the infant mortality rate was 24 0.065 deaths per every 1,000 live births. Again, would you confirm that?
I will confirm that. That's correct.
And the present infant mortality rate is now reduced to 17.544 deaths for every 1,000 live births. Is that correct?
That is correct, Your Honor.
Again, that is an improvement, and most probably, we could account that, among others, to the enactment of the reproductive health law. Okay. Would you confirm that?
Yes, I will confirm that, Your Honor.
Now, I am surprised with these statistics, and I hope you could explain this. In 2012, the contraceptive prevalence rate was 49%. Is that correct?
Ilan?
49%.
That's correct, Your Honor.
Ano? Now, the contraceptive prevalence rate now is 41.8%. Is that correct?
Bumaba. Yes, Your Honor. I think
Again,
that's
that is
correct.
an improvement, but
Yes,
we
that's
are
correct.
far behind other countries with respect to contraceptive prevalence rate. Would you also confirm that?
Yes, I would confirm that. Very much far behind.
With respect to contraceptive preference, practically it's the same preference from pill, female sterilization, calendar rhythm method, withdrawal, IUD, injection, condom lamp, and male sterilization. But could you give us, Mr. Secretary, most probably not now, but the different percentages in the preference for contraceptives? Now, with respect to the registered number of non-abortifacient contraceptives, what is the total number of available non-abortifacient contraceptives as certified by the FDA?
Our total for our modern methods of contraception, for methods, we have the pills, we have sterilization for the female, injectable meds, IUD, implants, male condoms, other sterilization for males. We have, by users, for family planning, we have about 6.9 million users, and by public sector access, about 3.9 million, or percentage-wise, it's about 57% po.
Okay. Now, my final question for this first round is how much is appropriated for family planning and reproductive health in 2024?
Your Honor, the total allotment is 749,999,400 pesos. This is, but we also have allotment in the regional offices of about 607,837,000, and with another 165 million also in health promotion. We have a total of 1.5 billion pesos allocated for family planning alone.
And
Can you wrap up,
yes,
Honorable Akman?
I
And we
will,
will list you for round
Madam
two.
Chair, and kindly give to us the totality of these figures, and together with your request that there should be a separate line item for family planning and reproductive health.
We will do that, Your Honor.
And
Thank you,
also
Madam Chair.
because of the favorable data consequent to the approval of the reproductive health law, can you also give us if you have any requests for augmentation?
Yes, Your Honor. We will
Thank you,
do that.
Madam Chair. Thank you, Secretary Ted.
Thank you. Next to interpolate, from the majority, we have the Honorable Ray Reyes.
Thank you, Madam Chair.
It's family planning
My,
and reproductive health.
First sets of questions are directed to PhilHealth.
Wala na naman. Zero po. Kasi sinama na naman dun sa generic.
Okay. Can you
Sinama na naman.
can you apprise us again of the current financial position and the financial performance as per submitted ng COA report? Like, what is the current investable assets and what was the net income that PhilHealth achieved back in the COA report that you mentioned?
President.
Your Honor, for the last 8 months, the current cash position, liquid cash position, is around 466 billion pesos, Your Honor. And the net income is around 67 billion, Your Honor. And if you annualize that, that's for 8 months, Your Honor. If you annualize it, it's roughly around 115 billion, Your Honor.
Okay. If I recall, I think in the 2022 COA report, I'm not so sure if it's correct, but you actually had a net income of 147 billion pesos. Is that correct?
Based on my understanding, Your Honor, that is correct. But if I can ask our CFO, our finance guy, Sir Renet, to explain, because there's some Sir Renet, Honorable was mentioning that in 2022 we had a net income of around 145 billion, and I know there's some. Can you explain what's the reason for that? There was. Your
Mr.
Honor,
Lim Jaco?
if I may allow Renet,
Yes,
kasi
please.
there's a. Yes, thank you, Your Honor.
Maraming salamat po and magandang umaga po. Now, for year 2022 po, the income of PhilHealth before change in ICL or insurance contract liability is 79 po. 79 billion po. Of course, the
79
other gains due to change in ICL or insurance contract liability of 72, that's 151.5 po, Mr. Chair.
Sir, 155 billion?
151 po.
151 billion pesos net income.
Yes, Mr. Chair, including na po yan yung insurance liability po account po natin.
Yes. I guess the reason why I need to ask that is because if you actually have a 151 billion net income, you requested back in 2022 a subsidy of 80 billion pesos also. So, how is it that you are requesting subsidy and then you are close to doubling your income? How can you explain this to the public right now that you're actually increasing in money? None of this is really being disbursed para sa mandate ng PhilHealth. And then it's coming out in the 2022 COA report that some of your executives have increased or tripled your salaries and allowances, some of them increasing up to 500,000 pesos a month. How can you at least explain to the public how can we justify this? And then now you come in here requesting about 101 billion pesos in subsidy.
Mr. Chair, maraming salamat po. Number one, the ICL po na 72 billion is paper income because this is changed in the insurance contract liability in the application of accounting standard po. The actual net income po here is 79 billion po. Tama po, mayroon tayong 79 billion. Of course, the result of this one is due to the fact that maganda ang collection effort ng PhilHealth. At the same time, of course, mayroon tayong national counterpart na pondo. And the benefit expense po for the year 2022 po is amounting to 143 po. And of course, mayroon din po tayo dito na interest income po from investment of 12.2 billion. That's the reason why po na mayroon tayong net income na 79 po. Now, of course, on the part of the compensation of the PhilHealth employees po, personnel, ito po ay nakabase sa approval ng ating CPCS, approve po ng GCG in terms of the implementation po ng compensation po ng GOCC, of which PhilHealth is part of that, Mr. Chair. Thank you po.
Yeah, what is the basis of the sudden increase in your salaries? You tripled it eh. So, is it it seems like you're tripling your salary because you were able to increase the net income of PhilHealth, but then you are failing to actually fulfill the mandate of PhilHealth of providing the healthcare services that is needed by the Filipino people. So it's coming out that while I understand that we need to have PhilHealth floating para hindi naman siya mabankrupt, it's very skewed towards profit-oriented instead of being a service-oriented organization already. Can you at least explain to us how? How can we justify this to the public?
Madam Chair,
Res. Randy?
if I may. Sir, thank you very much for the question. If I may be allowed, Madam Chair, sir, if I can be allowed, our corporate spokesperson, Doc Ish, because we already have a prepared answer for that specific question on the tripling of the salaries. Can we recognize him, Madam Chair?
Doc Ish, you're recognized.
Doc Ish, where's? Oh, there.
Thank you, Mr. Chair.
Very key question.
Honorable Chair and honorable members of the committee, our salary was increased based on an EO, an executive order 150, which is on the CPCS or the position classification and salary system, which is standardizing the salaries of all GOCCs. Even before we were allowed to pattern our salaries on this EO, we actually applied to the GCG and we have the certification process and we went through this and we were approved. Hence, our salary was increased accordingly to the standardized salaries of all GOCCs. The PhilHealth previous salary compensation is based on SSL4 still until we standardize again to the EO or an executive order. Thank you, Mr. Chair.
Yes.
So if an EO increases your salary, then an EO can also change it as needed, what is commensurate really to the performance of PhilHealth in fulfilling its mandate. Is that what you're saying?
Again, Mr. Chair, we were granted the salary increase as certified by the GCG coming from the EO. Yes.
What EO number and what series was this EO so that we may be able to review it?
Order 150, Mr. Chair.
What series of what year?
2020.
2021 po.
During the pandemic, you tripled your salaries?
This was effective 2022, Mr. Chair.
Still, but you guys had the guts to actually, during the middle of a pandemic, actually put out an EO to triple your salaries to be in effect this year in anticipation of what?
Mr. Chair, I would like to check for that the EO is not coming from PhilHealth, but was coming from the Malacanang as part of, again, the standardizing the salaries of all the GOCCs. So it's not only for PhilHealth, but for all the OGCs which underwent the same process.
Okay, thank you. I will have to review this EO and why is this standardized through all of the other government institutions. So sinasabi nyo, dinamay nyo pa yung mga ibang GOCC so sinasabi nyo pati sila na triple din yung salary nila.
Well, again, Mr. Chair, the EO speaks for all the GOCCs and not just for PhilHealth.
Okay, thank you. Next question, Madam Chair. This is with regards to the PhilHealth Consulta package. This is something that you guys rolled out because you wanted to fulfill the mandate of universal health care where everybody has a free checkup. The current case rate for your Consulta package is 500 pesos. Back in June 26, you mentioned that it is not enough. This is actually only enough to pay for doctor's fee and maybe a few laboratory tests. Pero kasama dapat kasi sa PhilHealth Consulta package, pati yung libreng gamot na ibibigay sa mga pasyente. Because it's only 500 pesos, not a lot of clinics or hospitals want to join your Consulta package. Do you have a list right now as to how many clinics and hospitals have actually joined this Consulta package?
As of August, we have 2,300.
Thank you, Mr. Chair, Madam Chair, and Sir, Honorable Congressman. As of August, we have 2,300 po. 2,300 providers po as of August po.
Okay, 2,300 providers are listed in the Consulta package. How many of your Filipinos have actually listed to it naman?
As to date po, we have around 17.6 million registered Filipinos members to the Consulta providers.
Okay, yes, it's around 17 million. That was around June 26 when you said it was around 17 million. At 500 pesos, in your opinion, do you really think that's enough?
Mr. Chair, may I?
Yes.
Madam Chair, the real plan for the primary care is to come out with a comprehensive outpatient benefit package. So the Consulta package is a transitional package for this primary care. Currently, we have the 500, yes, and the 750 per house, per person, but we are planning to increase the amount for a comprehensive outpatient benefit package. Another transition that we are coming out in the year or two is the libreng PhilHealth gamot. This will increase the number of PhilHealth gamot that we cover for now under the Consulta, which is like 21 essentials drug list to around 55 essentials drug list that will be provided by PhilHealth. So the amount for the PhilHealth gamot that we are looking is for the gamot 1.5
Total amount.
for the 2024, once we come out with the PhilHealth gamot, the amount that we are looking into is around 5 billion increase in the amount that we can pay actually, Mr. Chair.
So 5 billion increase in the total budget.
Yes.
But here's the thing, okay, nung June 26, kayo na rin nagsabi, ang talagang amount na pwede per patient is around 3,500 pesos. Why can it not be done right now? Why do you still have to wait 1 to 2 years' time? If my computations are correct, that is around 50 billion pesos so that we will be able to provide a comprehensive package. Can you at least provide us a roadmap or a commitment that maybe if you're able to provide a 90-day fulfillment backlog, can't you do this already, also within the 90 days, starting with day 1 now?
Yes, Madam Chair, we actually have a benefit plan, and so from Consulta, plus the addition of the PhilHealth gamot, plus the later on to a comprehensive outpatient benefit package. The benefit plan is actually by 2025 or 2026, we already have the comprehensive outpatient benefit package, Mr. Chair.
No, you're not answering the question. I asked if you could do it within 90 days, not within 2025. I don't think the Filipino people could wait until 2025 for a comprehensive package.
Res. Mandy?
Thank you, Mr. Chair. To answer your question, Mr. Chair, we are still doing a study for the comprehensive benefit package. So, I don't think we want to see the results of that study first, sir, Your Honor.
I'm sorry. I have to. No, I'm sorry. I can't accept that. And then just I know Mr. Chair is here, but I cannot wholeheartedly endorse this kind of budget proposal. Yeah, because 2 years pa, saka lang natin gagawin. Already nung June 26, sinabi ninyo 3,500 pesos is already sufficient. So we could already work with what you committed nung June 26 of this year when we talked about it in the Committee of Health, that you should be able to provide this Consulta package.
Sir, yes, thank you for that, Your Honor. We will come up with a improved benefit package, Your Honor, within the year, within the next 4 months po. Within the next 120 days po.
Yeah. I have to agree with what my colleagues are saying. Why do you need to augment it? I mean, it's clearly you are profitable. they might not actually even be needed for a subsidy. Maybe it's better if the subsidy will be already placed sa mga medical assistants namin that we'll be providing to our constituents, because we are the ones who are on the ground, and we are the ones who are able to respond to it in a timely manner. So, in between the 27 billion that is the backlog here, and then here you are profitable even with a subsidy. I'm sorry, I can't, Madam Chair, I can't endorse this
Your Honor,
proposed budget that PhilHealth has.
Your Honor,
Yes, Mandy.
Your Honor, with all due respect, can I just make a quick comment? Your Honor, just to clarify, we are not asking for subsidy. We are asking, Your Honor, for premium payments.
Press,
It's not,
Mandy.
yes po.
It is a subsidy.
It is a
So,
subsidy.
you don't need to say anything else. Can you wrap up?
Yes, Madam Chair, yeah, there's still a lot of questions. Maybe I'll go for another round. Yes, thank you.
Thank you.
Thank you, Your Honor.
Madam Chair, quick interjection, please. Yeah. For the record, this is to reiterate our intention that PhilHealth will just focus on purely curative care, and that preventive and promotive care, like the Consulta package, should instead be lodged before the Department of Health. Just at the proper time, Madam Chair, I would put that into a motion.
Right, thank you. Next to interpolate is from the minority. We have the Assistant Minority Leader, Marisa Magsino.
Good afternoon to our Chair Saldico. Good morning pa po. Good morning to our Department of Health family, to our colleagues. Good morning po. Our OFW party list has been bombarded with a lot of complaints and calls from our health workers who are already living and working abroad after the pandemic. Under Republic Act number 11469, or the Bayanihan to Heal as One Act, and Republic Act number 11712, or the Bayanihan to Recover as One Act, private and public health workers who contracted or died from COVID-19 infection while in the line of duty will have to receive compensation benefits as well as emergency public health allowances while fighting the epidemic. The compensation benefits are made po retroactive to February 1, 2020, and the emergency allowances to July 1, 2021. For this year, 19,562,172 is allocated for the payment of these compensation benefits, including arrears reckoning 2020 in accordance with Republic Act 11496 and RA 11712. Madam Chair, as of this date, how much of this allocation has been paid to qualified health workers as compensation and/or health emergency allowance, including those in arrears from 2020, Madam Chair?
Secretary.
Thank you, Madam Chair. For the health emergency allowance for healthcare workers, we allotted 22.8 billion in 2022 and 19.8 billion in 2023. And our obligation for the 2022 was already 99.87%, and our disbursement is 97.66%. For the GAA of 2023, we have also reached 99.66% obligation, but only 71.89% on disbursement. So that's the current state. We are also had requested additional money for because the total requirement is 63 billion. So with the allocation in 2022 of 22, and then 19 for 2020, and then another 20 billion this coming for the NEP, we hope we can get some more funds for the unprogrammed funds this year. So last April, the department actually wrote the Department of Budget and Management, and we're still awaiting their approval of a few billion pesos from the unprogrammed funds of DOH to be used for healthcare worker emergency allowance.
Madam Chair, thank you for that, Secretary. So the amount is not sufficient to satisfy all the obligations of the government for the payment of COVID-19 compensation and our emergency allowances to our qualified health and non-health workers, including arrears in compliance with RA 11496 and RA 11712. So that's very clear. Are there claims that remain, that there are remaining pending due to questions of eligibility of the supposed beneficiaries, yung claims po ng pending due to questions of eligibility of the supposed beneficiaries. How much is involved in these pending claims and what are the chances that they will be finally processed and the benefits to be released po to the claimants? Madam Chair.
Secretary?
Yes, Madam Chair, there are pending claims with problems in terms of disbursement and eligibility. And but all those that were involved, that were able to document their involvement, have already been disbursed and allocated. Maybe I can pass the mic to Undersecretary Carol Taño, who's in charge of the payment of the health emergency allowance. You say, Carol?
You say, Carol?
Magandang maga po, Madam Chair and Your Honor. Yes, we have unpaid claims for all those non-eligible po. Ibig sabihin po, kulang po sila ng mga certificate of eligibility. But after satisfying all the requirements, we will request it to DBM because that's a supporting document for the DBM to release po. And we have also released a department circular regarding the claims for those who are not present, yung mga nasa abroad po, FW. Meron na po tayong guidelines on that.
Madam Chair, so for 2024 po, there is a big, again, proposed budget of 19,962,172 for the payment of the COVID-19 allowances and compensation of eligible healthcare and non-healthcare workers, including arrears po ng July 1, 2021. However, RA 11712 provides that the benefits granted under it shall remain applicable only during the state of national public health emergency, as declared by our President. On July 21, 2023, President Marcos issued Proclamation number 297, lifting the state of public health emergency throughout the Philippines due to COVID-19. Madam Chair, my question is, how much more arrears from 2021 are to be covered by the proposed budget? Madam Chair.
Madam Chair, our gap for the remainder of the arrears, so we stopped giving when the public health emergency status has lifted, so the giving of health emergency allowance is no longer counted. So the counting is stopped. But up to July, our gap is 46,363,904,970.67 centavos. So this is still the gap, even with the net of 2023. So we've requested a certain amount, but not all, to DBM because we are expecting also the processing to be slow. These later claims that are slow are coming from our private hospital facilities, and I think their documentation is not as good as the government healthcare workers, which gave us complete. So our percentage of healthcare allowance for government healthcare workers is above 93%, I think. Yes, sir.
Madam Chair, isn't the proposed budget of 19 billion too much in excess since the payment po of the compensation and emergency allowances are already terminated with the lifting of the state of the national public health emergency since July 2023 by President Marcos?
Secretary?
Madam Chair, those are arrears. The 46 billion gap is actually arrears of the total number of healthcare workers who actually served during COVID. So these are unpaid since 2021, 2022, and 2023. So actually, if you compute the total funding requirement for the arrears as of July, when the was lifted, it is a total of 112,575,827,120.22 pesos. So what have been released so far in the GAA of 2022 and 2023 is a total of 46 billion.
Okay.
So what I stated was the gap that still has.
Madam Chair, I'll have to go on with the personal services. For 2024, DOH has a proposed budget of 36,382,144 for the basic salary of all its authorized permanent positions. However, there is a line item under the category of other compensation for specific groups labeled lump sum for filling of positions with a budget of 10,059,468. The question is, this is a lump sum allocation, meaning its specific utilization will still have to be identified, hence with a lot of discretion coming into play. Is this correct, Madam Chair?
Secretary?
Madam Chair, this is correct. There are salaries and benefits for newly hired, a total of 9,616 workers in the department with the amount of 6.9 billion pesos. But there's still a difference, no? Because we still require an amount, the deficiency of 1.5, especially needed. I think we source some of it from the Magna Carta benefits as well.
So, Madam Chair, so these 9,000 plus positions that will be established, may we know the nature, temporary, contractual, job order, and which specific group will benefit from this allocation, Madam Chair?
Madam Chair, these are plantilla items.
Okay. So, Madam Chair, I noticed, okay, this is one last question po. I noticed that for 2023, the same line item has a similar budget of 9,282,893. What is the rate of the utilization of the budget for 2023 and this proposed budget a continuing appropriation? If so, up to when? And is there any possibility of making them permanent positions, Madam Chair?
Secretary?
In general, our CONAP for 2022 reaches above 90%. So the 2023, I think we still have to look at that, because PS there's no CONAP, I think, because it's plantilla. So once the item is filled up, that's already dispersed.
Thank you, Rafa.
Can I interject with a question with regards to Honorable Magsino's question? May I just get an idea on when the health emergency allowances would be distributed? Kasi meron pa rin pong mga health workers who need it.
It's ongoing. What the Department of Health does is to sub-allot to the regions, and the regions have they have the listing for all the hospitals. And then if the hospital's documents are complete, the hospitals are paid.
How about po for the barangay health workers,
Ano bang barangay?
Madam Chair?
Also the regional, it's also allocated to the
So it
region.
is ongoing, Madam
I guess they will have to have a MOA with the local chief executive.
Thank you. Thank you very much.
Thank you. Madam Chair?
Yes, please wrap up.
Question po, how much did FDA propose to DBM for its MOOE for 2024? Is it higher or lower than the 515,032 billion as reflected in the special provision number 4? Is it sufficient for the FDA in the implementation of its programs and operations, Madam Chair?
Thank you. And those are your last questions, ma'am.
Yes.
Secretary?
We have our FDA chair, the Director General Sam Zacate is here. Ay, lumabas ba? Director Farinas will answer. I think our DG stepped out.
Yes, please. Your name and position.
Good morning, Madam Chair. I'm Dr. Irene Farinas po from the FDA Policy and Planning Service. To answer po the question of the Honorable Congresswoman, the Tier 2 for the MOOE of the FDA has a total of 517 million po. More than.
Yeah. Just a comment, Madam Chair.
Yes.
If the proposed MOOE of FDA is insufficient for its programs and operations, why do we not utilize the huge balance remaining in the said fund, which is primarily intended by the existing laws to support the MOOE of FDA, Madam Chair?
Thank you, and that was really your last question, okay? Please proceed.
Yes po.
Madam Chair.
We have enough funds po for the MOOE po.
Thank you. And we now proceed to the next. We have our Deputy Majority Leader, the Honorable Wilter Palma.
Thank you, Madam Chair. Fellow workers in government, good morning. I was reviewing your budget or NEP. Your NEP is 204 billion as against 2023 GAA 214 billion. So there's a difference of 10 billion. What is your contingency plan, Mr. Secretary?
Secretary?
We have appealed. We actually appealed. We have a set of appeals, and we prioritized services that might be affected with said appeal. So we appealed first with DBM when the NEP was cut, and then we're appealing now to the House and the Legislature for this subsequent budget to be reverted back to the remainder.
So are you comfortable if we'll just be on the level of 2023 to restore the 214 billion?
Maybe the analysis should be set, Madam Chair. The biggest decrease is actually the medical assistance for indigent program, about 10.37 billion, which is the 32% decrease. And the second one is your health facilities enhancement, 3.8 billion, which is a 14% decrease. And then the others are for communicable and non-communicable diseases, 1 billion each, PCCD and FDA, which is a 53% decrease in terms of budget.
I'm sorry. My question is, are you comfortable on the 2023 level, which is 214? Yes or no? Kasi pag no kayo, hayaan natin ang 204. Ayaw nyo ng increase.
We want more increase because we want more services.
There you go.
For the
Just answer
Filipino
me yes
people.
or no na lang para...
Yeah.
So, I'm appealing to my colleagues here, if you can restore that 10 billion, make it to the level of the 2023. Because I'm looking here, the MAIP, from 32 billion to 22 billion. This help us a lot as politician. Malaking tulong ito sa amin as compared before na wala tayong MAIP. Now, I'm appealing also, in the event na the 2023 level will not be restored, can you please increase the MAIP also and sacrifice all the other program? Would that be possible, Mr. Chair?
Yes, we can look at the way other programs are spending. If they have low utilization, we can actually lower the amount for them and allocate it for MAIP, which is very useful to our indigent patients.
Yes. You mentioned utilization. What is our utilization per program?
I don't have the per program utilization, but we can submit, Your Honor. We can submit the per program utilization.
Overall na lang.
Overall, for the 2023, we're at 75% obligation rate.
Disbursement, sir?
Disbursement is lower, I think 60 something, 67.
67?
I'll give you the exact figures. 59%. Disbursement is 67%. That's correct.
Yeah. Do you think we can allocate or obligate and disburse before the end of the year?
Yes, we're usually able to catch up with the programs on catch-up programs for disbursement and obligation.
Okay. In the procurement process, what is the system now of the duets? Is it centralized pa rin? Or are you downloading it to the regional office?
There are procurements that are done centrally, and there are procurements that are allocated to the region. So those that with, for example, the big programs like the vaccines, for example, and drugs for cancer, for TB, for HIV, we still do that centrally. But the others, like for example, health facilities sometimes are better downloaded because the local contractors are the better ones to fulfill the commitments. So we have a balance of some centrally procured, some put out to the region, allocated to the region.
How about the supplies?
Some are centrally procured, some are also allocated to the hospitals or to the regions.
Yan na, Mr. Secretary, with all due respect, pag central office yung nagpo-procure, ang bagal ng procurement process natin. So I'm suggesting, yung mga fast-moving and necessary, ibigay na natin sa regional office. Will
Yes,
that be
Your Honor.
possible, Mr. Secretary?
Yes, Your Honor, we will do that.
Can I expect that?
Yes, Your Honor, we will do
Okay. Anyway, we still have one more year to go
that. Yes.
as member of this 19 Congress. Okay?
Okay naman yun.
Another thing is the health facilities. Mababa yung ano eh. And by the way, my good friend, Doctor, what is the utilization rate of our health facilities?
So, overall, for 2023, we were allotted 26 billion, 26.7. We've already obligated 11 billion and dispersed 1.3 billion. So it's a 43% obligation, or 43.95. And our disbursement is so much lower at 11. This is because of progress billing. The contractors are paid based on performance.
That is as far as 2023 is concerned. How about 2022?
For 2022, we were allocated 22 billion, 22.9, almost 23 billion. We were able to obligate 84.6%, and we have disbursed 59%. So these are all continuing appropriations and ongoing construction.
So we are already in the 2023, and yet ang 2022, mayroon pa bang 2021, 2020, 2019?
Konti, may 2021 na konti, kasi 7 billion lang po, Your Honor, and 96.97 na ang obligated doon sa 2021, at 85% dispersed na. So, bayad na. Yung mga may problema na lang ang hindi nababayaran or nangako.
For 2022, it's 84%. That's obligation.
Yes, Your Honor.
Disbursement, magkano?
59% only, Your Honor.
Oh, we are about to end the 2023. Tapos backlog na naman tayo. Can we do something about it?
Yeah, so we have a catch-up plan. This is usually all delays in construction, so delay also in disbursement, because we pay based on progress of the work of the contractor.
Okay. I'll take off from your statement, Mr. Secretary, the delay in the construction and the delay in the payment also. Correct?
Yes, Your Honor.
Yes. You know why? If I may be allowed to suggest for the good of the Department of Health, construction and constructing buildings is not within your purview, right? It's not your forte. So may I suggest, if this would be possible, let the DPWH do the necessary bidding, construction, supervision, turnover, para mabilis yung turnover ng buildings natin, ng mga facilities pala.
We are agreeable to that, Your Honor. We are agreeable to downloading it to DPWH for construction purposes.
For the 2024, can I expect that, Mr. Secretary? Because some of our colleagues are also expecting that.
Actually, I've communicated in the cabinet to Secretary Bunoan about my desire to actually transfer to him what he wants to accept. Of course, he also has limitations. He said there are so many projects already, but if it is simpler, we will actually be willing to download to DPWH all the HPEP construction.
Yeah. We welcome that, Mr. Secretary. May I appeal to the good chairman here that if you can, the Honorable Saldico, if you can put that in the special provision of the GAA, would that be possible, Mr. Secretary?
Yes, Your Honor, we will be acceptable to us.
And thank you for that. No, we welcome that development. I have no more question. Thank you for your time. Yun lang kasing... by the way, before I let, I still have mga 1 minute pa? 2 minutes. How about those attached corporation? It seems to me na it's only PhilHealth and PITAC ang nag-increase. All the others, National Kidney, the Lung Center, that's and so on and so forth, nagbawas. In short, bawas din ang serbisyo natin.
Your Honor, hindi naman. These are, NEP levels are the same and the operating expenses are covered. Luckily, we have MAIP, so even with the delayed payments of PhilHealth to our corporate hospitals, we are able to go above water with MAIP funds that are for patients or indigent patients served by our government-owned controlled corporation hospitals.
Mr. Secretary, I don't want to mention sana, but since you mentioned about MAIP, may be allowed, Mr. Chair, this is as far as the professional fees concerned. We're having a problem with the PF of the doctors. Kasi indigent na nga, dinala dito sa Manila, tapos yung mga consultant natin, hindi tumatanggap ng guarantee letter. Can we do something about it? Pwede ba i-charge sa MAIP yung mga PF natin?
Your Honor, we already have a modified rule. 50% of professional fees of indigent patients who are admitted in private hospitals because there was no available bed in the government hospital is already allowed. Unfortunately, it's some of the doctors who don't want the letter of guarantee. They want cash. They want cash. So, some do not accept. But some also accept.
Mr. Secretary, maawa naman kayo sa congressman. Sa amin lahat pumupunta. Selling out 100, 200,000 for the professional fee. Anyway, before I end, Madam Chair, I just want to comment the different directors, particularly the National Kidney, the Lung Center, the Philippine Heart Center, the PCMC, and the PITAC for the job well done. You continue your passion. Malaking tulong sa mga Filipino people that are seeking medical assistance. If I have my way, I would be making a motion to restore the 10 billion difference between the 2023 and the 2024. Thank you, Madam Chair.
Salamat, Honorable Palma. The next interpellate is the Honorable Eileen Brosas. Who is not here, so we move to our Deputy Minority Leader, Franz Castro.
Thank you, Madam Chair. Magandang umaga po sa pamilya ng DOH. So, yung question ko po, no, yung implementation ng salary grade 15 sa ating mga nurses. So, tanong ko lang po, no, fully implemented na po ba itong salary grade 15 sa lahat ng ating mga nurses sa ating mga public hospitals po?
Yes, Madam Chair. Yes, Your Honor. This entry-level salary grade 1 is by Republic Act and it's now being implemented.
So, sure po kayo, wala nang naiwan po?
Some hospitals actually accept job order first when there are no plantilla items. So that's probably why some government health workers claim they are not yet in the plantilla. So once the plantilla item is vacated, the salary grade 15, they are promoted to that particular salary grade.
Thank you, Mr. Chair. Secretary, Madam Chair, magkano po yung pinapasweldo natin sa ating mga contractual nurses?
So we for job order, we do the salary grade 16, right? 16. Salary grade 16 levels. Yeah, so it's at 39,672 pesos a month as basic salary.
Yan po yung salary ng mga contractual and job order?
Yes, ma'am. Yes, Your Honor. in Department of Health.
So, yung mga salary ng mga job order and contractual are the same with the salary of salary grade 15, yung ating mga may plantilla position.
Yes, Your Honor. The usual rule is we use 20% higher than the salary grade for plantilla if it is contractual.
Okay, that's okay. So,
They will pay for their own benefits.
according to the National Database of Human Resource Information System, meron po tayong 13,975 contractual nurses. Do you confirm that?
These are nurses that are the National Deployment Program. Nurses that are deployed in support of local government units. That's correct, Your Honor.
Local government unit po ba ito? Yung 13,975? O sa mga hospitals natin sa national?
Yeah, that's under that program, we deploy them to LGUs that do not have human resources for health.
So ang sweldo nila, Madam Chair, ay 39,000. Salary grade 15.
Yes, Your Honor.
Okay.
16, salary grade 16.
So, tignan po natin. So, ano po yung position ng DOH regarding DBM BC 2020-4? Kasi nakita natin dito na excludes yung mga nurses, including contractual nurses, sa implementation ng 9173. Kasi may alam po tayong mga information na hindi po salary grade 15 yung pinapasweldo natin sa ating mga contractual NGOs.
We'll have to check on that, but our policy is, if you're contractual, we hire them higher rate, which is the salary grade 16 instead of the plantilla 15. Because that's the policy of government. If you're contractual, we pay you higher so you can pay for your own PhilHealth, you can pay for your own other benefits.
So do we have unfilled position for nurses?
Yes, di ba? Unfilled. Yes, we have many unfilled positions for
How
nurses
many?
distributed all over the country.
How many po? How many?
I think 4,000. If I recall from memory, it's about over 4,000 that are unfilled.
Over?
4,000.
4,000. Pero ilan po yung contractual natin? 13,000. So, wala po ba kayong balak na i-fill in itong mga contractual dun sa plantilla positions?
The one that left the post must have clearance and everything.
So, ilan po yan, Madam Chair, Mr. Secretary?
The exact figure is 4,468 plantilla items for nurses, for unfilled nurses position as of June 30, 2023.
Can we have a commitment, Mr. Chair, from the DOH that this will be filled in na for 2024 or starting now? Ma-fill in na yon. Pwede po ba tayo mag-request na sa DBM ng authorization for it?
Yes, it's open. Hospitals actually hire immediately once there is an applicant. For the information of the Madam Chair, before we used to have a what you call a queuing list of nurses applying for vacant positions. So there was no problem for unfilled positions. The moment someone resigned or left for abroad, there was a nurse. Unfortunately, if we ask our hospitals now, that waiting list is gone. So we've scraped the bottom of the barrel. So we wait until a nurse. Recently, we had 10,000 nurses that passed the nursing board. So if not all of them will go abroad, these items are open for them.
Mr. Secretary, sabi nyo nga, sabi nga natin, meron 13,975. Ang open position natin ay 4,000. So bakit hindi ma-fill in? At ba't sinasabi ninyo walang mag-a-apply, walang nag-a-apply man ng mga nurse? Available po yung mga contractual nurses natin, di po ba? Bakit hindi sila yung i-fill in doon sa mga plantilla positions?
Yes, Your Honor. Yan
Mr.
naman ang ginagawa.
Secretary, earlier you said sila po ay assigned sa LGUs.
New
Tama
nurse
ba?
deployment.
Yun na nga,
Nurse
yun na.
deployment
So
program.
is it because meron tayong devolution transition plan kaya hindi nyo ginagamit yung unfilled positions?
No, kasi yung mga items, the unfilled plantilla are in the hospitals. So sometimes the nurse item is very specific. So it's an OR nurse or an ICU nurse or an ER nurse. Not everybody applies to those positions if they don't like the job. If the nurse doesn't like to work in an ER, they will not take it.
Honorable Castro.
Imposible naman po yun, na talagang, alam niyo po ba, scarce na scarce tayo dun sa mga nurses sa ating mga hospitals. At mayroong hospital nga po, nag-a-allow ng private designated nurse. Kasi kulang yung ating mga nurses sa mga public hospitals. So, hindi ko malaman yung logic, bakit hindi ma-fill upan itong 4,000 na ito, at nananatiling nakikita natin sa mga hospitals, kulang na mga nurses, kulang talaga ng mga nag-aasikaso sa mga patient, and even, yung mga pasyente, sila pa yung nag-incur ng bayad doon sa mga caregiver, yung private na mga caregiver, at saka mga private designated nurse. Alam niyo po ba yan na may mga ganyang hospitals na merong private designated nurse na binabayaran pa ng pasyente. Kahit na nga po merong GL So mabigat pa rin po sa pamilya yung pagbabayad ng mga private nurse. And yet, meron pala tayong mga position at kailangan natin mag-create pa siguro from the DBM, mag-create pa ng mga positions na kailangan ng ating mga hospitals. Madam Chair, Mr. Secretary.
Yes, Madam Chair. So, the plantilla items are open for registered and licensed nurses to apply to. However, on our computations, we actually see that we actually have a nursing gap of about 127,000 nurses. That is our nursing gap at 16 nurses per 10,000 population. So, kulang pa rin po talaga. So that's the reason why we are seeing hospitals na may vacant plantilla item for nurses. I came from Philippine General Hospital, Your Honor, before I became Secretary of Health. The situation in the emergency department is that one nurse is taking care of 20 emergency patients. And I asked the chief nurse, why can't we hire new nurses? And the answer to me is walang nag-a-apply. So, we hope that we can increase the nurses. The CHED has already removed the embargo for new nursing schools. So this is one solution. It's already the source of the production of our nursing graduates. So they had an embargo, so they released it. Some nursing schools will now increase the number of nursing slots they have.
So imposible po na sabihin natin walang nag-a-apply. So, hindi po ako naniniwala na merong nag-a-apply. In fact, may mga contractual nga po Kaya, hindi ako naniniwala na walang nag-a-apply na mga nurses, considering na siguro maliit pa yung sweldo, pero meron po yan na nag-a-apply. May I ask, Madam Chair, that DBM, Madam Chair, is there a representative from the DBM?
We have DBM Director Sofia Abad. Ma'am, there's a question for you.
Actually, isang numbers lang ang tinitingnan nyo. Oo. Tsaka,
Yes,
minsan ayaw
please.
nila magtrabaho sa ospital na malayo.
Page, pakitulungan na lang si ma'am. Hanapan ng mic.
Oo, yung plantilla sa ospital. Yung dineploy natin contractual public health.
Good morning. Good morning, Madam Chair.
Okay. Meron po tayong, Madam Chair, meron po tayong unfilled position na 4,000 sa DOH. At may kakulangan nga tayo, sinasabi na 127K nurses ang kailangan natin. And there are contractual nurses na 13,975. Would you authorize DBM to fill in this 4,000 vacant position or plantilla position for nurses? Would you authorize?
Yeah. Foremost po, let me just introduce myself. I'm Sofia Yanto Abad from the DBM, Director of Budget and Management, Bureau B. Actually, that concern is lodged with another bureau, the OPCCB, but let me just clarify that under the rules, there is no authority needed to fill up the positions. Because once the positions have been created, you just have to fill it up.
Hindi, pag binaki.
Yes, Madam Chair, malinaw. Hindi naman kailangan ng authorization. Bakit sinasabi, Madam Chair, ng secretary natin na kailangan pa ng authorization? 4,000 ito. 13,000 ang JOs.
Secretary?
Yes, Your Honor. If the item is a new plantilla item given by DBM, there is no need for authority to fill. But it is an item used by a nurse who left for abroad. Clearances have to be made, and it takes about 6 months for that to be filled up. That's the weight we have in the hospital. The other thing I'd like to explain, maybe it's good that our Honorable Congresswoman understand that the 13,000 contractual for nurse deployment in the LGU is our public health nurses. So this is because they are assistants to the LGU. It's not plantilla. It is a programmed support to local health system so that they will have public health nurses. Yung kakulangan natin, nasa hospital nursing. It's working in the public hospitals. Many of our nurses, kung minsan ayaw magtrabaho sa government hospital kahit mataas ang sweldo, kasi po talagang maraming pasyente. Marami po talaga yung patients na compared to working, let's say, in a private hospital where the workload is lower.
Madam Chair, i-redirect ko lang, no, ang pinag-uusapan natin dito, yung 4,000 na plantilla position for nurses. Malinaw naman po na hindi naman kailangan yung authorization. So, meron tayong 13,000 na job order. So baka pwede na nating i-fill up from that 13,000, itong 4,000 na ito. Hindi naman kailangan ng authorization eh. At sinasabi din ng DBM dito, hindi na rin naman kailangan yung clearance for as long as, katulad sa teacher, pag nag-announce po na may bakanting ganitong number of position sa teacher, pinipill up na agad yun. Hindi na sila natin nagtatanong sa authorization from the DBM.
Your Honor, the public health nurses who are on contractual basis are free to apply in the hospitals if the plantilla item is in the hospital. But the program of the nurse deployment is all contractual. And I've met some of them. They've been contractual for 10 years. Maybe it's about time we institutionalize it and put plantilla items on this program. Normally, when we give a deployment for a nurse in a local government, we hope that the LGU would actually absorb them if they already have. But some LGUs really have no funds. So this is the support of national to help improve public health nursing in local government units.
Madam Chair, nalilito po ako, no? Nalilito ako doon sa sinasabi ni Secretary. Simple lang naman ang sinasabi ko, may 4,000 na vacant and filled plantilla position for nurses. May 13,000 ka na tingin ko naman merong 4,000 dito na willing na maplantilla. Ba't hindi ito mapilapan? Bakit sinasabi pa natin yung may pagkakaiba ba yung public health nurses doon sa sinasabi niyong LGU na mga pangangailangan sa nurses? So yung tanong ko lang po, mapipilapan niyo ba itong 4,000 na ito? I-fill up niyo ba yung plantilla position for this?
Yes, Your Honor,
out of those 13,000?
We will fill them up as long as there are applicants to these plantilla items.
Okay. Siguro dahil sinasabi ni Madam Chair, tatapusin ko lang itong topic na to and I will register for a second round for other topics. Sabi nyo kanina, kung mayroong nag-a-apply, sige, bigyan nyo nga po ako ng listahan ng mga ospital. Kung walang mga nag-a-apply, bigyan nyo po kami dito ng listahan. Lahat ng hospital na wala talagang nag-a-apply na mga nurses para malaman natin na wala talagang nag-a-apply. Kung wala nga nag-a-apply, Madam Chair, itong 13,000, pwede na yung i-fill in doon kung gusto nila.
Mr. Secretary?
Yes, we will supply
to submit the
list. Yes.
If you have it with you now, we can have the page pick it up from you.
We will supply the list, Your Honor.
Thank you, Madam Chair. Second round po.
Thank you. Next to interpolate from the majority, we have the Honorable Salvador Plato.
Thank you, Madam Chair. To our friends from the Executive Department, Secretary Ted, Bosa, and the DOH family, our dear colleagues, magandang umaga po sa inyong lahat. Kanina sa accomplishment nyo sa 2022, nakita ko rito in 22 year-end accomplishment. Doon sa, I'm concerned daw sa MAIP, yung medical assistance to indigent patients. 2.8 million patients noong 2022, nakalagay dito, Mr. Chair, Madam Chair. Hindi yata nakikinig si Secretary.
I'm sorry, Your Honor. Someone was talking beside me. So, may I request Your Honor to repeat the question? Sorry.
Repeat daw ang question. Nakalagay sa report nyo, 2.8 million patients ang na-serve ng Medical Assistance Indigent Program na napakagandang programa ng Department of Health. Ilan po ang hindi na sa Region 3, sa Bulacan na lang po, in particular sa aking district, sa 6 district, siguro may kopya kayo, si Director Bilos, siguro meron, no? Kaya yung mga napakagaling na mga staff niyo sa Region 3.
Your Honor, I will refer you to ASEC Sharade Granda. She's looking at our big charts for the MAIP program. Bulacan?
Hindi na kabilang sa oras ko ito, Madam Chair, ha? O sige, yung ko na lang, kung mahirapan po kayo, yung sa 2023, mas concerned ako up to June 30 na lang, yung June 30.
Your Honor, up to August 31 for Bulacan, the 6th district, we have allocated, the grand total is 31 million pesos.
Ano, ang tinatanong ko yung ano, kasi malami ako niyan eh. Maraming binigay sa akin yan, kaya doon ako papunta eh. Ilan yung natulungan natin kasi nagpapasalamat nga sila sa Department of Health. Sa napakarami, umiyak sila na nagpapasalamat sa tulong na ginawa nyo. Gusto ko lang malaman yung ilan. Yung as of June, kahit noong August, June 30 na nga hinihingi ko, meron na pala kayo August. Maraming salamat kung meron na kayo August, napakarami na po yan. Ilan na po ang natutulungan natin? Hindi yung amount, tinatanong ko yung bilang ng patients na mahihirap. Kasi, you know, Mr. Chair, yung aking area, we have 5 resettlement areas doon sa Norsagaray, sa Santa Maria na napaka mahihirap. Kaya magsalita tayo dito sa wikang Tagalog kasi sa ating sariling wika kasi napakarami nakikinig na mahihirap. Ang pinag-uusapan natin kasi kalusugan po eh. Kaya napakarami nakikinig ngayon nasa Bulacan na mahihirap nating kababayan.
So, Your Honor, Madam Chair, we have already allocated 2 million, no? 2 million patients for 2023.
No, yung bilang lang po ng natulungan natin. Kasi yung amount alam ko na po yun eh.
Ang meron po kami figure ay 143,000 patients. Pero Central Luzon po to. Region 3. Isasabit po namin sa inyo yung sa Bulacan.
Kaya ko po tinatanong to, Madam Chair, Secretary, kasi pinaabot sa iyo, lalo na sa nakaraan yung staff ng DOH, yung mga taga-regional office, sa mga support na binibigay sa amin, nagpapasalamat po sila sa tulong po natin. At, you know, the Medical Assistance to Indigent Patients, my program, under the Department of Health, has saved countless lives and provided financial aid to the health and hospitalization concerns of our constituents, especially in the province of Bulacan and in my area, the 6th district of Bulacan. May tatanong lang po ako kung siguro ito rin ang concern lahat yung sinasabi ni Congressman Palma kanina eh. Gusto namin mag-inquire. Nabanggit na namin kay Peace Speaker ito eh, at saka kay Secretary, wala na ba si Chairman Saldico? Tungkol po sa if we can utilize funds, if we can devote funds to provide yung pambili po ng mga assistive devices such as wheelchairs, quad cane, and the likes, as this is frequently requested and needed especially by our senior citizens and PWDs. At saka po isa pa, if we can use portion of our MAIP to purchase medicines and medical supplies that most residents need, particularly maintenance medicines for the seniors and those who have ailments that requires monthly intake of medicines. Alam po nyo kasi napakaraming, nabibigyan din po kami ang Region 3, saka yung mga, kaya kulang po talaga, Secretary. Kaya pondo naman namin ang gagamitin namin eh. Napakarami kasi akong pondo, hindi sa pagyayabang. Isa ako sa pinakamarami sa MAIP siguro. So, bibigyan ko kayo. Can we utilize that to purchase assistive devices? Kasi hindi kulang yung binibigay yung mga gamot po eh. Baka pwedeng, kayo na bibili, kayo naman talaga bumibili. Kayo na rin mamimili, basta within my district, kasi ang bili natin Pangulo, unity, tulungan natin lahat. Regardless of political persuasion, itanong nyo sa distrito ko, lahat pinagbibigyan ko, kahit yung mga, lalo na yung mga inuuna ko yung hindi bumuto sa akin. Totoo po ito, Mr. Chair.
Secretary?
Madam Chair, pwede naman po, pero as of now, the rules for MAIP is really for hospitalization and medicines used in the hospital. In fact, what we do is, we even allow na pag discharge nila, meron silang 1 month supply. Pero hindi talaga siya nagagamit for the outpatient. For the assistive devices, my recommendation is magkaroon talaga ng program on assistive devices. Kailangan kasi ng wheelchair assessor. Hindi naman basta hiningi ng pasyente, kailangan
magbigay kayo.
bigay nila. So magkakaroon tayo ng program.
Magbigay kasi kayo, isa, dalawa lang. Kaya ito, bibili na nga tayo, pondo naman namin ang gagamitin. Can you find any, anong paraan? Can you find any ways na matulungan nyo? Kasi pondo naman ng mga congressman ito.
Yes, sir.
Kaya ako sinasabi to, this is for all our congressmen here concerned.
Yes, Your Honor. We will look for we will create the program for assistive devices.
Pwede natin asahan yan, Mr. Secretary, Madam Chair?
Yes, Madam Chair.
Thank you po. Maraming salamat po.
Salamat. Next,
Hindi pa ako tapos, Madam. Hindi pa tumutunog eh. Tumunog na ba? Another isang question na lang. Hindi pa tumutunog. Tumunog na ba? Isa na lang.
Sige po, last question po.
Kasi ito naman ay concern din lahat ng mga congressmen. The new program of constructing super health center is a very welcome improvement in our healthcare system. Sa aming distrito sa Bulacan, kailangan pa din ng pagtugon sa pangangailangan sa pangkalusugan ng mga mamamayan, lalo na sa mga nabanggit kong bayan ng Norsagaray at Angat, lalo na sa aking bayan sa Santa Maria. At nais ko pong linawin, dito kanina nakita ko si Secretary, Acting Secretary Berhere. Salamat sa naumpisa na po yung pinigay nyo na isang health center. Nais ko lang malaman at linawin kung ang mga doctors, nurses, midwives, lahat ng mga empleyado, tauhan ito na inilalagay ay saan po manggagaling at saka anong serbisyo ang kasama nito. Ang pinag-aalala ko po kasi ay kung may tayo na ito at wala namang doctors na may assign dito, anong mangyayari sa magagandang gusaling ito. Nais ko din po malaman kung saan magmumula ang mga supplies dito tulad ng gamot at iba pang pangangailangan upang maging in full operation ang napakagandang proyektong ito ng Department of Health. Thank you, Mr. Chair, Madam Chair. Thank you very much.
Salamat. Mr. Secretary.
Madam Chair, tama po yun. Madami tayong inallocate sa 6th District. Sa 2023, may tinayong health facility sa Angat. It is a super health center na dinidescribe natin for 10 million. At dito sa 2024, naka-allocate din po sa Santa Maria, another super health center worth 12 million. Pero yung pong MOA nito, the MOA requires that the LGU provides the health personnel. Ang tulong na binibigay ng national lang po ay yung infrastructure at some equipment. Yun lang, Your Chair.
Alright, salamat. Before I yield the chair, I would like to request PhilHealth for the following data in preparation for my interpellation para lang magamit ko yung 5 minutes efficiently. So pakilista na lang po yung aking data request. Total revenues, including premium collections, and then for benefit payments, total benefit payments, as well as by program. So yung benefit payments po for indigents, for senior citizens, for financially incapable point-of-service patients, unemployed PWDs, pamana, as well as for the use of the benefit package improvement totaling 20 billion. So may I have the breakdown of those actual benefit payouts for 2022? Paki-prepare na lang po yung data. Matagal pa naman po ako sa listahan. Thank you very much.
Noted po.
And at this point, I yield the chair to our Vice Chair, Nika Ko.
You got it. You got it all.
Thank you and good noon to everyone. Next to interpolate, we have Honorable Arlene Brosas from the minority.
Thank you, Madam Chair. Maraming salamat, Madam Chair. Madam Chair, let me go straight to my policy questions and concerns regarding PhilHealth, Madam Chair. Madam Chair, kung maalala ko, ipinatawag natin yan nung nakaraan na mga taon sa investigasyon, Madam Chair. Noong 2022 naman, noong 2020, sa isa pong Senate hearing, sinabi ng dating PhilHealth President and Chief Executive, Ricardo Morales, ito po yung history nun
Yes,
na nasa 10.2 billion ang potentially lost mula sa PhilHealth budget dahil sa fraudulent transactions and schemes. Sa parehong taon, ayon rin sa PACC, na 153 billion naman ang nawala sa PhilHealth dahil sa fraud. Now, yun po yung mga naging pagdinig, hearings before. Now, can the PhilHealth apprise us on these issues? Kasi nagbago na lang ng CEO ngayon ng PhilHealth, diba? I believe November po kayo na gano'n, no? Tapos July lang kayo umupo. Tama po ba?
Umupo po ako, Madam Chair, if I may. Umupo po ako nung
Madam
November
Chair.
28, 2022 po.
Madam Chair, before PhilHealth answers, may we request people in the Nograles Hall to minimize their noise kasi hindi po naririnig yung mga tanong ni Congresswoman Brosas.
Thank you po. So po, just to repeat my answer po, my appointment started po on November 28, 2022 po.
Thank you. Ito pa lang po ang tanong ko sa PhilHealth. How many, coming from those na investigations, meron po bang ginagawa ngayon ang PhilHealth or may ginawa na ba ang PhilHealth kaugnay doon sa mga investigations na yon? How many among your personnel and officials, Madam Chair, involved in fraud and irregularities have been charged by PhilHealth? How many have been found guilty and imprisoned? How many have been removed from office but reappointed in some other government agencies? And how many are still in PhilHealth? Yun po ang mga tanong ko.
Thank you po for your question. Madam Chair, if I may be allowed to ask my PhilHealth COO, Attorney Eli Santos, to answer the question po. Since I had just joined, no? COO, if you may.
COO.
Madam Chairperson, Honorable Representative, Arlene Brosas, to my knowledge, most if not all of the cases filed by the Ombudsman, based on the hearings conducted by the Senate and the House of Representatives sometime in 2020 and 21, most if not all, were dismissed, Madam Chairperson, but there are still ongoing cases. We will submit, Madam Chairperson, Honorable Representative Brosas, a formal update or report on this, Madam Chairperson, because at present we do not have the numbers, Madam Chairperson, please.
Yes, please, in preparation for plenary, Madam Chair, kailangan ko po yung mga detalye na ito. But how many are still in PhilHealth? Meron po ba kayong idea?
Madam Chairperson, Honorable Representative Arlene Brosas, some, if not all, of those investigated are still in PhilHealth today. One or two have resigned, Madam Chairperson. Honorable members.
Thank you, Madam Chair. Nag-aalala po tayo dito, Madam Chair, kasi kanina nga, di ba, nung tinanong po ng isang distinguished colleague natin na may trumiple yung pay ng top executives ng Philippine Health Insurance Corporation from 26.202 million in 2021 to 72.244 million the following year.
ito po ay mula sa financial statements ng 2022 ninyo. Parang ang nangyari ay na-rewardan pa. We continue to reward its top officials with big salaries and benefits despite unresolved allegations of fraud and irregularities. Ayaw po nating mangyari yon. So that is why I am asking po for the complete report nung mga nandyan pa, kung sino-sino. So, yung complete report na lang po, kung sino-sino yung nandyan pa at sino-sino yung may allegations noong 2020 to 2021. Madam Chair.
We will comply, Madam Chairperson. Honorable Representative Brosas.
Thank you.
Madam
Yes,
Chair.
President.
Thank you, ma'am, for the question. I just want to add, we will comply, no? We will comply immediately. But I just want to add po, yung triple ng salary from 2021, as mentioned by Dr. Ish earlier, parang ano lang yan po in-adjust lang nila in line with the GOCCs. So,
it means nag-triple naman talaga, di ba? Kasi parang in-align sa GOCC, pero kayo yung mga pinakamalalaki. Ang top executives talaga ang pinakamalalaki. Ang nakinabang dito. Okay. Totoo naman, di ba, lahat kasi salary, ano tawag dito?
Salary grade po, top order. Yeah.
Yes, gano'n naman yun. Pero ang nangyari, ang pinakamalalaki, sino yung kumikita ng malalaki, sila talaga yung magtatap palalo. Di ba, Madam Chair, yun naman talaga yung logic nung pagtaas. So, hindi ko po sinasabi na kasalanan nyo yun. Pero parang habang ang hirap-hirap po ng kalagayan ng mga mamamayan natin, merong ganitong pag-triple o pagtaas ng sahod o ng salary ang mga top officials ng isang GOCC, Madam Chair. Yun.
understood po. Thank you po. Thank you po.
Yes, thank you, Madam Chair. Yung next question ko po, the report please, Oo. Kung hindi po, mag-file po tayo ng resolution yan para
Ma'am, we will comply immediately.
mag-investigate.
Ma'am, we will comply immediately po. Promise yan po.
Thank you.
po.
Please also copy furnish the Committee on Appropriations.
Yes, Madam Chair, we shall do it. We shall comply immediately and furnish the committee po.
Thank you very much.
Thank you din po.
Before the plenary po. Ibig sabihin nun,
When is the schedule?
the
Sorry po.
schedule of the plenary will be on the second week siguro, mga ganyan. Second week or
Second
third
week of September po.
Yes, oo.
Okay.
So we need that before the plenary.
Yes po. Wala pa po time.
We don't have yet, but September 19 is the start of the plenary deliberation. So hopefully before September 19.
Okay. Yes po.
Yes.
Thank you, Madam Chair. Madam Chair, yung next question ko po ay sa coverage benefits, no? Based on studies, PhilHealth has lower coverage among poorest provinces and regions, like the conflict-affected provinces in Mindanao and BARM. Likewise, the PSA, National Health and Demographic Study noong 2022 po, showed that PhilHealth insurance coverage is highest among the rich household population. Based on this, can we say that PhilHealth is mostly benefiting the richer regions, provinces, and households? Tanong po natin dito, paano na yung mga kawawa nating mga regions? Hindi pala sila inaabot.
Thank you again for your question, Madam Chair. If I can allow CEO to answer the question, no? But ma'am, Honorable Brosas, I just want to...
Please address the chairman.
Sorry,
Yes, thank
Madam
you.
Chair, regarding the first request by Honorable Brosas, Madam Chair, we shall comply within the next 48 hours, no? The request of Madam Honorable Brosas.
Yes, Madam Chair, simple lang yung tanong ko Kasi yung region with lowest household population covered by PhilHealth insurance was BARM with 41.4%. Yung poorest provinces po have low population coverage. May senior citizen, may indigent, sponsored beneficiaries, pero members din sila. Mindanao also has the largest share of indirect contributors. Mostly indigent nga sila sponsored. Ngayon, sila po yung mga conflict-affected provinces, Maguindanao, Lanao del Sur, Basilan, Sulut, Tawi-Tawi. The least PhilHealth coverage is at 52% and below. So, ibig sabihin, sila yung hindi nakikinabang, Madam
Please wind
Chair.
Madam Chairperson.
Yes,
Honorable
Your Honor.
Representative Brosas, we understand, Madam Chairperson, the data. In fact, Madam Chairperson, at present, we are really pushing for the implementation of the consulta, that is the primary care. And we do not discriminate, Madam Chairperson, as to whether or not it's rich or poor. We implement equally the program, Madam Chairperson, Honorable Representative Brosas. If the data shows that, then we will redirect our focus on these areas, Madam Chairperson, Honorable Representative Brosas.
Madam Chair, last end question ko na lang po on
Okay,
maternal
your last
health.
question.
Yes. Madam Chair, what is being done to address and ensure inclusive maternal health care? Which line items in the DOH budget contribute to the implementation of the RPRH law and the prevention of adolescent pregnancies? Magkano po ang inallocate natin for the year 2024 dyan, Madam Chair? Gusto nating malaman kasi mataas talaga yung maternal mortality rate natin ngayon.
May I ask who can address the question from the DOH?
It's supposed to be the secretary, ano?
Secretary? Secretary?
Yeah, Madam Chair, the family planning budget is 1.5 billion in total in terms of commodities and goods. This also includes health promotion and adolescent health, Your Honor.
Okay. Thank
Madam
you.
Chair, general yun, ano? Family planning, hindi pa particular for reproductive health, ano? Madam Chair. So there's no items, particular item para dyan.
We already promised to actually separate the family planning as a separate item. We will make a request to...
Madam Chair, importante po yun kasi ilagay natin sa intelligence and confidential funds yung mga pondo natin, lagay natin as a separate item dito po sa maternal health program and reproductive health program natin, Madam Chair. Kasi kakapasa lang natin ng adolescent health pregnancy, no, na batas bill kahapon. Kaya maganda po sana na makita natin yung actual na paglalagyan nitong pondo na to. Thank you, Madam Chair.
Thank you.
Katulad po ng nung sinabi ni Congressman Lagman, sana maipasa sa atin yung particular item na yon. Thank you.
Thank you. Next, we have from the majority, Honorable Representative Bambi Emano.
Thank you. Thank you very much, Madam Chair, and mayong hapon sa tanan. Madam Chair, would like to follow up with the question of Representative Castro regarding the nurses. When COVID came, Madam Chair, I was governor of Misamis Oriental, and we hired a lot of nurses. May we know if where are those nurses right now, Madam Chair? DOH especially.
Can I also request for everybody to observe silence? Thank you very much.
Thank you, Madam Chair. Those are the nurses referred to by Madam Castro that are still deployed under and still employed as contractual and deployed to local government. So,
No, as I understood, Madam Chair, not all nurses were rehired. Some were let go by DOH, Madam Chair.
So, the answer given to me, Your Honor, Madam Chair, is that the salaries were increased so that the number technically decreased. So some were let go. So that's the reason. So we raised the contract of service.
So,
rate.
Madam Chair, does that answer the question of Congresswoman Castro? Because if the salaries were increased, meaning some of the nurses, they laid off. So where are those nurses as of now, Madam Chair? Because we lack nurses in all of our hospitals. But just a follow-up to the questioning of Congresswoman Castro. Let me proceed now, Madam Chair, to my second topic. Just a gentle reminder, because during the party allocation, I was able to discuss to the good secretary the status of our Northeastern Misamis Oriental General Hospital, we call NMGH. This is the status now, Madam Chair. That's 400 million, the one on the screen. That's 400 million. It was through an act, Madam Chair, 11721, approved by Congress, Senate, signed by the President, of the establishment of a Level 2 hospital to decongest Northern Mindanao Medical Center, that hopefully it will serve as a safe for all patients that will go to the city of Cagayan de Oro. As of now, this is the status, Madam Chair. Next slide there. That's 400 million worth, Madam Chair. Next slide, please. There. That's 400 million worth of funds from the DOH. And a gentle reminder that they committed, Madam Chair, during the consultation, that by October they will operate it into an infirmary. Can we get the officially on record the commitment of the good secretary, if they can really operate it with that status, current status, as of the moment, Madam Chair? Look at the pictures, Mr. Secretary.
Madam Chair.
Secretary.
Madam Chair, Your Honor, yes, we are confirming our commitment with our regional director. By October 31, we will start operations as an infirmary. And we also would like to appeal for the proposal to include the 40 million medical equipment, which was actually slashed and put to Tier 2. So we hope that we can get the budget for 2024.
Madam Chair, I'm requesting budget and hoping in the committee hearing we cannot bring this anymore to the plenary. But hoping, Madam Chair, is that good enough? They must commit, Madam Chair, because I will not be able to anymore ask them during the plenary. I must get a commitment today, Madam Chair.
Secretary.
Madam Chair, we commit at least to make it operational as infirmary, the equipment needed to make it operational.
Madam Chair, I thank the good secretary for the commitment. Madam Chair, supposedly it was started in 2021. They spent 400 million. For phase 2, supposedly they will spend another 450 million. For phase 3, 80 million. For phase 4, 350. For phase 5, 500 million. The 400 million, that's the outcome, Madam Chair. And when I scanned through the budget of the Department of Health, Madam Chair, I could not see the continuation for the second phase of 450 million. May I ask, Madam Chair, why?
Secretary.
We will propose for 2025, Your Honor, because it was deleted. We actually put it, but the DBM actually put it on what's called Tier 2. So they didn't put it in part. And when we put the 400 on 2025, we will make sure it's a MICA, multi-year contract authority.
But
so
Madam Chair, they will be operating it already by next year. And meaning, operational, around 80% the completion of the first 400 million. So we wait again for another year for them to allocate funds. I don't think that's fair, Madam Chair. I really do not think that's fair to the people of the islands of Mindanao, Madam Chair. It's either I get a commitment, Madam Chair, or I will be forced. And I thank already Chairman Karaps for the second. Hopefully, I will not need it, Madam Chair.
Yes, Madam Chair, we will commit and look for funds to actually allocate equipment for 2024.
Madam Chair, hopefully before plenary, I will already be able to talk to DOH. If they can visit the office, so I can get already how much they will be committing for the 2024 budget, Madam Chair. Would that be possible, Madam Chair, Mr. Secretary, sir?
Yes, Madam Chair. We will commit before plenary.
Madam Chair, no further questions. Thank you. Mayong buntag sa tanan.
Thank you, Honorable Emano. From the minority...
Yeah, Madam Chair, last. I would also discuss with them additional... they were able to supply us with the equipments needed for St. Paul Hospital. They promised us that they will give us the number that were listed. We were only delivered 6, so that hopefully will also be able to discuss in the office, Madam Chair. Will that be...
Honorable Secretary?
Yes, Your Honor.
Thank you, Madam Chair. Again, thank you from the bottom of our hearts, from the islands of Mindanao.
Thank you, Honorable Emano. Now we move to the minority with Honorable Representative Raul Manuel.
Thank you, Madam Chair. I also go straight to my questions. Madam Chair, na lang, I'd like to ask the Secretary regarding the pandemic, which one is correct? Is it correct na wala na po yung pandemic or may pandemic pa rin pero hindi na siya considered na emergency? Is it the first or the second?
There's no more pandemic. The WHO has already declared that the pandemic is over. But the disease, COVID-19, continues to exist.
Madam Chair, ito naman regarding mental health. Since pandemic po kasi ay lumalala ang mental health crisis sa ating bansa. It has been there before pero lumala pa nga, especially among the youth. Madam Chair, ilang percent po ng budget natin sa DOH ay specifically para sa mental health?
We allocated 600 million pesos for mental health, for the mental health program. This doesn't include our support to the National Mental Hospital, which is another certain amount. And so our mental health total is about, for 2024, is 682,708,800. We have an appeal of about 1 billion to address the gaps. So it actually decreased. Our previous year, 2023, the current year, is 1.8 billion. So this decreased actually by almost 63%, Your Honor.
Yeah, Madam Chair, ang laki po nung magiging proposed cut sa ating mental health services. Aside from that, Madam Chair, how about yung programs po natin or plans para madagdagan po mapadami yung ating mental health care professionals tsaka psychiatrists? Kasi Madam Chair, compared sa suggestion ng World Health Organization na dapat 10 for every 100,000 Filipinos ang psychiatrist, sa atin po 0.41. Madam Chair, di man lang umabot ng isang buong tao. Tapos Madam Chair, for every 100,000 Filipinos, 3 lang yung ating mental health professionals. So paano po natin mapapadami yun?
Thank you, Your Honor, Madam Chair. Actually, our program for mental health includes more of a community-based than a facility-based. So we have other extenders other than the professionals. We also should probably include that the TRCs, the treatment and rehab centers, also are part of our mental health program because substance abuse is considered also part of the mental health campaign. So we are now creating in the TRCs a lot of community-based programs also. So rest assured to our honorable congressman that this is part of my 8-point agenda. It's number 6 in my 8-point agenda. Ginhawa ng isip at damdamin. And we will try our best to actually address the mental health problems of our country.
Yeah. Madam Chair, it's noted, pero ang question ko po specific dun sa personnel na aspect, paano po natin mapapadami talaga yung tao na kayang nag-spread out sa ating bansa to provide healthcare services?
So, Madam Chair, the total psychiatrists we have is 651 nationwide. Very low number. The WHO actually initiative is actually about 516 psychiatric nurses, about 0.5 per 100,000, and 133 psychologists, or 0.1 per 100,000. So we do hope that we will coordinate with CHED for the representation to make sure that more students actually enter into the fields of professional fields of mental health. We have to address the lack of specialists and also in the level of primary care. So we will use other physicians actually also to include this. We're also creating with PhilHealth a program for mental health. I think that's one of the benefits that was mentioned that we will come out soon, and hopefully our mental health specialists and primary care providers can provide the needed gap, address the needed gap in mental health. So we will also train to address the gap immediately. Band-aid solution is to train current primary care physicians on psychological first aid and identification of these cases so that they can be referred to the proper professionals.
Okay. Madam Chair, sa kabuang budget ng DOH, ang nabanggit po kasi yung 600 million for mental health services, tapos NCMH. Para yung total po, ilang porsyento lang po yon ng DOH budget? Mental health compared to yung total budget, abot po ba siya ng 10% man lang?
Madam Chair, it's about only 1% because it's about last year it was 1.5 billion, now it's less than that. So it's a little less than 1% of the total health budget.
Yeah. Tapos Madam Chair, kahit idadagdag natin yung budget for NCMH, ang konti pa rin talaga. So if we are to consider mental health as a critical part of the overall health of people, tingin natin Madam Chair, ang ganitong share, hindi talaga siya makakasapat. Also, yung budget natin for NCMH, it's 2.2 billion at yung Filipinos in need, Madam Chair, 3.6 million. Yun yung mga may at least one type of mental, neurological, or substance use conditions. That's equivalent to only around 611 pesos per Filipino in need, Madam Chair. So, tingnan natin injustice ito sa mga may mental health needs. Ito na lang, Madam Chair, kasi 5 months na after na isa publiko ang malapig pen na kalagayan ng NCMH. So ano na po yung mga naging hakbang so far ng DOH para may saayos natin yung state ng NCMH?
Madam Chair, Your Honor, we have many programs. Some are also innovative. We have the Lusog Isip website wherein because of the lack of psychologists, there is an app that is open to our youth so that they can actually go to this app and be able to address some of their mental health issues, and they can be triaged and referred to specific centers. So this is one of the more cutting-edge things we have tried to do. So this has been just launched a few months ago, the Lusog Isip app. It's an app on the phone, and the youth can actually, this was launched in Ateneo. We're also trying to get our TRCs to address community. So the outpatient part of our treatment and rehab centers are addressing, because they also have in-house psychologists. So to address the need, ito yung ginagawa. Pero tama kayo, Your Honor, talagang kailangan natin mag-increase ng mental health professionals. Maybe we should also start with nurses specializing in psychiatric nursing.
Madam Chair, magkano yung capital outlay for NCMH for 2024?
Some mental health, walang capital outlay. Capital outlay? Let me check and then we will verify. I don't think capital outlay may be just equipment. I don't think our mental health has a new building or a facility that's going to be built.
Yeah. Then, Madam Chair, kayo natin tinatanong kasi na isa publiko na nga po na ang baho doon, sorry for the word, pero ang dugyot sa NCMH na kaysa po mag-improve yung state ng mga pasyente doon, hindi talaga yun conducive para mag-heal po sila.
Madam Chair, Your Honor, I was informed by our ASEC Gorgolon of HPEP that there's allocated for 2024 200 million for the National Center for Mental Health, both infrastructure and equipment, so for renovation and for additional equipment.
Yeah. Sana, Madam Chair, no, hanggat kaya pa ay madagdagan natin. Madam Chair, on another topic, kasi po may standing na MOA, signed in 2015, ang CHR, ang Human Rights Victims Claims Board, tsaka DOH, for non-monetary reparation sa mga naging biktima ng violations and abuses ng martial law. Pero so far, wala implementing guidelines. So, paano na po na-implement ng DOH yung kanyang parte doon sa ganitong mga compensation?
Alam niyo ba yun? Anyone knows that? Your Honor, Madam Chair, I will study this and we'll find out how we can help implement. If we are the ones who's supposed to implement the IRR, I will follow up and make sure we come up with the IRR. But we'll look at the law and then we will address the issue of our honorable representation.
Duly noted, Madam Chair. To confirm lang, may budget po ba for this sa 2024 so far?
We'll also look, Your Honor, Madam Chair, hanapan naman ng budget.
Okay, kasi so far, ibig sabihin, wala, Madam Chair.
Sa mental health program, pwede kung yan ay batas, then we can get it from the overall 600 million that we put in the mental health program.
No, Madam Chair, ito ay para sa mga human rights victims. So, ibig sabihin, it's a range of health services na dapat nating ma-provide sa kanila.
Yes, Madam Chair, Your Honor, pwede rin natin kunin yan sa medical assistance for indigent program. Basta specific yung kanilang request. If they are victims of martial law, then we can, and they have prescriptions or we can actually address that from existing programs, especially if there is a law that is already enabling it.
Yeah, Madam Chair, we will further coordinate with DOH on this matter and hopefully po yung guidelines as soon as time possible ay magawa. Madam Chair, ito naman cuts on various programs of DOH. Can DOH confirm? May aside po sa overall na 10 billion cut, may cut po sa National Nutrition Council.
Yes, yes, Your Honor, Madam Chair, there is a cut.
Meron. Sa National AIDS Council, may cut din po.
Pinak, yes, yes, Your Honor.
Health Policy and Standards Development Program.
Yun na, hindi ko alam. I will verify. There is also a cut,
May
Your
cut
Honor.
din. Health System Strengthening Program.
Please wind up with the questions.
Yes, Madam Chair.
I will have to check whether the health systems have a cut or not.
Yeah, kasi based po sa research po natin ay meron po. Pati sa prevention and control of both communicable and non-communicable diseases.
Yun, meron yun. Yes, yes, there
May
is,
cut
Your
din.
Honor.
Cancer Control Program.
Yes, meron din, no,
May
Your
cut
Honor.
din. Epidemiology and Surveillance Program.
Yes, Your Honor, meron
Meron
din.
din. National Reference Laboratories.
Meron? Yes, meron din, Your Honor.
Di ba, Madam Chair? So, yun na lang for me to wind up, Madam Chair. Nakakalungkot po, no? Overall, may cut. Sa maraming mga kailangang programa, may cut. So, Madam Chair, ganito po ba sa bagong Pilipinas na yung health po natin and social services, yun yung kinakaltasan. Kaya, Madam Chair, I also echo the sentiment of other colleagues natin na hindi dapat ganito sa DOH. Dapat po ma-restore yung cut at kung kaya, taasan pa po. Yun lang, Madam Chair. Thank you.
Thank you.
Move to interject, Madam Chair.
Honorable Garin.
Madam Chair, pasensya na po, no? With due respect to Congressman Manuel, Madam Chair, tila hindi po ako sumasang-ayon.
Madam Chair, just a point of order.
Yeah.
Are we allowed to interject? Because I thought there is a policy in this committee
Yeah,
that
Madam
there
Chair,
will
if I
be
may.
no
Yeah, Madam Chair, but my point
because,
is... no, Madam Chair,
let
if
us
I may.
speak first, please. Let me finish first. That was the policy of this committee that was approved during the first meeting of the committee. And, well, in fact, during the previous hearings, nandito ako. I am asking also to interject, but I am not allowed to interject as part of the minority. Now, why are we now allowed to interject, Madam Chair?
1 minute suspension.
Thank you, Madam Chair.
Ano bang, may interjection ba sila?
Sinatel. Yun nga, kaya nga.
Hearing resume.
Point of order, Madam Chair. Yeah. I really don't want to make a point of order, but I would find it unfair on the part of the administration being wrongly accused na maraming mga programa sa kalusugan ang tinapyasan. Mr. Chair, the figures is not correct.
Madam Chair, point of order.
Madam Chair, I'm
Madam
having
Chair,
a
yung
point of
binabanggit
order.
po, hindi po siya isang point of order.
Yeah.
Order is about yung proceedings natin, yung paano natin
No, Madam
pinapagano.
Chair. Hindi po totoo
That is
yan.
an interjection kasi facts po yung pinapresent, Madam Chair.
Yeah, Madam Chair, you can make a point of order if the figures being presented is not correct. Because this is a budget briefing. Hindi po pwede na meron tayong drama na pinapalabas natin na lahat ng programa ng kalusugan ay tinapyasan and making the administration look back where in fact it is not true. We have to compare
Madam
net
Chair,
versus net.
Madam
So
Chair,
with that,
point
Madam
of
Chair,
order.
I move that the interpellation of the Honorable Manuel be stricken off the records. So move, Madam Chair.
1 minute suspension.
Madam Chair, have we resumed hearing? Muna?
Yes, we did.
Thank you.
Madam Chair, nag-resume na ba tayo, Madam Chair?
Kinompare naman yung ngayon siya yung proposal, di ba?
Hindi kasi hindi nila kinumpare apples to apples. Kaya mukhang binawasan.
Merong tinapyas.
No. Gusto ko lang mag-object.
Let me just clarify everything. Let me just clarify. According to the rules from the appropriations, it is correct that we cannot interject. So,
I had a point of order, Madam Chair.
let me just clarify that. Okay?
So no, Madam Chair, so no interjection.
No interjections.
Just a point of order.
Yeah. So I had a point of order, Madam Chair, and pending motion.
Yes, Madam Chair, since my interpellation was referred to, then I would like to express that I object to the striking out of my interpellation since for several agencies po, that's how we as young people compare yung ating mga plano sa pagbabudget. Anong meron tayo ngayon at ano yung plano from Malacanang na budget. Kasi yun yung magiging baseline natin, Madam Chair, how we will assess the higher budget for services.
Madam Chair, may I explain my objection, my point of order? I raise it as a point of order kasi tila pinapalabas na tinapyasan lahat ng programa ng kalusugan. And that's very unfair to an administration who has been investing on health. Kung magdadagdag tayo ng pondo, dagdagan. That's why my point of order is that there was a misrepresentation of the facts given because comparison is net versus net. Kaya yung mga sagot kanina na tinapyasan lahat ng programa ng kalusugan, that is not factual. I therefore move earlier, Madam Speaker, that those statements be stricken off the record. Because that will make the administration look bad. And that will make us look bad na parang lahat ng programa sa kalusugan ay tinapyasan natin. That's unfair to the people who have been working for the budget of the Department of Health. So I had a motion, Madam Chair.
Madam Chair.
I object, Madam
Madam
Chair, to that
Chair.
motion.
May I have the floor, Madam Chair?
1 minute suspension.
Madam Chair. Madam Chair.
Sorry. We
May I
need
ask
to...
for clarification?
Yes, Honorable Plato.
Kasi kanina pa akong umaga rito Madam Chair. Kung ganito ang mangyayari, abutin na naman ako ng alas 11 mamayang gabi. Just like the DOTR. Now, let's settle the issue. Bakit nyo pinapayagan yung point of order?
We will be clarifying the
Please
rules.
let me finish, Madam Chair. Because our rules state specifically kung ano yung point of order and when it is going to be raised. Di ba? Kasi ina-allow nyo But if I read section 103 of our House rules, and I would like to quote, a point of order is a privileged question that raises a violation of the rules in relation to the matter under discussion on the floor. A motion to read any part of the rules is equivalent to a point of order and takes precedence over any other motion other than a motion to adjourn. Yun po ang rules natin. Dapat yun ang sundin natin.
Thank you for clarifying the rules. Actually, that is what we are going to clarify. The point of order will, as mentioned, only be on the ruling and violation of the rules. Parliamentary. So, and with that, and because there is a pending motion, Honorable Garin, will you?
Thank you, Madam Chair. After conferring with our good colleague, I actually withdraw my point of order with the assurance of the Chair that the data that were mentioned will be corrected. So the wrong data that will be mentioned will have to be stricken off the records.
Madam Chair, question of privilege. May I be allowed to speak?
Honorable Raul Manuel.
Yes, Madam Chair. Madam Chair, I don't see the point na may mga ipapatanggal po tayong facts and data kasi Madam Chair, wala pa kong isa-cite na data kung hindi ito yung proposal na nasa National Expenditure Program. Second, Madam Chair, it has been also a part of our scrutiny of the national budget na kinukumpara din talaga natin yung actual budget ngayon tsaka yung pinopropose po sa National Expenditure Program. There are many ways to compare naman talaga, GAA to GAA, NEP to NEP, pero hindi po nawawala doon, Madam Chair, yung GAA to NEP. Kasi, Madam Chair, doon natin makikita na kung ano yung pagkakaalam ngayon ng administrasyon sa national budget, ano yung dapat ayusin, ano yung dapat baguhin. Kaya, Madam Chair, ako po, Madam Chair, na-notice ko, di ba, sa OVP, parang nililimit natin yung discussion, sa OP, nilimit natin yung discussion, pati ba naman DOH, Madam Chair? Sana po hindi tayo matakot sa facts at sa katotohanan, Madam Chair, at i-allow natin yung mga deliberations at ma-put on record iyon. Yun lang muna, Madam Chair.
Thank you, Honorable Manuel. Let me yield the chairmanship to Honorable Stella Kimbo.
Thank you. So, may minutes mo ba si... Okay. So, just to set the record clear, Mr. Secretary.
Yes, Madam Chair.
So, moving forward, when we make comparison of numbers, we just have to make it clear what we are comparing, whether we're comparing NEP figures versus GAA figures. All right? So, just to make, to minimize confusion. Yun lang po, Secretary, okay? Moving forward. And for the members of the House, if a point of order is to be raised, it has to be based on a violation of a rule. Yun lang po. Right? Okay. So with that,
Madam Chair,
yes.
just to clarify, with regards to the statement, last statement of Honorable Janet Garin, what is the ruling of the Chair? In regards to the striking out of all the data pertinent to the position of the Honorable Manuel, what's the ruling of the Chair? Thank you.
Madam Chair. Madam Chair.
Yeah. Let me make Okay.
No, I'm just asking the chair, what is the ruling of the chair with regards to the statement, and that is not a motion of the Honorable Garin. What I'm saying is, what is the ruling of the chair with regards to the statement that she's getting the commitment of the chair?
Okay, let me make a ruling on this first. We first have to set on record alin dito sa data ang mali. Alright, so we are referring to the data on page 12. Mr. Secretary, so let's do a rundown. All the numbers here. So can you confirm that these numbers are correct? One by one.
Yes, Madam Chair. For the DOH, for PhilHealth, the NEP for 2024 is 101.5 billion, and the NEP in 2023 was 100.2 billion. So it increased. For Heart Center, the NEP in 2024 is 1.8 billion. The NEP in 2023 was the same, 1.8 billion. For NKTI, it was 1.3 billion in 2023. For 2024, it's 1.2, so minimal decrease. For Philippine Children, it's 1.2 billion. It increased to 1.4 billion for 2024. It increased, yes. And for Lung Center of the Philippines, it was 630 million in 2023 NEP. It's now 561, which is lower. For PITAC, it increased from 156 to 174. And for NNC, it decreased from 401 to 296. And for PINAC, it's almost the same, 43, yes, increased to 46 for AIDS.
Okay, so all of these data have been confirmed by the Secretary, so there is nothing to be stricken out. Okay, so ang kailangan na lang natin ipaliwanag sa mga nakikinig natin ng mga kababayan is ang pagko-compare po natin ng numero is NEP to NEP at GAA to GAA. Sa ngayon po, ang pinag-uusapan natin ay NEP pa lang po. So proposed numbers pa lang. Ang maaprubahan na number would be the GAA number, which will happen months from now. So yun po ang paliwanag. So that being clear, we can now move forward. The next to interpolate from the majority, we have the chair of our Committee on Health, the Honorable Siriaco Gato. And I yield the chair back to the Honorable Nika.
Thank you, Madam Chair. I hope the passions have been subsided a little bit. Good noon, esteemed colleagues and the Department of Health Family, headed by our Secretary Teddy Herbosa, the FDA Director General Sam Zacate, and
excuse me,
President
can you
Manny
just please
Ledesma of
observe
PhilHealth.
silence first, everyone, please, para magkarinigan po tayo, please. Thank you.
As Chair of the Committee on Health, I wish to express my full support for the proposed budget of the Department of Health. Our experience during the COVID-19 pandemic underscores the critical importance of investing in healthcare system to ensure access to healthcare quality and affordable healthcare services. The proposed budget of the Department of Health is crucial to a nation that is recovering from global health pandemic. We have specialty centers to establish, a healthcare workforce to augment and develop, medical researchers and trainings to fund, and programs of the universal healthcare to be strengthened and to be sustained. Prioritizing healthcare funding is not an option, it is an imperative. It means investing in hospitals, facilities, and healthcare personnel. It means ensuring that all communities, regardless of the socioeconomic status or geographical location, have equal access to quality, and affordable healthcare services. As we consider the Department of Health budget, let us remember that this is an investment in the health and prosperity of our citizens. This is an investment in our common values, our shared values for equality and our shared values for equality and compassion, and this is an investment in the well-being and future of our nation. So, mga mahal kong kasama dito sa August body, sana po masuportahan natin ang proposed budget ng Department of Health. Maraming salamat po.
Okay. Any response? Secretary.
Madam Chair, I'd like to thank the Honorable Congressman Gato, who I was with during residency days at the Philippine General Hospital. He has spoken like a true physician. Thank you very much.
Thank you. Next, we have from the minority, Honorable B.H. Herrera.
Thank you very much, Madam Chair. Magandang hapon po sa inyong lahat, the DOH family. Mr. Secretary, I'll just go straight to my point. Kanina pinag-uusapan yung disbursement rate ng MAIP. And I saw in 2022, yung disbursement rate ng MAIP is 63.8% only. So meron pong 9.4 billion na hindi nagamit for MAIP. May I know po why this happened? Kasi syempre kami po dito sa Congress, malungkot po kami doon. Pwede namin kayong tulungan sa daming ospital pong nangangailangan. Napakadali po niyan kung kami po ang tatanungin nyo saan ibababa ang pondong ito.
Actually, Honorable Chair, Madam, Honorable Representative, yes, our utilization is actually increasing. So what's happening is the MAIP of 2022 is going up to about 94% utilization. It's the 2023 that still continues to be low. And the items we identified that causes it to be low, like there are some private hospitals that don't want to sign an MOA, especially in areas where there is no public hospital. Some of them don't want a letter of guarantee. There are also physicians who don't want to accept the letter of guarantee. So yun yung difficulties ng aming regional office. But for the patients that need them, marami talagang lumalapit at happy naman sila pag nabigyan sila ng allocation for indigency funds.
Yes, Madam Chair, through you. One of the reasons na nakikita ko why we are having difficulty signing with private hospitals kasi mahirap po yata tayo magbayad, ang bagal. Have we fixed this already? Because na-note ko that there are still 2.2 billion na utang sa mga private hospitals in terms of the allowances during the pandemic and all that. So, it's going to be difficult for us to convince private sector participation if we don't pay on time. PhilHealth has a lot of utang in all private hospitals. Kamusta na po ito?
Thank you, Madam Chair, Your Honor. Yes, actually, most of the public hospitals depend on the MAIP for their continuing operations budget. Kasi nga, medyo delayed yung sa PhilHealth. So, ang nangyayari, the MAIP has been a help also not only to the patients but also to the operations of the hospital. Kasi dun sila na-reimburse.
Mr. Secretary, isa po ako sa nag-push na magkaroon ng private sector participation for MAIP. May you please submit to the committee and to my office kung ano-ano na pong updated list ng private hospitals po natin.
Yes, Your Honor. Madam Chair will submit to your office.
And then we were discussing a while ago tungkol sa consultation fee, 50% is charged to MAIP. Now, sabi nyo kasi 50%, again, maraming doktor na ayaw magpa-MAIP kasi matagal magbayad ulit ang ating gobyerno. Yung po bang off-budget account natin, hindi po ba natin pwedeng magamit dito? Because I see yung trust receipts ninyo that are deposited with AGDB, ang kanyang nature of expenditure is professional fees or refund to doctors from patients from PhilHealth. So is this something we can use? Because I see there's still a balance of 3 billion.
Ano yun? What's that? AGDP.
Trust receipts po ito. It's coming from affiliation fees, seminar training fees, and other fees. That's a source and nature. And then it has an available balance of 3 billion ng 2022.
I think, ma'am, Your Honor, Madam Chair, I think this is income of the hospitals. So they use that for their operations, the affiliation fees. That's hospital, the DOH hospitals are allowed to retain income. So,
Yes.
and then they use it also for the gaps in their operations, and patients also, indigent patients that they serve.
Kasi nakalagay po dito, it can be paid for professional fees or refund to doctors.
Pwede naman, basta yung hospital meron nung funds na yan kasi that's distributed depending on which hospital
Baka pwede
has
na
the
po
funds.
pasubmit na lang po sa opisina so we can explore
Sige
this
ma'am,
also.
we will do that, Your Honor, Madam Chair will do that.
And then, because of that, nakita ko ang laki ng dinecline ng budget for MAIP. Parang 29.5% decrease from 33 billion. Ngayon, it's just 22 billion na lang. Bakit po nagkaganon? Because of your absorptive capacity?
I think so, ma'am. As you declared in your first query, Madam Chair, it was the low utilization. So, of course, DBM will not give you the same amount if your utilization is low.
Meron na po ba tayong ginawang steps, Madam Chair, para maiwasan natin to? Kasi lahat po ng kababayan natin kailangan yung medical assistance.
Yes, we are having steps. Our head of are streamlining the guidelines, the MOA, and the quick reimbursement so that the hospitals can benefit from the MAIP program.
Sa program fund, you were given 52 billion for this. Ano po ang disbursement rate nito?
As of now, for the unprogrammed, we requested DBM last April for use in addition to the health emergency allowance. If you remember,
Utilization natin
Oo.
is 2.64. Hindi pa po natin
For the
nakukuha yung
unprogrammed.
52 billion for the
yeah.
unprogrammed.
So the 52 billion is still in DBM, but we've made a request for it for additional for the health emergency allowance, no?
No,
Kasi
because
kulang pa ng cash.
there's 52 billion for the emergency allowance and there's another 52 billion for the age
Unprogrammed.
and social welfare program. So both haven't been released. So 110 billion,
We have
the
an
whole
appeal.
110 billion from unprogrammed has not
but
been
we
released.
didn't request for the whole 110. We only requested for the amount we expect to be able to disburse.
Which is how much po?
7 billion yata yung hiningi muna namin.
Okay,
Additional.
so wala tayong magagamit dito sa 110. 7 billion pa lang.
Palang, wala pa.
Okay. Sayang naman po. Dahil naka-earmark din po yun sa inyo. But anyway, dun po sa
For later
antiretroviral,
review, di ba?
yung AIDS activity natin, parang 66 out of 95% ang na-reach natin. And I think it's because of the unfilled position also, 26 out of 32. Bakit po nagkaganon yung ating accomplishment when it comes to yung sa AIDS, considering tumataas ang incidence ng AIDS in the country?
Antiretroviral. May I refer to Undersecretary Rosette Berhere for the HIV utilization.
Yes, good afternoon, Madam Chair, and good afternoon, Congresswoman Pereira. Ma'am, may I clarify what the 26 out of the 32 mean?
Parang 26% lang ang nagamit doon sa antiretroviral na program ng DOH.
Based on how we have implemented the program, Honorable Congresswoman and Madam Chair, para pong hindi, we have users, service users.
Utilization po ng budget.
Nasaan?
Budget po ba ngayon tanong?
No, we have, ito.
1.2 billion.
Oh, kasi ngayon po, ma'am, yun pong ating mga antiretrovirals are all parang in some parts of the country, low na yung inventories natin and a lot of users are consuming the antiretrovirals. Although, yun pong ating detection kasi ngayon, hindi pa po at par with the 95% target, meaning yung mga number of HIV patients who are supposed to be detected, nasa around 68% pa lang tayo. Pero lahat po sila, among the 68% that are being detected, almost 70% of them are undergoing medication. So, yun pong 38% na utilization, as you say, para pong hindi po tayo pareho ng records. We're just finding the
Pasabit na lang po sa office so that we could match our records. And the next thing for cancer, how do you qualify for that program? Because we set aside 1 billion for the Cancer Assistance Fund. We only have 6,666 registered cancer patients. and then another billion for 18,695 for cancer treatment and mitigations. If you can just submit na to the committee how to apply for this and ano yung progress nito.
Madam Chair will refer to Undersecretary Berhere. The
Yes,
program is under her.
Thank you po, Secretary and Madam Chair and Congresswoman. Ma'am, Madam Congresswoman, there is a doctor in all of our sites that would be assessing the patient if they are going to be eligible for the funds or not. So yun po yung proseso natin. And then after that, once they are assessed, they go through the process already and they receive the benefit.
Pasubmit na lang sa office on how to avail of this so we could already tell our constituents as well.
Yes po, ma'am. We will do
And
that.
then, quickly lang, Madam Chair, wait lang Quick Response Fund, bakit napakababa ng paggamit natin ito? Considering these are standby fund for repair of health facilities, replacement of medical equipment during calamities. Marami pong nangangailangan nito. Bakit hindi po natin nagagamit ng maayos?
Madam Chair, for disasters kasi yung QRF, and usually the disasters happen on the latter part of the year. That's why our disaster conscious month is July. So when the floods come, we start using that up for the victims of typhoons and other calamities.
Then responsible parenting, Madam Chair, 17% lang ang disbursement rate. Bakit po?
Yusek Berhere do have the answer to disbursement rate of the...
Yes po, Madam Chair and Honorable Congresswoman, our obligation rate now is at around 80%. And yun pong disbursement lang po because nakakabayad pag nag-deliver na fully deliver. Kaya medyo mababa po. We're just getting the numbers right now.
Madam Chair, last na lang. Marami po kaming requests of medicines, especially we have online consultations wherein a lot of patients need medicines. And I see that you still have, ito na ulit yung retained income fund nyo. I don't know where this is, but there's a balance of 20 billion. Is this something that, drugs and medicines revolving fund.
Please wind up.
We have a balance of 5 billion. Is this something that can be accessed so that we have a lot of medicines available for our patients and constituents, considering there's still a huge balance?
Madam Chair, Your Honor, usually the revolving fund is in the hospitals. So what happens is, may pera sila na pambayad sa next supply. So at tapos may nabayaran din na reimburse. Yun na nire-retain yung income nila. And it's put in a revolving fund.
Yes, Madam Chair, basta bring it up. Dahil napakarami pong ospital na incomplete ang gamit. If we have this much revolving fund, so maybe you can submit to the committee anong detalye nitong revolving fund na to for sale of drugs and medicines so that we can see kung ano-anong mga ospital to na hindi ginagamit yung kanilang funding for the medicines.
Yes, Madam Chair, we will submit the...
And super last, midwives nagko-complain, di daw po sila makakolekta sa PhilHealth. Yun na lang, Madam Chair. Thank you.
President? PhilHealth?
Yeah, ikaw na. Sorry, ma'am. What was the can you repeat the last question? Sorry, ma'am.
Yung mga midwives daw po, may lumapit sa amin na grupo that they are having a difficult time claiming from PhilHealth.
Ma'am, we shall, Honorable Congresswoman, we shall set a meeting with them immediately po, and we will discuss how to resolve the issue po.
So, meron talaga. This is tama yung valid ang kanilang nire-raise sa opisina.
Can I allow COO to answer the question po?
Madam Chairperson, Your Honor, at present, we have not received any complaint or update from our partner providers involving the maternity care lying-in clinics, but to follow the commitment of our President and CEO, Sir Mandy, we'll schedule a meeting with them immediately to address and resolve whatever issues they have. Madam Chairperson, Your Honor, please.
Please, thank you very much, Madam Chair. And again, ulitin ko po, yung MAIP po natin, kung nahihirapan po kayo, nandito po kaming lahat. Willing po kaming tulungan kayo para ma-dispense in all hospitals necessary. Maraming pong salamat.
Thank you. Next, we have from the majority, Honorable Representative Romeo Acop.
Thank you, Madam Chair. Before I start, may I reserve or may I signify for the second round? Baka makalimutan ko po eh. May I know from the Department of Health, how does the DOH arrive at the allocations provided for each region? And what are the factors that were taken into consideration in determining these amounts? I asked this question, Mr. Secretary, kasi yung Region 4A, insofar as the regional allocation of the 2024 expenditure program is concerned, 2.98 billion lang ang nakukuha ng Region 4. In the other departments, nasa top 5 palagi ang Region 4A. May I know the reason why ganito na lang ang napunta sa Region 4A?
Madam Chair, Your Honor, we usually assess the receiving LGU, whether they can fulfill the requirements, if the site is available, if the readiness of the place to build the health facility, if they are willing to commit with the healthcare workers after the facility is finished. And then there's also, based on criteria on the poorest, we usually allocate the poorest and most needy localities first, and then prioritize over based on the class of the municipality.
In the previous years, Mr. Secretary, ano po yung position ng Region 4A?
Region 4A, according to my colleagues here, Madam Chair, Your Honor, is in the top 3 for the funding support. Region 4A gets a lot of support, I guess, based on the population.
That is precisely the question that I'm asking, Mr. Secretary. Bakit in the previous years, nasa top 5 siya, ngayon bigla siyang bumagsak? May I know the reasons why?
I will look into that, Your Honor. Ano bumagsak sa 4? Ba't bumaba?
Wala tayong sa H5 kasi tayo nagbaba yung category 4 boss. Pero kahit category 4 ka, mataas pa rin yung funding. Huwag mo nang sasabihin yung category.
So we'll investigate and we'll submit to your office why it went down, Your Honor.
Thank you. May I go to the PhilHealth Insurance Corporation?
Gawa ka naman ng report sa kanya. Gawa ka ng report.
For 2022, what was your surplus insofar as your sources and uses of fund, gross of tax subsidy and conversions are concerned? What was your surplus in the year 2022?
Madam Chair, if I can allow our funds management sector head, Sir Renet Limsiaco, to address the question of Honorable Congressman Acop. If I can allow Sir Renet Limsiaco to answer the question, Madam Chair.
Sir Limsiaco,
Thank you, Madam Chair.
you're recognized.
Maraming salamat, Madam Chair, and magandang hapon po sa ating lahat. As to the surplus in the year 2022, we have 76.64 billion, Mr. Chair, as we have premium contribution of 207.2 billion and benefit payment of 130.56 billion, Mr. Chair. Madam Chair.
Okay na pala. Sige. Madam Chair, may I ask what was your total assets in 2022?
Madam Chair, Honorable Kong Acop, our total assets year 2022 amounting to 454.8 billion pesos, Madam Chair. 454.8 billion, Madam Chair.
For 2022, what was your net profit?
Madam Chair, our net profit, including the other gains due to changes in ICL or insurance contract liability amounting to 151.5. If we gonna get that other gains, Madam Chair, again, our net income before change in ICL is amounting to 79.0 billion, Madam Chair.
Now, with these statistics that you have you requested national government for subsidy?
Madam Chair, on the part of...
No, yes or no lang, sagot. Ang tanong ko po is, have you requested for subsidy from national government? It's answerable by yes or no, para dire-diretso po tayo.
Sorry, Madam Chair. Yes po, we requested a subsidy from the national government, Madam Chair.
Tatanungin ko po kayo, sa inyong laking pera na kinikita, kailangan nyo pa ba ang subsidy from national government? Kasi ang gobyerno po natin, nahihirapan na nga na humahanap ng pondo eh. So, I am asking that question. Kailangan nyo po ba ang subsidy from national government when in fact, according to the statistics, kaya nyo mag-self-sustain eh?
Madam Chair, Honorable Kong Akop, thank you for your question. Sir, we need the subsidy because we are currently in the process of expanding our benefit packages, which PhilHealth has not done po in the last 10 years. And
with your indulgence, in the last 10 years, hindi pa nyo na bago yung inyong benefit package. May I ask, how many times have you increased your salaries?
If I can allow, Madam Chair, if I can allow our COO to answer the question.
Sir Santos?
Madam Chairperson, Honorable Representative Akop, I do not have the exact data right now, but I can say that before 2021, November 2021, we implemented the CPCS based on the Executive Order 150 issued by the Office of the President, and this is based on the study conducted by the GCG.
Madam Chair, tinatanong ko lang po kung ilang beses na tumaas yung kanilang sweldo for the past 10 years. Kasi 10 years, sabi nila, hindi nababago yung benefits na binibigay eh. So, I would like to ask, in the past 10 years, ilang beses na tumaas ang mga sweldo nila?
Okay, COO, please provide the specific response.
Thank you, Madam Chairperson. Thank you, Honorable Representative Akop. I can say right now, Madam Chairperson, without the data, only once, Madam Chairperson, this 2021. Actually, Madam Chairperson, Honorable Representative Akop, we were really behind because before this implementation of EO 150, we were still under the SL salary, SL4. However, the national government was already in SL5, Madam Chairperson, Honorable Representative Akop. But we will provide the required data, Madam Chairperson, please.
Thank you. I will go to one issue insofar as the services of PhilHealth is concerned. With regards to the health packages the PhilHealth provide for admitted patients, what would be the average percentage that these packages cover on the total hospital bill?
Madam Chairperson, Honorable Representative Akop.
COO, please answer.
Madam Chairperson, we have this average value per claim and we peg it at 10,000 pesos per claim. But as to how much per case rate, Madam Chairperson, we do not have at present the necessary data. But again, we will submit that data, Madam Chairperson. Honorable Representative Akop, please.
Thank you, Madam Chair. I will cite an example. In the case of pneumonia, PhilHealth charges different amounts based on the classification of the hospitals. Di po ba? Pag class A or B, 15,000 yung inyo pong sinisingil. And for lower class classification of hospitals, 10,000. Tama. And if you look at it, it requires the same management and it requires the same medicine. Now, bakit po ganun ang pagsingil po ninyo? Bakit may difference na 5,000? It depende sa klase ng hospital.
Madam Chair, if you can allow Doc Ish to answer the question, please.
Go ahead.
Yeah, thank you po.
Madam Chair, Congressman microphone, please. Sir Lim Shako.
Hello. Okay. Madam Chair, Congressman Akop, we don't pay po our packages differently sa types of hospital. So, kung ito po'y level 1 or level 2, level 3, yung pong pneumonia, ang difference ng pagbabayad natin is according to the disease. So, the disease po type. Kung ikaw ay yung moderate type of pneumonia at ang package po natin, for example, in a moderate type of pneumonia is 15,000, yan po ay ibabayad natin kung ikaw man ay na-admit sa level 1, level 2, or level 3. Hindi po nag-iiba-iba ang package rates natin according to the levels of facilities.
Thank you, Madam Chair. There was a time when PhilHealth required that pneumonia cases be admitted for 96 hours. Di po ba? So, depende sa number of hours. Kasi, kung yung pasyente, i-discharge mo before 96 hours, merong return to hospital yung claim nila.
The general rule po is...
Hindi, sagutin mo muna ako. Hindi ko tinatanong kung ano yung general rule eh. Tama po ba yung sinasabi ko?
Wala po tayong on the number of hours except for the 24 hours po yung general rule for admission. Ngayon, kung pneumonia po kayo, kung ito man po ay na-admit kayo ng 3 days or 4 days, again, ang package rate po natin is dependent kung anong type ng klase ng pneumonia, kung moderate or severe type of pneumonia.
Okay.
May I also remind everyone to please address the chair? Thank you.
Sorry, Madam Chair.
Sige. Now, the PhilHealth coverage as a percentage of the population for 2022 is 70%. Would that be correct?
Chair? Sir, would clarify ko lang po, yun pong coverage ng benefits or coverage ng membership?
Membership.
Our membership coverage.
We will, Madam Chair, we will just retrieve the data po. Just a minute po. Can we retrieve the data po for membership?
Honorable Akop.
Madam Chair, magsi-second round na lang ako. And I'll just ask PhilHealth to prepare for the second round dahil marami pong issues dito. Para dun sa aking mga kasamaan, pwede na silang magtanong. Thank you, Madam Chair.
Thank you, Honorable Akop.
Thank you po.
With that, let me go to the minority with Honorable Deputy Minority Leader Presley De Jesus.
Thank you, Madam Chair, and good afternoon po sa atin lahat, no? Ito lang, simple lang tanong ko kasi halos lahat natanong na, no? That's the problem pag nasa hulihan ka. Pero ganun pa man, lahat ng gusto kong tanong, maganda yung positive. Siguro tanong ko lang kasi kanina, tanong ni Kong B.H. Herrera, with regard to the utilization rate ng DOH, medyo, ilan po ang utilization rate po ng ngayon? As far as yung MAIP is concerned?
MAIP nasa 60-something, diba? Around 60%, nasa 67%.
Okay, so mataas din pala. Siguro, I do understand kung bakit hindi natin nare-reach yung mga 80%. Yung bang coverage po ba, kasama po ba yung secretary, yung mga hearing aid, kasama ba yun? Yung mga titanium pag na-injured, hindi kasama. So, Bakit po? Bakit po hindi kasama yan? Lalo mga kababayan natin mahirap kailangan nila po yan.
Yung pong mga implants, nasasama yon kasi sa hospital yon basta hospital bill. Pero pag mga hearing aid and assistive devices, outpatient po yon. So lahat ng nagamit sa hospital pwede talagang isama sa MAIP.
Okay. Yun po kasi, nakikita po namin, siguro one of the reasons why the utilization rate medyo mababa. Kasi po, karamihan sa probinsya, nakikita ko lalo pag umikot kami sa mga electric cooperatives, ang problema po daw nila madalas, pag tinatanong ko sila, lagi na po puno yung provincial, city, at saka municipal health hospital. Ang tanong po nila, pwede ho bang yung private na hospital na hindi na kailangan magmawa ang DOH doon. Pwede ba yung may asosasyon naman ng mga private hospital, pwede ba ang DOH at private hospital magmawa na lang kayo para mag-cascade na po sa mababa? Lalo po yung moms and pops na hospital po natin sa malalayong lugar. Madam Chair.
Madam Chair, Your Honor, kailangan po yung specific hospital kasi kinokowa kami. Kasi it's a private entity, tapos bibigyan natin ng government money. So yung MOA po, yung protection ng agency na government funds were properly used when it was transferred to a private entity, like a private hospital. Yun po ang sagot doon, Your Honor.
Madam Chair, so in short, kapag meron tayong MOA with a private hospital, pwede na po?
Na po, pati yung 50% kung tatanggap yung doktor ng letter of guarantee, 50% ng professional fee niya, pwede rin masagot ng MAIP po.
So in short, Madam Chair, no, kung yung MOA po, remember the association ng mga hospital, meron naman po sila association, no? So if the DOH and the association of the hospitals, mag-MOA kayo, pwede ba yun? Instead na individual na lang mga hospital, kasi matagal specific So yung DOH na ang bahala sa asosasyon, and then they will cascade po sa mga probinsya po, lalo po yung mga malalayong lugar. Is it possible, Madam Chair?
May I refer to our ASEC na lawyer, ASEC Grande.
Good afternoon, Madam Chair. Honorable Congressman, the GAA provides that we will enter into a MOA to the facility, Mr. Chair. It's not the association of the hospitals, Mr. Chair. So we follow the GAA, Mr. Chair.
Madam Chair, no, specifically si Attorney Grande, during pandemic, may nalapit ako siya, natulungan mo. I salute you with that, Attorney. If you remember me, siguro, we were only on the phone. Lastly, siguro, ang tanong ko rito, Madam Chair, no, dahil siguro, para naman lahat tayo makapagtanong dito. So, yung MAIP nyo, konti lang ho ba yan o marami yan? Yung 22 billion. Para sa amin, nalilitan kami dyan
Kulang po kasi sa ospital po ako nagtatrabaho. Napakarami po talaga ng mahihirap na Pilipinong nangangailangan ng pondo.
With due respect po, no, kung marami ako narinig din, between PhilHealth at MAIP daw, mas gusto nila MAIP kasi talaga ako na ibibigay. Mr. President, pasensya na. Yun ang narinig ko sa between MAIP and PhilHealth, mas gusto daw nila yung sa MAIP. Bakit? 100% ang coverage sila. No? Ang problema lang nila, puno lagi ang mga probinsya at saka mga city hospitals. Kaya kung gusto daw nila, request nila, ang DOH mismo, makipag-coordinate sa asosasyon ng mga hospital para wala nang silang problema, MOA po. No? With that note, Madam Chair, siguro I just have manifestation, no? Since kanina pa ako, nakita ko yung mga sagot nila, and I salute PhilHealth and of course the DOH family, no? Madam Chair, I would like to congratulate and commend Secretary Ted Herbosa for immediately jumping into action to ensure that the DOH is ready to respond to the needs of our constituents. No, lalo na yung MAIP na yan. This is a defining moment for the healthcare sector as we navigate the post-pandemic situation. And I am confident that Secretary Bosa can lead the department through this period. We need a strong healthcare system if we want Filipinos to reap the full benefits of the universal healthcare. With that goal in mind, we look forward to seeing your expertise in action, no, Secretary, and we're excited to see the positive impact will undoubtedly make in the healthcare sector. Yun lang po, Madam Chair. Maraming salamat and congratulations po sa inyo lahat.
Thank you, Deputy Minority Leader Presley De Jesus. Let's go to the majority with the Representative Edgar Chato.
Thank you very much, Madam Chair and our colleagues, and of course, good afternoon to Secretary Ted Herbosa and the rest of the DOH officials who are good friends of the province of Bohol. Let me start by saying that I really strongly support the budget of the Department of Health, and in fact, manifest also my support any move from our colleagues to increase the budget. Healthcare is a very, very important sector in need of our people that must be on top priority. And we have been partners with DOH. I thank them also for the almost to be completed ongoing construction of the multi-specialty medical complex that is now ongoing in the province of Bohol. Maybe this will be a trailblazing facility to also lead what we have already approved in the House, the multi-specialty medical complexes in the different regions. With special recognition, of course, to two programs that are very close to the hearts of our people, and this is the HFEP of ASIC Gorgolon, and of course, our MAEP of ASIC Grande, who have always been helpful, Mr. Secretary, the rest of the DOH family. Let me just manifest one thing. When the COVID-19 pandemic started, it seems like everyone was caught unaware. And even during that time, we have to agree and recognize that we were not that prepared to face it. I would recall that during the meeting of the Health Committee, Secretary Duque then was the secretary. It was only RITM that can really be trusted on relying to issues. And the basic requirement of swabbing, for example, and testing was sent to Australia before we were able to build our capacities. Now, we are not aware, even with the lifting of the COVID pandemic, we're not aware on the next threats on healthcare. Are we getting ready for that? Where are we? And is this also considered in the 2024 budget?
Madam Chair, Your Honor, thank you for that question. Yes, we have put emphasis on that. There are several House bills and Senate bills addressing these deficiencies. There is the Centers for Disease Control law. The House has already passed it. It's already at the Senate. We're awaiting its approval. So these Centers of Disease Control will strengthen our Epidemiology Bureau, our outbreak surveillance, and our response during the next outbreak or pandemic. Then we also passed a law on the Virology Institute of the Philippines, which is going to be lodged with the Department of Science and Technology. Hopefully, we will also be able to address vaccine production, because if you remember, during the COVID-19, all we did was import finished products, whereas our neighboring countries bought bulk and were able to do fill and finish because they had existing vaccine plants. So we do hope that this part of the endeavor can also be produced. We have the vaccine resiliency project that's actually out there also with NEDA, and we hope that can be implemented soon with this administration.
Thank you, Madam Chair. And on the side of mental and behavioral health, are there moves on the part of the Department of Health, or is it a direction on building other mental health facilities? That's the first question. And the second is, in the process of addressing healthcare, it seems like the aftercare is taken care of by the RHUs. Am I correct? And in the RHUs, I'm wondering whether these are taken care of by the local RHUs or by the DSWD, the social workers. Which group is handling the aftercare?
Thank you, Madam Chair. Your Honor, yes, for mental health, we actually included it in the Philippine Development Plan for Health Facilities, which has already been approved by the Office of the President. So mental health facilities have been identified also in different parts of the country. We also are putting an emphasis on community-based mental health. That means outpatient care. Kasi magastos po talaga yung facility-based, yung treatment ng mental. So especially now with the newer medicines, as long as the medicines are available, the mentally ill patients can be actually taken care of well at home. On the aftercare, yes, there's a partnership. I think aftercare is part of primary care. And you are correct. We should actually consider taking care of disabilities and persons with disabilities also in primary care settings. I have heard many requests for assistive devices for mobility, for hearing. So these are things that we had not addressed in the past. And I hope in my administration we can address this aftercare. After they have been hospitalized, their lives have been saved, they usually still suffer from a disability. We partner also with the SWD in this part. And also local governments. Actually, many local governments have their own programs giving assistive devices and other things to assist the mobility of persons with disability. So thank you for that information. We will concentrate on putting that in the super health centers also.
Thank you very much, Madam Chair. But this is a primary jurisdiction of the Department of Health, not the SWD. It should be in partnership.
Yes, this is a priority, and so these are the mental health facilities that are unbuilt. Mariveles for Region 3. In Region 5, we have the Bicol Medical Center, and in Zamboanga also, Region 9, we are building facilities. Wala sa Visayas.
Thank you, Madam Chair. Maybe wala sa Visayas, but we're looking forward to have it in the Governor Celestino Galeares Memorial Hospital,
yes,
which
of
is a
course.
multi-specialty medical complex.
Yes, thank you.
Madam Chair, one question on universal health care. We are moving towards that, and the LGUs are also still put into, it's hard, I mean, even with the devolution being mentioned, it seems like they're not that ready to absorb the NDPs. I was just wondering if our NDP program can still be extended at the DOH for 1 or 2 years before the transition to the local governments to make adjustments, because the LGUs are also expected to earn something from the consulta benefits once the universal health care is being implemented. But the transition, I think, are we ready now?
Yes, Madam Chair, Your Honor, the nurse deployment program is a very vital component of primary care. Kasi our traditional idea is the nurse stays in the hospital. But when I talk to these nurses that we have deployed, they realize the difference of the care you give in primary care settings. So maternal, child care, etc. All these persons with disabilities. So I think we will continue that program. That program continues. In fact, as long as there's budget allocated for this nurse deployment, we have 20 billion ba for this year? 17 billion for this year that will be deployed to the different regions that require human resources for health.
Thank you very much, Madam Chair. Just one point, not a question, but it's a manifestation. We are used to the local investment planning for health, but I'm looking also into the possibility that DOH can come up with a new tool that will enable LGUs to better localize investment planning, to consider the unique needs, issues, and concerns of the people at present. Maybe innovations will be in place.
Madam Chair, that's actually a very important aspect. It's not a one-size-fits-all. I have discovered that some of the local investment plans need to be appropriate, especially for island provinces, which are very unique setting. So we're now trying to make sure that the setting is correct when you do a local investment plan. So it's not a generic plan. So I've been telling our personnel at the Department of Health to be more appropriate in the planning for healthcare. Like for example, regions like Mimaropa with all island provinces, you cannot put a regional hospital in one place. You have to put in every province, in every island. So these are things we are now putting into our planning, especially for local investments, where the super health centers will be placed, where these facilities, and then the idea also of using mobile buses for, let's say, Bohol. Let's say you can have several north, south, east, west, a super health center, and then a mobile clinic that can go around to serve the others who are far from those super health centers.
And thank you very much, Madam Chair, and thank you very much, Secretary Ted. Thank you also for helping Bohol again during the earthquake. You were there with us, so thank you to the DOH family. Thank you.
Thank you. I now yield the chairmanship to Vice Chairperson Honorable Janet Garin.
Next to interpolate is the Honorable Caraps Paduano from the minority.
Thank you, Madam Chair. Sec, good afternoon to the DOH family. Anyway, before I proceed with some of my questions, let me state that this representation supports the position being raised by Congressman Palma an hour ago with regards to its PEP, that its PEP should be downloaded and implemented to the DPWH. Now, can I get the commitment of support from the good secretary with regards to the its PEP?
Yes, Madam Chair, we already committed, and we reiterate that for the infrastructure part, we will try to delegate all that is going to be accepted by the DPWH, Your Honor.
Thank you, Madam Chair. Thank you, Secretary. Second, Mr. Secretary, how much is your proposed MAIP budget for 2024? Yung proposed, not the NEP. Yung proposed.
The proposed was 26, no? Our proposed was 42 billion pesos. The one that was placed in the NEP was 22 only.
So it was slash.
It was slash, yes.
Previous year, 2023 budget was 32 billion.
32
Am I
billion.
correct?
Yes, Your Honor. Yes, Madam Chair.
Madam Chair, I would like to manifest that the budget for MAIP of being requested by the DOH will be restored as requested by the DOH to the DBM. Thank you, Madam Chair. Now, let me ask just, maybe this is just a parochial question, but maybe it is also happening in all other DOH hospitals with regards to the private rooms or semi-private rooms in DOH run and managed hospitals. Now, ang problema kasi, Sir Secretary, those indigent patients, no? Qualified indigent patients na nakapasok o pumapasok or being admitted in the semi-private rooms are not allowed to avail the MAIP. Is it the policy of the DOH?
We allow that the same way we have allowed indigent patients in private hospitals. We actually now allow, the program now allows.
When was that? When was that?
Arce Grande. Madam Chair, can we recognize Arce Grande?
Madam Chair, this year, Honorable Congressman, we shifted into the based on the needs, not based on the based on the needs of the patient, not on the room. It is not dependent on the room. So kung ang kailangan po ng pasyente ay ICU, we will cover. If dun sa private po, pag ang aming mga medical center chief naman po, Mr. Chair, Madam Chair, and Honorable Congressman, tinitignan nila yung kung walang availability at na-admit po sa private, we cover it po.
So, just this year?
Yes, Madam Chair, Honorable Congressman, because...
But you confirmed that in previous years it is not happening. Those patient, indigent patients admitted in the private rooms are not allowed to avail the MAIP.
In the previous years, Honorable Madam Chair and Mr. Congressman, noon naman po ay binabayaran pa rin naman po based on the needs po, kaya we adopted it moving forward. Na-improve po, nalakalagay na lang po sa policy because we revised our guideline.
Madam Chair, I do not agree on the statement made by the DOH because for the past several years and even decade, that is happening in our regional hospital in Region 6, particularly Corazon, Locsin, Montalbano regional hospitals. Indigent patients that is admitted in private rooms are not allowed by Dr. Drilon, your head of hospitals in Corazon, Locsin. He never allows. And that's why, Madam Chair, I just like to point out, please, Mr. Secretary, remind all those heads of hospitals with regards to the new policy of the DOH, paki-remind lang sila kasi as of last month, doon sa amin po, wala pa rin yan. Pag indigent, wala nang bakante doon sa ibang rooms, papasok sa private rooms, hindi maka-avail ng MAIP nyo po. Kahit yung pondo namin, they cannot use and avail our funds because that is the policy of the DOH now. Please remind all those heads of hospitals. Can I get the commitment from the Secretary?
Yes, Madam Chair, Your Honor, we will inform the Director of Corazon, Montalbano to actually follow the guidelines to allow utilization of MAIP even if the patient is in the private ward. We will write him directly.
Thank you, Mr. Secretary. Madam Chair, and next is indigent patients, critical and emergency cases that is admitted in the private hospitals during emergency cases, then this transferred to a DOH or public hospital, again, they're not allowed to avail the MAIP. Is it also the policy of the DOH?
The policy is already allowed as long as the hospital has a memorandum of agreement with the regional office.
No. What I'm saying, Mr. Secretary, is the patient from the admitted because of emergency cases from a private hospital, then transfers to a public hospital. Is it the policy of the DOH that they cannot also avail the MAIP?
There is no policy like that, Madam Chair, no, Your Honor. So,
Again, Secretary, Mr. Secretary, please check your heads of hospital, because if this is happening in my region, in my city, this might also happening in other regions and cities and provinces. Kasi sa amin po, since the start of the MAIP program, hindi po pwede. The regional hospital or the Corazon Locsin Montelobano Regional Hospital never allows those indigent patients admitted in the private hospitals and transferred to public hospital. They never allow to avail the MAIP. Again, please check, because this is a very serious problems of the indigents in our province and our region. And siguro nangyayari din po ito doon sa ibang regions and provinces.
yes, Madam Chair, Your Honor, we will check.
Can you issue, Secretary, a memorandum or a circular?
Yes, we will
just
issue
to
that.
remind them?
Madam Chair, we will issue a memorandum to the regional hospitals.
Can I get the commitment of the Secretary before the plenary?
Yes, we will issue that before the plenary.
Thank you.
Madam
Thank
Chair.
you, Madam Chair. Last na lang, Madam Chair, sa PhilHealth.
last question,
Madam
sir.
Chair, baka makalimutan ko lang, please list my name for the second round. Now, PhilHealth, you mentioned a while ago that the net of the PhilHealth is 79 billion for 2022. Tama po ba?
Yes po, correct po.
Now, 79 billion plus you're asking for subsidy to the national government.
Yes po, correct po.
How much?
The subsidy we're asking for po is
Sa NEP 101.5 billion.
po, if I'll allow Sir Renet to answer the question.
Madam Chair, Honorable Congressman, the PhilHealth subsidy request for year 2024 is 101.5 billion, Mr. Chair. For 2024 po.
Microphone, please, Compaduano. Yeah.
The 2020, minention niyo kasi yung...
Sir Manny, sir, please put off your microphone.
Sorry.
Yeah, thank you.
Sorry.
For 2022 and 2023 subsidy.
PhilHealth, please respond.
Check ko lang ang record. Madam Chair, our funds for year 2022
Subsidy. I'm asking for the subsidy.
Subsidy po ay 2022 ay 79.930 billion, Mr. Chair, and 2021 71.292 billion, Mr. Chair.
And now 2024 again, how much?
2024, Madam Chair, Honorable Congressman, for year 2024, ang ating request ay 101.580 billion ay syntax and 21.1 billion ay galing po sa PCSO and PAGCOR Fund. Madam Chair, Honorable Congressman.
Madam Chair, with that huge amount, Madam Chair, ang tanong dito, bakit ang dami niyong backlog doon sa payments doon sa mga private hospitals?
Yeah, Compaduano, just to clarify, that's the request or that's the actual funding? Kasi kaninang sinabi niyo 79 billion. Now you're saying 101. Which is, that's the request or that's the actual subsidy you got? Please respond to Kong Paduano.
That 79 billion, Madam Chair, is the net profit of PhilHealth. And they're still asking for subsidy in the government, national government, every year.
Yes.
So that 101 is the actual net budget.
Yes, Madam Chair. Yes, Madam Chair, Kong.
Now, Madam Chair, that is why with that huge amount of funds, bakit nadidelay yung payment natin?
PhilHealth, please respond.
Go ahead. You want to say something? Again, Honorable Chair, Honorable Kong Akop, no?
No, Kong Paduano.
Sorry, my apologies, sir.
Yeah, it's okay. Pogi naman si
My
Kong
apologies,
Akop.
sir.
Sir Paduano.
Yeah. So, my apologies, Kong Paduano.
Yeah, but you accepted. Please proceed.
As I mentioned earlier, because you were saying, sir, there's a delay in payments, bakit ang bagal ng pagkabayad, no? So, what we are planning to do para mapabilis is I was asking earlier, if we can be given 90 days, we're going to implement this DCPM.
What is that DCPM?
It's called Debit Credit Payment Mechanism, wherein po we will advance 80% of the funds, tapos magre-reconcile na lang para mas mabilis po. So that way po, as I mentioned earlier, within 90 days po, maximum, halos lahat po yung outstanding na 27 billion, mababayaran na po.
So, as of August, you have a 27 billion outstanding.
Yes po, that's the total po. That's the grand total po.
Yeah. Maybe request Honorable Paduano to please wind up.
Anyway, thank you, Madam Chair. I will just have my time in the second round. Thank you. I will just follow up my question with the PhilHealth. Thank you.
Thank you very much, Kong Paduano.
Thank you po.
Before the next interpolator, may we get the commitment of Secretary Herbosa to comply with the request letter of Kong Paduano by mid of next week? Will that be possible?
Yes, Madam Chair, we will comply.
Okay. May we now proceed to the Honorable Jaime Fresnedi for his interpellation.
Thank you, Madam Chair. Good afternoon po. Good afternoon po sa DOH family. Madam Chair, in the GAA 2023 versus NEP for 2024 budget comparison, I noticed that the budget for the Office of the Secretary, budget for the National Nutrition Council, and budget for the Philippine National AIDS Council all decreased for 2024. May we know the reason, Madam Chair, why there was this decrease in the budget for 2024 or NEP for 2024?
DOH, please respond.
Yes, Madam Chair, yes. In the, if you compare NEP to NEP, the decrease was the National Nutrition Council from 401 million. It went down for 2024 to 296. For PINAC, it actually increased because our NEP in 2023 was 43 million, but the NEP this year is 46, so it actually increased. But the GAA we received last year for NEP, for GAA 2023 for this year, is actually higher at 52. So yung NEP yung bumaba po. Pero sa GAA, pag GAA to NEP, pababa. Pag NEP to NEP, tumaas.
Meaning to say, it actually increased.
Yes, it actually increased. Kung NEP to NEP lang po ang pinag-uusapan.
Even at the Office of the Secretary, Madam Chair?
Yes. For the Office of the Secretary, the 2023 NEP was 195 billion in 2023. But the NEP now is 204 billion. So actually, tumaas. Pero if you compare it from the GAA was 214. Pero ang NEP ngayon, 204 na lang. 10 billion yung nakaltas.
Okay. That means there was a decrease for 2024 compared to 2023.
Yes, from GAA to NEP, there is a decrease. Pero from NEP to NEP, it's an increase.
I think the GAA is the actual.
Yes,
And the NEP is the proposed. Even, meaning to say, there was a decrease.
Ngayon po, from GAA to NEP, there is a decrease.
There was a decrease.
Yes.
Okay, may we know the reason why there is a decrease of almost 10 billion? Madam Say.
Asan yung, most of the decrease, your Madam Chair, was actually in the HPEP and the MAIP. HPEP, MAIP. MAIP was a decrease of 10 billion, minus 32%. HPEP was a decrease of 3.8 billion, almost 4 billion. And then about 1 billion to the other programs. So those were the decreases, Your Honor.
Well, Madam Chair, I think MAIF is really very important, especially to the indigent patients, no? I suppose instead of decreasing the provisions or the budget allocations for MAIP, we should instead increase the budget for MAIP, Madam Chair. Madam Chair?
Yeah, DOH, can the DOH clarify, was there really a decrease or none?
From GAA to NEP decreased, but from NEP to NEP
But how do you
increased.
compare? Is it NEP to NEP and GAA to GAA? Or do you compare apples and oranges?
NEP to NEP.
NEP to NEP. Okay, you
I think GAA for 2023, the current, and NEP is the proposed. For 2024, it will become GAA. If we approve and toto, it will be a decrease of, there will be a decrease of 10 billion. Am
That's
I right,
correct, Madam Chair.
Madam
That's
Chair?
correct, Your Honor.
So I was saying that instead of decreasing the budget for MAIP, of which thousands of indigent patients benefited, we should, instead of restoring back, we should further increase the budget allocation for MAIP, Madam Chair.
What does the DOH say?
We concur because we see that the MIP, actually our proposal to DBM was actually 40 plus, 42, no? 42 billion for MIP this year, but they slashed it to only 22. So that's how it went down. The current year is 36, 32. 32. Our current GAA MIP is 32. So our initial proposal to DBM was actually 42, but it was cut. So this is where we are now, 22.
Okay. Madam Chair, I appeal for the reconsiderations of this budget for MAIF, not only for restoring back the budget, but it should be increased, Madam Chair.
Yeah, the Committee on Appropriations take notes of the sentiments of the Honorable First Lady. Actually, then the GAA is already an adjusted NEP. So if you look at the NEP to NEP, that is what DBM approves, but when the inputs or the adjustments from the legislative, Congress and Senate comes, it equates with the previous GAA or even higher. That's actually the context. So maybe can the Honorable Secretary affirm this?
I confirm, Madam Chair.
So maybe now proceed to the next
Yes,
section.
Madam Chair.
Thank you, Kong.
In your budget utilization for 2018 to 2023, and it says here that the budget utilization by obligation is 91%, while the average utilization by disbursement is 76%. May I, Madam Chair, may we know the status of the budget disbursement by utilization from 2018 to 2022?
DOH, please respond.
The average, Madam Chair, 2018, our disbursement rate was only 65%, but our obligation rate was 95%. Our delays to explain disbursement, it's really mostly the construction because the
Sec, can you please answer his
Madam
question? He was referring to the average disbursement rate for 2018 to 2022. Am I right, Kong?
Yes.
Yes, so please,
yeah, the average disbursement rate for the past from 2018 to 2022 is 76% only.
Do I assume, Madam Chair, that from 2018 to 2022, this average 76% disbursement by utilization is already 100%?
Yes, Madam Chair. Usually what happens is mostly HPEP, it is put as a continuing appropriations, and when the projects are finished either the following year, like for 2021, it's completed by 2022 or 2023, it becomes 100% thereafter.
Maybe it applies in 2022 budget, Madam Chair, but from 2018 to 2020, may we know if it is already, the disbursement utilization is already 100%?
yeah, can the DOH please respond?
Yes,
May we
we have-
request the other members present, other people present in the room to please minimize your voice. Please proceed, Secretary Bosa.
Thank you, Madam Chair. For our utilization obligation, disbursement, our disbursement already for 2018 was 88.8%, for 2019, 86.9%, for 2020 it was 94.5%, for 2021, 85%. So it's only 2022 where our utilization is still, our
Sir?
disbursement is still only
Yeah, if I
59.
may, just to clarify, the question of Congressman Fresnedi was actually, your answer is applicable to 2021 onwards, but he's referring to the disbursement that you mentioned. Dahil hindi pa siya 100%, how can that be when in fact that was 5 years ago? That's the question of Congressman Fresnedi. Ibig niya sabihin itong 88, 86%, ito ba ay continuing project because that's like several years ago, 18, 19, 20, 21, 22, it's 5 years ago.
So, ma'am, some of the money, Madam Chair, some of the money has been reverted to the National Treasury. If the project was delayed or not completed,
the answer,
that's the answer why
Kong,
it's
is the funds has already been reverted. So it was not disbursed 100%, but those that were not allowed were already reverted.
Meaning to say, Madam Chair, the project was not finished or completed.
Secretary Bosa, please respond.
I beg your pardon, may I?
Meaning to say, when the budget was returned to the National Treasury, the project was not completed, Madam Chair.
That is correct. Either the project was deferred or not completed.
So, Secretary Bosa, I believe the concern of Congress Nedi is that it goes back to your previous answer. It was not 100% disbursed. Can you possibly correct your answer, sir?
Yes, I will correct it. Was because there are some projects that eventually are not built because sometimes by the time it's utilized, there's already a facility built there by local funds. So we have to look for another site.
So, Congress Nedi?
Yeah, okay, Madam Chair. Another issue, Madam Chair, is about malnutrition. According to the World Bank, for nearly 30 years, undernutrition has remained a serious problem, with 1 in every 3 Filipino children below 5 years old suffering from stunting or pagkabansot. According to the United Nations Children's Fund, it also kills 95 Filipino children every day, while 27 out of 1,000 do not get past their 5th birthday. May we know what your agency are doing to address the problem of undernutrition, Madam Chair?
DOH, please respond.
Thank you very much, Madam Chair, Your Honor. For the malnutrition or undernutrition and stunting, we have just launched recently the Philippine Plan of Action for Nutrition, and we are addressing our stunting problem. For under 5, it's 26%, which is a very significant problem. And we are addressing this together with the SWD. They have the food stamps program. We have the first 1,000 days program with the 1,000 days coalition, making sure that the pregnant mother and the lactating mother are given proper nutrition, nutrients and micronutrients that are necessary for the development of the fetus and the newborn child when they are breastfeeding. So we're also imposing mandatory breastfeeding for our newborns. And we also have, with the DSWD partnership with the daycare feeding program. So once the children are brought to daycare, the Department of Health together with DSWD gives feeding to those that are assessed as mild to moderate malnutrition. And those that are severe, we bring to the hospitals. And then at the school with DepEd, we also have a school-based feeding program. So we try to catch it at the different stages in life. But I agree, Your Honor, we need to do more. I think the emphasis will now be on the first 1,000 days, really, so that we can have more funding for this and be able to do this at that sites. Currently, the National Nutrition Plan has a 243 barangays, right, that we are focusing.
Congress Nadi?
Yes, I do agree with you, Mr. Secretary, that we should address this problem and to start within 1,000 days from conception, because if not, the adverse effect to the children, not only to the health, but to the performance in school. And also, it says that according to the survey, the performance of Filipino students in 2018, the Philippines ranked the lowest among 79 countries in mathematics, science, and reading. So I do hope that the agency should also fill the different vacant position for them to perform their mandate efficiently, because I noted that there are a lot of vacant positions unfilled. So, Madam Chair,
DOH, can you respond and please commit filling up of unfilled position, NNC?
Yes, Madam Chair, we commit to filling up the positions for this. Aside from this, I'd probably like to disclose that we're also looking at not only nutrition-specific problems, but nutrition-sensitive. Like, for example, water, sanitation, and hygiene. It has also been found that in poor communities, the frequency of diarrhea because of the lack of potable water is a source of undernutrition. So, dinalawa na namin yan. May nutrition-specific, which is feeding, and nutrition-sensitive.
May I now yield to the Honorable Rachel Arenas.
Madam Chair, my last question po.
Go ahead.
Yeah, okay. Sa PhilHealth po, no? Anyway, I already talked to the President, and I just would like to reiterate my appeal to at least consider the early facilitations of the collectibles of the Hospital de Muntinlupa. I hope na ma-actionan po ito na mabilis dahil malaki po talaga ang pangangailangan ng OSMON. Maraming salamat po.
PhilHealth?
Thank you, Madam Chair. Yes po, we'll comply and address, and we've already started to reconcile po. We'll get back to you immediately po.
Maraming salamat. Thank you, Madam Chair.
The next to interpolate is Deputy Majority Leader Bong Teves.
Thank you, Madam Chair. Madam Chair, fellow Congressman, the Department of Health, Secretary Herbosa, good afternoon. Madam Chair, following the analysis of the Department of Health budget from year 2016 to 2022, the DOH disbursement rates have not exceeded to 81%. For example, in 2021, the overall disbursement rate of the DOH is 72.4%, while in 2022, mas bumaba po ito with a rate of 68.7%. Ibig sabihin nito, hindi po namamaximize ng ahinsya ang pundong ibinigay sa inyo. Madam Chair, iko-continuous ko na lang siguro pa after na nila ako sagutin. For example, in your health facilities enhancement program, in 2022, kung saan itong programang ito ay nagko-construct ng mga rehabilitate ng mga barangay health station, rural health units, at iba pang health facilities, ang inyong disbursement rate ay 29.7% lamang. Ano ba ang dahilan ng mababang disbursement rate na ito kahit na 85.2% naman ang inyong obligasyon rate sa nasabing programa? Ibig sabihin lang po nito, Madam Chair, mayroon budget ang health facilities enhancement program na 24 billion na nakapag-obligate po ang DOH ng 20 billion pero ang amount disbursed lamang ay 7 billion. Next, Madam Chair, may pondo para sa mga construction of health facilities sa Camarines Norte, Sorsogon at Bay, pero walang nakalaan na pondo para sa mga medical equipment. Dito ganun din sa Batangas, Cavite, Laguna, Quezon, Cagayan at Rizal. May mga pinagawa silang construction pero wala po silang mga facilities. Aanhin po ang health facility kung wala namang kagamitan. Samantalang mayroon pong unutilized funds ang DOH na 29.7 billion noong year 2022. Alam ko po na hindi si Secretary ngayon ang siyang may katungkulan ng mga panahon. Sana mabusisi po natin ito. Last, Madam Chair, napakalaki po ng unutilized funds ng DOH noong year 2022 na may halagang 29.7 billion. Bakit hindi natin tulungan ang 149.86 municipalities na nangangailangan ng pondo para sa pambili nila ng gamot at bigyan sila ng gamot? Ibig sabihin, kung ito lamang ng mga munisipyong ito na naghihirap, ay bibigyan natin ito ng tig 2 million na halaga ng gamot. 2.8 billion lamang ang halaga nito. Meron pa po kayo natitira na 26 billion pesos. At lastly, po, what are your plans tungkol sa pagdami ng IV trips like glutathione not administered nor prescribed by doctors, kasi nagkalat po ang mga yan sa mga mall at hindi medical professional ang nagkakandak niyan. Paano tayo makakasiguro na ito ay FDA-approved at safe for our consumers? Marami niyan po sa mall. At hindi po ako babait, nakikita ko yan. At lastly po, meron po akong natanggap na sulat. Nangyari po ang aksidente sa Paki, Laguna. Itong pinsan ko po ay na-aksidente noong September 2, 8 p.m. Dinala nila sa ospital at ang sabi ng nurse at doktor doon, kailangan pumila po ang pasyente. Ito po ay emergency na dahil na-aksidente. Pinapipila po sila at pagkatapos noon, wala pong tumingin na doktor. Pero noong September 3, 2 a.m., binawian na po sila ng buhay. Saka po sila po pinuntahan ng doktor at nurse. Sana tingnan po ito ng mabuti. At lastly po, Madam Chair, this representation is not against the proposed budget of the Department of Health. In fact, I am in favor of increasing its budget to help our indigent patients. Pero dapat ma-maximize ng Department of Health at dapat walang unused budget tulad ng nangyari last year, 2022. ang DOH dahil kapag walang unused budget o savings or walang surplus ang DOH, ibig sabihin ang lahat ng pondo ninyo ay nagagamit at napapakinabangan ng mga may sakit dating mga kapwa Pilipino. Maraming salamat po sa inyo lahat at inuulit ko po, sinusuportahan ko po ang budget ng Department of Health.
Secretary, you may answer.
Maraming salamat, Madam Chair. We were making efforts for our obligation rate to increase, especially for the HPEP program. Salamat po. Also for the equipment, usually ina-allocate namin po, Madam Chair, yung equipment pag patapos na, pag malapit nang matapos yung facility. And kung minsan hindi nagkakasabay, totoo yun po. May mga ibang facility na natapos at wala pang equipment. So, aayusin po namin ang aming trabaho. For the rest of the budget, unutilized, the unobligated budget, meron na kaming outstanding requests, some for MAIP, some for some other specialty hospital, and some for the healthcare workers health emergency allowance benefit dun sa unutilized, para hinihintay na lang namin po ang approval, Madam Chair, ng DBM. Sa glutathione, nakausap ko na po ang aming Director General ng FDA na siyang nagpupulis at magmo-monitor ng itong off-label use ng glutathione sa iba't ibang lugar, lalo na sa mall, pati na yung mga fake medicines sa internet. Ako po ay nabiktima na rin na may ini-endorse daw akong gamot sa internet. So, inatasan na namin ang Director General at nakipagpulong sila kasama ang NBI. In fact, may mga doktor na nag-file na rin ng complaint para magkaroon ng kaso yung mga gumagawa po nito. And then sa huli, kukunin ko po yung pangalan ng ospital para ma-imbestigahan natin at alam nyo naman, ang mga ospital, ang Department of Health ang nagbibigay ng license to operate. So titingnan natin kung may violation po talaga dito sa pasyenteng namatay dito sa Pakil, Laguna. Maraming salamat, Madam Chair.
Saan ko pwedeng ibigay ito?
Congressman Bong, you can give it to the DOH.
Hindi. Pakunin nyo na lang, kunin nyo. DM ikaw. Okay. Wala si Kong Loyola, wala. Tawagin mo lang yung dalawa. Tapos si Kong Rufus.
The next is our Vice Chair, Congressman Roy Loyola. Is he here?
Coming. Next lang
Okay.
muna.
Congresswoman Jervil Ruistro.
Rufus Rodriguez.
Congressman Rufus Rodriguez.
Thank you very much, Madam Chair, and a pleasant good afternoon to the Department of Health officialdom, headed by our very energetic Secretary of Health, former Executive Vice President of the University of the Philippines, the best university in Diliman. Because the best university in Taft Avenue is the La Salle University. My good friends from here, we have here Yusek, Tayag, let us form a DOH and a house dance troupe. Yusek Dumama, Asek Orgolon, they were there in Cagayan de Oro for the blood bank. Thank you very much. And where is Yusek Verhere, the hero to fight COVID-19? Madam Chair, under the leadership of Secretary Herbosa, we see here under the accomplishments, a long line of accomplishments. And that is so because the Philippine Constitution, which is Section 15 of Article 2, Declaration of Principal State Policy states that, here is the hero of COVID-19, Secretary Verhere, Yusek Verhere. We, Cagayan de Oro, thank you so much. And since I mentioned already the personalities, then let me mention the outstanding Regional Director of Region 10, who is already, RD Nenet Gamolo here already? Where is Nenet? Can you stand up on the other room?
and also Dr. Dinampo for MAIP and Engineer Mallorca for HPEP. All right. Going back to the Constitution, Section 15, Article 2 provides, the state shall promote and protect the right to health of all Filipinos and instill health consciousness among them. Because of that, Madam Chair, I would like to congratulate Secretary Herbosa because here are the accomplishments. 2,372 HVAC projects completed. That is for 2022 aside from the present half year. 2.8 patients served by the MAIP, including the 1,000 served in Cagayan de Oro. Thank you so much, Secretary. And then 66 currently antiviral therapy, 1.3 children fully immunized, and a feeding program. And I wish to acknowledge Asik Dayanghirang. Please stand because she is taking care of our children from age 1 to 1,000 years old. 100 years old. So, that is why I have filed a bill to make their council become a commission so that there'll be more funds. So, after all of these achievements, Madam Chair, I look at the budget, I am aghast, I am disappointed because you see, you can see here that the budget of the DOH has been reduced. The DOH-wide budget is reduced by 3% from the level of 2023 of about 10 billion. And also, Madam Chair, the reduction of the Office of the Secretary, which is a reduction of 215 billion to only 204 billion. 11 billion. How can we do this? To the Department of Health, tasked by our Constitution to lead a charge, to give the right of the health to the people. Madam Chair, that is my question. So may I ask our Secretary, of the 11 billion that was slashed, that was reduced, because in the proper time I'll move for the restoration at least to the 2023 GAA. Which of these are very important to the department such that you will be asked to submit to the committee what can be restored of the 2023 budget to 2024. Madam Chair.
Secretary.
Yes, Madam Chair. Our main ask for the reinstitution of the slash budget is for the medical assistance to indigent patients program, wherein more than 32% was slashed for about 10 billion. Our proposal was 42. It's only 22 in the NEP. Our current budget is 36. So we hope that that can be returned.
Aside from that, what else? But before I proceed, I see now our outstanding regional director. Can you take about Director Gamolo? Yan ang aming director. MAIP, andyan lahat ng MAIP. Mga medisina for my medical missions nandyan. For HPEP nandyan. Nandyan ba si Engineer Mallorca? Where's Engineer Mallorca? Can you take? Yan ang magaling yan. Ang dami nang natapos ng mga rural health units. Saan nyo sa MAIP? Si Dr. Dinampo? Nandyan din. Thank you. So please proceed, Secretary.
So ang second po, Madam Chair, is the Health Facilities Enhancement Program. Yun din ang pinakamalaking nakaltas. 3.8 billion, almost 4 billion ang nakaltas po doon sa aming proposal. So marami pong nagre-request ng mga health facilities na sa ngayon yan ang tinututukan natin dito sa Universal Healthcare Implementation, yung ating mga primary care facilities na doon mararamdaman talaga ng mga tao na may healthcare as stated in the Constitution, Madam Chair.
Thank you very much, Secretary. I gave you a letter. Have you received my letter dated today?
Yes,
because my second round depends on your correct answer in this question.
Yes, Madam Chair.
I have requested very small, only 6 barangays with 8 million each, and super health center in 12 million. Will that be included in the 2024 of your budget?
We'll make sure we look for unutilized funds.
Oh, that's not enough, Secretary. We want categorical answers here because that's very small. Our units would need this. Just 6 units at 848 plus 12. Only 60 million. How can you say we look into unused? How can you say that with this representation?
Madam Chair, according to Asek Gorgolon, the head of HPEP, we will fund your request.
Thank you. That is the correct answer. So, Madam Chair, because my time is up, I will not anymore go to second round because right now, I now move not only for the approval of the budget of the DOH, but to increase the budget of the DOH, especially on MAIP and also the HFEP. So move, Madam Chair.
Sir, we will...
There's a motion.
Yeah,
Is there any second from my colleagues?
We will take up your motion at the proper time, Congressman Rufus.
At the proper time, I will move the plenary. They deserve, and therefore, Madam Chair, I congratulate our Department of Health to Secretary Herbosa here and to all present here. Congratulations to all. Let's fight for the increase of the budget of the Department of Health. Tingnan mo.
The next to interpolate, Vice Chair Roy Loyola.
Thanks, Yusek Gorgolon. Thank you very much, Asek. Improving the budget.
Thank you, Madam Chair. Good afternoon to the DOH family, headed by Secretary Ted Herbosa. Madam Chair, all my queries has been answered already by the good secretary, and for this reason, I respectfully manifest my strong support to the budget of the DOH. And if there's a way to increase the budget of the DOH, I will be happy to be a co-author of this measure. I so move, Madam Chair. Thank you.
Thank you, Vice Chair. Vice Chair Alan T. Is Vice Chair Alan T. here? Congressman Ron Salo. Congressman Choderico Aresco. Congressman Ando Ominal. Congressman Marcoleta. Deputy Majority Leader J.J. Suarez. Representative Mark Go. Congressman Ernesto Junicio. Go ahead, please.
Present, ma'am. To all my distinguished colleagues, sa ating former President GMA, ma'am, magandang hapon po. To the Department of Health family, again, good afternoon. Ako po si Kong Ernix from District 1 of the City of Manila. First and foremost, gusto ko lang pong iparating kay Sec, yung mga tao niya po, si mga nakakaharap namin na representatives from DOH, napakabait at napakagaling na asikaso po yung distrito namin. Kaya maraming salamat po for the record. Pero, Sec, yung tanong ko lang po, I've been hearing some information. I just want clarification kung totoo or hindi. Kasi yung MAIP po natin, yung utilization capacity medyo mababa po. I'm hearing that it came from you na may plano po yata kayong maganda na para magamit ng mas madali for it to be flexible. Meron po ba kayong any plans for the MAIP program to be more flexible in utilization, sir?
Secretary.
Yes, Madam Chair, Honorable Congressman. Yes, we plan to actually utilize the new rules, which has allowed us to even use the MAIP for private hospitals, and also to be able to use it also for other requirements, no? Implants for other things. So normally tumataas naman po by the end of the year na you-utilize talaga yung mga indigents and the needs for that. But at this point parang medyo mababa, but alam namin humahabol yan, nauubos din yung funds over the end of the year.
Thank you, Sec. Is there any chance, may I know, if posible po kaya yung magamit po yung MAIP program for the procurement of medicines and wheelchairs?
as of now, pag sa hospital na prescribe yung medicines, of course, magagamit. And what we've done to go around that is to prescribe already on discharge a certain amount of the medicines. Pero once outpatient, hindi ho nagagamit yung MAIP eh. And also for the assistive devices, yung wheelchair and other mobility devices, hindi siya allowed doon sa aming maybe Attorney Grande, Asek Grande can specify the rules on the use for mobility devices.
Asek, please.
Thank you, Madam Chair. Honorable Congressman, in our present GAA today, Honorable Congressman, we cover for medicines, hospitalization, and yun pong, ang tawag doon, yung mga prosthetics, yung mga ginagamit during the operation. But insofar as procurement of wheelchairs is concerned po, hindi pa po covered po siya under our present GAA. And for the improvement on the MAIP, we have proposed also special provisions that improve the access to the MAIP. So in the NEP, in our new NEP that's approved po dun sa DBM, wala na yung certification by medical center chief. So it will be now more, mas madali para sa mga regional offices natin to enter into a memorandum of agreement. We have also proposed for the expansion of other health facilities na makover po ng MAIP. And then medicines, we have also proposed for medicines that are not covered by PNF so long as it is prescribed by the doctor and FDA registered. So this will, if this will be approved po, Honorable Congressman, this will actually make the MAIP more accessible and comprehensive. We don't procure po, Honorable Congressman po.
Yes, thank you. Siguro if in any way, shape, or form that it could be possible. Sa amin, ma'am, we have funds as representatives sa MAIP na marami po kasing naghihingi ng mga wheelchairs and medicines. You know, I understand that the facilities, the resources of DOH, kaya nakikinig ako simula umaga, marami naghihingi, marami nagre-require, but bumaba yung budget. No, we in general have to understand that our resources are limited. I'm the first one to understand that. Kaya yung sa akin po, if there are funds readily available, baka we can look into it na magamit natin kasi marami naghihingi ng medicine sa wheelchair. So lang po, and again, asahan niyo po yung suporta ng ambang lingkod ninyo sa DOH. Mr. Sec, marami pong salamat. Thank you very much, Madam Chair.
The next to interpolate is Representative Mark Go.
Thank you. Thank you very much, Madam Chair. Good afternoon, Secretary Teddy, at lahat po ng mga opisyal ng DOH na nandito ngayong hapon. Gusto ko pong tanungin yung PhilHealth. Last or this year, ang inallocate po ng ating gobyerno to PhilHealth is 102 billion. Tama po ba yun? And this year, it's going to be almost the same, but it's higher, 101.5 billion pesos.
Madam Chair, can I allow Sir Renet? Yes po. Yes po, Madam Chair.
Okay, Madam Chair, dito po sa ito po yung mga premium payment ng mga covered ng mga tao na binabayaran ng gobyerno. Tama po ba yun?
Yes po. Yes
okay. If you look at the record now, out of this premium payment made by the national government, ilan po yung mga benefits na ibigay ninyo para dito sa mga ito?
Total benefits po is
hindi po yung buong bansa, kundi po yung lang na binayaran ng gobyerno. Ano po?
PhilHealth.
Po, for calendar year, Madam Chair, for calendar year 2022, the total benefits is 56.09 billion po.
So, ang ibig po sabihin niyan, you have earned from the government more than 44 or 40 billion pesos because what was given to PhilHealth is almost 100 billion, but the amount that you paid to the hospitals for these people covered by the national government is only more than 50 billion pesos. So, you have a lot of savings generated, or income, if you may, out of the payment made by the national government.
Yes po. To answer your question, yes po. However, we will use that po for the subsequent years po.
Yeah, Madam Chair, hindi ba if you do a study, there should be a refund that should be given to the national government. In our experience, if we deal with an insurance company and if you have good performance during previous years, you can be refunded or you can have a rebate, if you may, pag ganito po ang sitwasyon. And every year, ganito nangyayari sa PhilHealth. Sobrang binabayad ng gobyerno in terms of premium as against yung binabayaran ng PhilHealth sa mga ospital na ang nagbabayad ng premium para sa mga pasyente ay ang ating gobyerno.
Madam Chair.
Go ahead.
Yes po, noted po. By law po, I think we're allowed to carry it over for 2 years po. And the huge surplus po will be used to increase our benefit case packages po, which PhilHealth has not touched for more than 10 years po.
Yeah, pero kailangan siguro i-consider niyo yung pagbabawas ng premium payment per individual, Madam Chair. Kasi yung ginagawa nyo, in-increase yung benefit, pero yung experience din ng mga kinocover ng gobyerno ay ganun pa rin. More or less about 50 billion pesos yearly. And the contribution of the government for these people is more than 100, more or less about 100 billion pesos. So dapat, based on this experience, yung premium na binabayaran ng gobyerno should be reduced significantly.
Agree po, it's just that po kasi ang laki po ng kailangan po ng increase ng benefit payments. If you'll notice po, yung increase namin are very huge eh. So kung babawasan po namin yan, makukulangan po kami pagdating sa increase ng benefit payments, which we've started doing already this year po.
Madam Chair, hindi po tama yung sagot ninyo. Kasi based on experience, nabanggit ko kanina, ang binabayaran ng gobyerno is about 100 billion per year sa premium ng mga kinocover natin. At yung binabayaran ninyo sa mga pasyente na pumupunta sa ospital, on a yearly basis, about only 50%, about 50 billion pesos. So, hindi ba kailangan bawasan natin yung premium contribution na binabayaran ng ating national government?
Noted po. We will look into it po. Because based on my understanding po, yung benefit plan namin po, kakailanganin namin yung pondo. But we hear you po. Maybe we will study it further po and revert to you po.
Madam Chair, probably this is where we can get some funds from the 100 billion that we allocate to PhilHealth. After all, you mentioned this morning na ang inyong cash, very liquid kayo, ilang daang bilyong piso ang nasa coffers ng PhilHealth ngayon. Tama po ba yun?
Yes po, we currently have 466 billion po in cash.
O kasi po, yung 100 billion na yan ay galing sa national government. Okay, so I think that's one item that I would like to point out. Yung pong second question ko, dito po sa headcount ng PhilHealth, ng Department of Health, ang inyo pong plantilla position, Mr. Secretary, is about 96,806 based on the report given to us by the CPBRD At yung pong unfilled positions ninyo, on the average, is about 19,900 on an annual basis. And this has been there since 2021 and even in the previous years up to today.
PhilHealth.
Now, Mr. Secretary,
Madam Chair, sa akin yata ang tanong. The unfilled positions, you are correct, Madam Chair, Your Honor, 19,000 positions. Pero nagbabago naman ho yan. Sometimes na-fill up, tapos may ibang na-unfill. Ganun yung ano yan.
pero ito po yung average annually. So yung pong pondo nito
nasa DBM naman yan.
Hindi pa
kasi
po
PSN
na-download sa inyo itong payment
pag
dito.
na-fill up yung item, tsaka lang binibigay ng DBM.
So at any given time, you have 19,000 unfilled positions.
Plantilla positions, yes.
Kaya pa buwan ninyong i-fill up ito? Kasi kung every year meron kayong ganong 19,000 na unfilled positions, hindi po kaya, ang ibig sabihin niya, baka hindi nyo talagang kailangan na yung 19,000.
Kaya naman po kasi most of these are in the hospitals. We run 83 hospitals. Tapos some of them are the low items na ayaw applyan kasi napakababa, below, no takers kasi they're low. Baka some of the solutions would be, we're studying it, is to slash them and create to a better position na attractive doon sa ating mga gustong pumasok sa trabaho. So yung mga orderly or workers, very low yung salary grade. Parang ayaw pumasok. So yun yung mga unfilled. Pag talagang unfilled, mag-request na kami sa DBM na anong tawag doon? Yung co-consolidate. We pull those that are unfilled and then create new positions para yung salary and pera magamit naman ng Department of Health.
Okay, so this year po siguro or
Yes.
2024, you'll be able to fill up a significant part of this 19,000.
Yes, Madam Chair, Your Honor, we will do that.
positions.
We will make our efforts to do that.
Okay, last question po. Dito po sa budget natin for 2023 and 2024, meron po kayong budget na more than 2 billion pesos for health promotion. I think this is a good approach, Mr. Secretary, because it's more preventive.
Correct.
Kasi po kailangan po natin ito. Ano po ba yung mga specific strategies ninyo to ensure that we promote yung wellness and health yun po ng ating mga kababayan?
Yes, maganda po yung Madam Chair. Health promotion is the area where it's low cost pero malaki ang impact. For example, better nutrition, exercise, and other programs to prevent yung mga non-communicable diseases. For example, if we're able to prevent diabetes, bababa yung diabetic nephropathy, bababa yung nagkakaroon ng dialysis na nanghihingi sa ating mga congressman ng for dialysis. Siguro, Madam Chair, I can recognize Yusek Berhere, who's in charge of this program, to describe in detail yung iba't ibang programa ng health promotion.
Yusek Berhere, you're now recognized.
Good afternoon po, Madam Chair, and good afternoon, Honorable Congressman Marco. Yes, we have actually integrated dito po sa healthy settings po natin na programa for health promotion.
Okay.
So, we've actually integrated our programs for health promotion into our healthy settings approach, kung saan we have implemented this health promotion among the different settings where we most are during the times of our lives. For example po, sa eskwelahan, we have healthy learning institutions. For workplaces, we have healthy workplaces. For the community, we have healthy communities. And now we have healthy hospitals as well. Dito po sa mga programa po natin, naka-integrate po dyan. Halimbawa sa education, we have our adolescent health. We also have our immunization, may mental health services, meron po tayo for sexual and reproductive health, and the others. Ganon din po sa workplaces and sa ating mga communities. We already have signed memorandum of agreements with the different last mile education schools. Meron din po tayo sa labor sector, meron din po tayo sa mga komunidad. Aside from that, Honorable Chair and Congressmen, meron ho tayong Health is Life campaign, which we do caravans across the country, where we raise awareness of our people among the different priority programs and also the risk factors for ill health dito po sa ating bansa. Bukod po doon, meron ho tayong mga sinusulong na mga regulatory mechanisms, like for example against tobacco, against sugary drinks, against junk food, kung saan katulong po natin yung iba't ibang sektor para po magkaroon tayo ng taxes for that, and we can have more monies for health, and at the same time improving the health of our people. We also have grantees kung saan nagkakaroon po tayo ng mga healthy communities. Meron na ho tayo ngayon 83 province-wide and city-wide health systems implementing Health is Life. Meron ho tayong healthy communities po iyon. Meron ho tayong 30 na healthy schools, 11 po na healthy workplaces, and now we have 122 healthy hospitals.
So, Madam Chair, with all of these things, at the end of the year, you will be able to measure the effectiveness of these programs. So, in terms of mga serious cases po yan, mababawasan yan siguro because of the promotional programs that you have for the, for our people. Tama po ba yun? So, meron po kayong mga metrics na ginagamit para ma-determine how effective these programs are at the end of the year.
Yes, Madam Chair. Honorable Congressman, meron ho kami, no? So, meron na ho tayong ginagawa na survey per year. We call it the Health Literacy Survey. With all of this promotion and preventive programs that we are implementing, we're trying to measure the awareness of people and their behavior, if it's going to change. And this Health Literacy Survey, ito po yung sumasagot doon. So recently, we conducted the survey, and naipakita po nung survey na ito na almost around 75% of our people are more or less aware of our environmental health, our immunization, diet and physical activity. Yun pong measurement of outcomes, like health outcomes, kung mababawasan ba yung sakit halimbawa sa tuberculosis, mababawasan ang sakit sa mga vaccine preventable. We will measure that in the next 5 years. But for now, our main goal is for our citizens to be more health literate para po yung behavior nila is geared towards better health.
Yeah, thank you po, Yusek Berhere. Madam Chair, just one last question if you will permit me.
Yeah, go ahead.
Yung pong when I read the presentation and when I saw it this morning, maganda po yung vision for the health sector. Nakalagay dito, Filipinos are among the healthiest people in Asia by 2040. Medyo maganda po itong vision ninyo. I would like to know, Mr. Secretary, where are we now as a country in relation to the Asian region as far as health is concerned? Kasi we want to be the healthiest people in Asia in 2040. Ano po tayo? Nasaan tayo ngayon? At how would yung pong ano pong natin?
Secretary.
Yeah, Madam Chair, Your Honor. Yes, no, we are now classified as a middle-income country, and by 2040, we'll probably be labeled as a high middle-income country. But our health statistics has remained flat from low middle income. In fact, our neighbors, ASEAN neighbors, I will compare ASEAN na lang po para malaman nyo, yung infant mortality natin steady lang. Yung sa kanila talagang bumaba na, napababa na nila with their efforts. Yung maternal mortality, ganun din. Tayo medyo steady. Bumababa naman, napapababa naman natin, pero our neighbors are overtaking us. So parang medyo nahihiya ako bilang Pilipino na yung ating mga Thai and Vietnamese and Indonesian neighbors are overtaking us in parameters for health. So very important na magpursige pa tayo based on our level of economy. Kasi nga, ini-expect tayo ng ibang bansa na maganda ekonomiya natin, dapat healthy din yung ating mga populasyon. Longer lifespan, lower infant mortality, mataas ang mga batang na bakunahan, na gano'n at walang namamatay ng vaccine preventable diseases at walang outbreak. So, ano lang tayo, flat. We really need to do more para gumanda pa rin ang ating health indices.
So we will expect a lot of things to happen in the next 6 years under this administration as far as our health is concerned.
Yes,
And this
Madam
is,
Chair.
and with your leadership, we will be assured that this will happen, Mr. Secretary.
Yes, Madam Chair, Your Honor, that's our commitment. The Department of Health commits to getting the Filipinos healthy. As stated by Honorable Rufus Rodriguez, this is in our Constitution that we should actually protect the right to health of every Filipino.
Okay.
Thank you.
Thank you very much, Madam Chair.
Thank you, Congressman Marco. The next to interpolate is Congressman Howard Gintu.
Good afternoon, Madam Chair, and to the DOH family. My question is, the DOH proposed a budget of 190,233,000 for health emergency preparedness. Kasama ba sa budget natin na ito ang pag-provide ng mga basic health equipment and medicines para sa mga barangay health stations?
Madam Chair, the funding for barangay health stations is really in the health facilities enhancement program. The funding for emergency is more for the emergency response, and there's also quick release funds. Pwede naman bumili ng emergency equipment like emergency generator pag nawala ng kuryente, but the regular equipment for the barangay health stations is in the health facilities enhancement program, Madam Chair.
So correct, Secretary, the budget for that is 190 million.
Yes, for health emergency management.
Madam Chair, if I'm not mistaken, we have about, well, it's going to be shared across 21,730 barangay health stations. That would give an average of 9,000 pesos per barangay health station. Isn't that budget perhaps too small to be shared across 21,000 barangay health stations?
Madam Chair, that's the health emergency management budget that's managing emergencies. But we also have the budget, which are billions, in HPEP, which is for the funding of regular equipment in the barangay health stations. So pang emergency po yung minimension na 194 plus 500 million na QRF, quick release funds, in times of emergency.
Thank you for that clarification. Another thing, Madam Chair, napansin ko kasi sa listing natin ng mga projects para sa Health Facilities Enhancement Program sa 2024, NEP, walang allotment para sa kahit anong barangay health station at rural health unit sa Capiz. Pero sa tingin ko naman, no, maraming mga barangay health station sa Capiz na nangangailangan ng ma-upgrade. I would like to ask if the reason as to why there is no allocation for the said province.
We will check, Madam Chair, Your Honor, we will check the facilities. I don't believe provinces are left with zero. Usually meron yan. So it's either na baka nasa hospital or baka nasa health facility, depending on the stage of what the funding is for that particular local investment plan. So checkin namin and we will report back to
Yes,
this.
Mrs. Secretary, please give that information to the congressman.
Pakicheck.
Thank you, Mr. Chair. I will, Madam Chair, that I greatly appreciate that. Kasi po, alam niyo naman po, pag ano talaga may emergency, lalo na po sa mga barangay, no, mga maliliit na barangay, maliliit na mga munisipyo, ito po talagang mga barangay health station ang ating mga nilalapitan. Kaya po sana kung mabigyan po sila ng pondo at also sapat na pondo para makabili sila ng mga equipment. Yun lang po naman, Madam Chair. Maraming salamat po.
Thank you. Thank you. The next interpellate is Deputy Majority Leader J.J. Suarez.
Thank you very much, Madam Chairman. Earlier today, I think I came across an article that's very close to my heart, which was the first 1,000 days. I think it came out in the newspapers today. It was something that I implemented as governor of Quezon Province, and we came out with fantastic results. In fact, we tested children when they were age 5 after going through the first 1,000 days interventions implemented by the province then when I was governor. And kids performed remarkably better using the ECCD scorecard. So my question is, Sec, I just wanted to know how the DOH, a lot of familiar friends are here, people who helped me along the way when I was governor. Who will be the office that will be tasked to implement this program, and what will be the specific role that DOH will play, and if there are other agencies and departments that are converging towards this program?
Thank you very much, Madam Chair, Your Honor. Yes, the first 1,000 days is still is a very good program. In fact, the idea that our IQ is getting low was attributed to the fact that our malnutrition program was addressed at the wrong time, huli na. And you addressed it right. Because if we feed the mother correctly, the pregnant mother, the fetus will grow well. And at birth, if you are doing mandatory breastfeeding and you give the micronutrients, the brain will develop well. And it's usually in the first 1,000 days or the first 2 years of life na the brain develops. After that, may stunting na ng brain. So tama yun, talagang it has good effects later on at school. Our program for this is headed by Asek Apet Dayang Hirang, who is the Executive Director of the National Nutrition Council. Ako po yung chair ng National Nutrition Council, and we have a governing board of different agencies. Katulong po natin dito ang Department of Science and Technology with the FNNI, ang DSWD for the tunuhog na namin with the food stamp program, and then the Department of Agriculture to provide the nutritious food for our citizens, and also our DILG, which will implement in the local chief executives. Sila talaga yung magpapatakbo nitong programa nito. Pero full support kami dito. In fact, yung food stamps, kami na magpoponda pagka pregnant at lactating mother. So, and then all the under 2, and then we promise to actually make sure all the nutrition specific, kasi may nutrition specific yung pagkain at nutrition, at merong nutrition sensitive. Ito yung making sure na vaccinated yung bata, hindi siya mamamatay of vaccine preventable diseases. Yung tubig na iniinom niya ay walang diarrhea or E. coli or hindi magkaka-cholera. So making sure the local government units will help us do the safe water. And then we recently launched the PPAN, the Philippine Plan of Action for Nutrition. This is a 5-year plan, and this is the idea, kasama dito yung first 1,000 days and all other nutrition programs in different life stages. Thank you, Madam Chair.
Thank you very much, Madam Chair. Also, I just wanted to ask, yung maternal package ng PhilHealth, in-expand na rin po ba nila to para sa pregnant women?
PhilHealth?
Madam Chair, can I request Doc Ish to answer the question, please?
Go ahead, PhilHealth. Madam Chair, we already have the maternity care package, and this would involve a package for the hospital, and we also have a package for the maternity care clinics na outside the hospitals po. So the maternity care clinics